to welcome you all beautiful ladies to our very own rice ball of Karnataka. We hope you had a pleasant journey to Gangavathi, and we intend to make your stay here even more memorable.
Without wasting much more time. Without wasting much more time, let us kickstart our program by Srimati Sujata Srinivaslu ma'am. Over to you, madam.
Prathama pranama smarisuve ninnaya divyanama Vigneshwara ninage prathama pranama smarisuve ninnaya divyanama Vigna vinashaka buddhi pradayaka Vidyaya nido Shri Varadayaka Vigna vinashaka Buddhi pradayaka Vidyaya nido Shri Varadayaka Charana kamala ninna poojipe anudina pavanagoliso ಈ ಶಾಂತಿ ಧಾಮ ಪಾವನಗೊಳಿಸೋ ಈ ಶಾಂತಿ ಧಾಮ ವಿಘ್ನೇಶ್ವರ ನಿನಗೆ ಪ್ರಥಮ ಪ್ರಣಾಮ ಸ್ಮರಿಸುವೆ ನಿನ್ನಯ ದಿವ್ಯನಾಮ ಗಂಗಾಧರ ಸುತ ಚಂದ್ರ ಸುಧಾಕರ ಗಂಗಾಧರ ಸುತ ಚಂದ್ರ ಸುಧಾರಕ ಮಂಗಳಗೊಳಿಸೋ ಶುಭಕಾರಕ ಮಂಗಳಗೊಳಿಸೋ ಶ್ರೀ ಶುಭಕಾರಕ ಭವಸಾಗರವನು ದಾಟಲು ಅನುದಿನ ಭವಸಾಗರವನು ದಾಟಲು ಅನುದಿನ ಸಾಧನ ವೇತಕ ತಾರಕ ನಾಮ ಸಾಧನ ವೇತಕ ತಾರಕ ನಾಮ ವಿಘ್ನೇಶ್ವರ ನಿನಗೆ ಪ್ರಥಮ ಪ್ರಣಾಮ ಸ್ಮರಿಸುವೆ ನಿನ್ನಯ ದಿವ್ಯನಾಮ ಸ್ಮರಿಸುವೆ ನಿನ್ನಯ ದಿವ್ಯನಾಮ ಸ್ಮರಿಸುವೆ ನಿನ್ನಯ ಈ ದಿವ್ಯನಾಮ. Thank you.
The backbone of this conference, Dr. Sulochana Chinivalar ma'am, on the stage.
I Lakkol sir on the stage.
Now I request our IMA KSP WDW Chairman, Dr. Manpreet Kaur ma'am, to please come onto the dais.
I request Dr. V.V. Chinivalar, President-elect, IMA Karnataka State, to please come over to the stage for the inauguration ceremony. The plants, a gesture of giving life to life. Thank you. I request our dignitaries to be seated in the front.
Now, without wasting much time, let us dwell into the scientific session. The first session's talk is on mental health and its importance by Dr. Vinaya Prabha Baliga. For this first, I welcome the chairpersons for this talk, Dr. Sumati Gowda. Sorry, for the chairpersons for this is Dr. Shashikala Hosamani, consultant pediatrician at Shobha Nursing Home. And she is the president of W. Shelagi. She is pediatrician at Siddheshwara Nursing Home, Gangavathi. Please come onto the stage. The chairpersons, Dr. Shashikala Hosamani and Dr. Manjula Shelagi. Women are continuously multitasking. Today, it's time to remind ourselves that it's okay to not be okay. Our mental health should be our priority. It's not a luxury. I call upon our esteemed speaker, Dr. Vinaya Prabha Baligar ma'am, to enlighten us more on this topic. I request Dr. Sumati Gowda to introduce her, and I request Dr. Anita Shashidhar to escort madam onto the stage. Dr. Vinaya Prabha. I now ask Dr. Sumati Gowda to introduce her. Thank you, ma'am.
Good morning, everyone. I'm happy to introduce Dr. Vinaya Prabha. She is a psychotherapist by profession. She holds a doctorate degree from Delhi University. She was one of the first therapists in India to offer online counseling. She initially worked as a banker for 3 years and later quit to do her passion, her PhD in counseling psychology. She has been a visiting professor at management institutes and conducts soft skills training for the corporates and individual groups. She started Vistara, a trust working in the area of women empowerment.
Let the speech be for 20 to 25 minutes and the interactive session is for 5 minutes. Please try to maintain the timing for the safe progress of all the things. Thank you.
Thank you so much for the warning that I should not take too long. All right. Dr. Shivkumar Lakkol. Sorry. Yeah. Dr. Vijay Sarthi, Dr. Manpreet Kaur, Dr. Sulochana, friends. It gives me great pleasure to be amidst all of you today on the occasion of the Karnataka State Women Doctors Wing Conference, Anjana 2023. I am speaking on mental well-being and its importance. My desire is not only to address and inform all of you about this topic, but through you to reach out to thousands of other women and families. For many years, the medical emphasis on the holistic perception of the individual patient and use of a combination of therapies and lifestyle changes to treat the whole person. Now, it's no longer, just disease management, but we talk about disease reversal as well as creation of health. After COVID-19, it has been increasingly realized that the emotional, psychological, and social aspects of health are as important as the physical aspects, and that each of these are interdependent and have an influence on each other. COVID-19 brought to the forefront many changes, challenges, stressors, and uncertainties of life for all of us. The medical profession was especially impacted by it. Now, when you look at the challenges that it has brought about, we say that medicine is a very noble profession. It is. You're dealing with the life of a person, and it is simultaneously associated with a high degree of personal and professional satisfaction. But at the same time, there is a high degree of occupational stress and burnout. You doctors are exposed to human suffering and death. You take care of people's lives, and mistakes can sometimes be costly and sometimes irreversible. So how healthy are the doctors themselves? We talk a lot about doctors heal yourself, but how healthy are you? So I looked at various studies, and it was found that a study conducted under the guidance of the Indian Medical Association in 2022 showed that a significant number of doctors in India, approximately 82.7%, experienced stress. According to our 2022 online survey, stress levels as perceived by doctors in India was 61.43%, with 2/3 due to the professional stress and 1/3 due to domestic stress. In addition to mental health challenges, of course, you face a lot of physical health stress also, with irregular sleeping hours, excessive work, and then compromised immune function, lack of time for self-care activities, etc. Surprisingly, it was also found that doctors are expected to live longer because you have all the information about health, about how to stay fit and healthy. But it has been found that despite this, heart disease and cancer is swiftly rising amongst doctors. Another very disturbing trend is doctors committing suicide. A 10-year-long study conducted by IMA Kerala, in which 10,000 doctors were interviewed, it was found that stress is a major contributor of early deaths, followed by lack of periodic health checkups. We are all normal people. I mean, outside the medical profession, we're told to get periodic health checkups. Annual checkups are mandatory, but doctors themselves don't follow it. Medical profession leads the list of occupations with the highest rate of suicide rate, and two root causes of this is stress and depression. Doctors in developing countries are reported to have high grades of anxiety and depression. Suicide is preventable, and all that it requires is that they should not only have the regular medical checkups, but also deal with the stress that they undergo in their profession. I also looked at specifically about women doctors. What is the problem? What is the stress that they face? There are not many studies, but a survey conducted on women obstetricians and gynecologists in Coimbatore, Tamil Nadu, in the age group of 29 to 55 years, indicated that the majority of the doctors experience moderate to high levels of stress. Another study conducted on over 500 doctors in India showed that 65% of doctor mothers, experienced burnout while trying to balance their personal and professional lives. So apart from taking care of physical health, mental well-being is very important. What exactly is mental well-being? Is it just that you don't have any severe clinical syndromes? Or what does it mean by, what do I mean by mental well-being? WHO defines mental health as mental well-being in which an individual realizes his or her abilities, can cope with the normal stresses and uncertainties of life and navigate life challenges, can work productively and efficiently, make and keep good relationships with people, and also able to contribute to community. So mental well-being includes psychological, emotional, and social well-being, and it contributes to overall well-being of the person. It, of course, helps to combat various, you know about psychosomatic diseases, it also helps to combat psychosomatic diseases and heart disease, BP, etc. Psychologically, it leads to an enhanced self-image, balanced in thoughts, emotions, and behavior, reduces anxiety, etc. Now, there is a relationship between mental health and physical health. As you know, if you are depressed, you're not going to take good care of yourself. And vice versa, if people are having continuous diseases or chronic diseases, then again it can lead to a problem in their mental health in terms of anxiety, depression, and the whole well-being. So when we ask doctors, how do you take care of your mental health? Doctors in India have a common tale to tell. They say, where's the time for it? We're so busy in our profession, we've got so much of work stress. Who bothers about mental health? And that is the last priority for them. After working for so many hours, sometimes days straight on, they don't have time or energy to think about their own mental health. Depression, stress, burnout are terms which are common knowledge to doctors, but when it comes to their own selves, it is sidelined. The patient, their work takes priority. And to add to this, there's not much research being done, nor is there any existing literature on the psychological problems of doctors. and there's no specific channel or arrangement or a program for doctors and medical professionals to talk about their mental health and well-being. Hardly any training is given to doctors in managing their emotional well-being. What are the stresses faced by women doctors? Now, in this scenario, what are the stresses faced by women doctors, which is unique to them, not only because they're women, but they're also doctors. Now, it has been found that they could face gender bias and discrimination at work and also in the family. Many juggle between professional responsibility with family and caretaking roles. Outside, they have an elevated higher status as doctors, a noble profession. But within the family, they may not be given that much of importance. Now, I'm not saying it's true of everybody, but this is normally in majority of the cases. In fact, this brings to mind Indira Nooyi. When she became the president of PepsiCo, and she came home one day, and late at night after her work, her mother said, "You may be the president or whatever of PepsiCo, but when you come home, you are a wife and a mother and a daughter. Nobody can take your place. So leave that crown in the garage." So she had to go and fetch the milk, and she asked her mother, she said, "Why didn't you ask my husband?" She said, "He was too tired. She's come back after a whole day's work." And she said, "Why didn't you ask the help, the hired help?" She said, "I forgot." All right, so whatever it is, your domestic duties remain yours. So she says that our system, Indira Nooyi says, our system puts the career clock and the female biological clock in direct conflict. So even though women are employed outside their home, this neither relieves them of the domestic duties, nor does it significantly change their social position. Managing paid work and demands of unpaid work at home can cause feelings of loneliness, overwhelm, and stress. Do you think so, women? Doctors? You got a lot of support at home? Then it's fine. Women still perform most of the caring roles in the home. If anybody falls sick, there are seniors who are old age people, it normally falls on them to take care of them. Women have a higher mean level of internalizing disorders. You know, you tend to stuff your emotions. You do not express it as much as men do. Men have got the liberty to express their emotions outside to, maybe the job or to you or to, their colleagues. Their mental health concerns, women's mental health concerns are largely and frequently dismissed as being hormonal. Their expectation about what constitutes illness is gender biased. A gender bias more often than not ensures that the symptoms are taken less seriously than they are for men. How is this? How does it really come out in reality? So supposing it's a woman who is suffering from any illness, she is blamed rather than taken care of. She's told, "You don't take care of yourself. You don't eat on time, you don't exercise. You should learn to take care of yourself." Or she's ridiculed. "Oh, she's got a hormone problem. Oh, it's menopause, that's why she's got a problem." Sufferer is also told to get over it. No one can help you. You deal with it yourself. Or she's told to stop attention seeking and making a fuss instead of being told, "I'm there for you. If you need anything, I'm here." So women, especially those who have young children, don't have time to fall sick. So quickly pop a pill and carry on with their work. And they're told they're weak and lazy instead of being strong and courageous. It's also told that it's a choice rather than it can happen to anyone. That normally it is told that there is a problem with her choices, her lifestyle, her personality, rather than it's a problem to be addressed empathetically. So often the women professionals experience low levels of family support. If they do, they're very lucky, and they can do very well and balance their work as well as their home duties. Also, during their lifetimes, women are faced with various life stressors and major life transitions, which they have to handle along with everything else, like pregnancy, motherhood, caring and nurturing roles of tending to old and sick in the family, of course, falls to them. Sometimes they could be faced with emotional abuse like ridicule, humiliation, name calling, guilt. I heard about a woman doctor who committed suicide 2 years ago because of guilt. So these are emotions, negative emotions, which can add to all the other stresses that the women face. Also, there are various societal expectations that, she's got to be the perfect wife, the perfect mother, the perfect daughter-in-law, and expected to be more giving and sacrificing. Any adjustment or change to be made in her life, in the family, falls on the woman's shoulders. Now, especially for government doctors, I don't know how many of you are government doctors here, they have stresses unique to them too. So they have increased workload, maybe they don't have proper infrastructure, insufficient medical equipment, fear of transfers, they're forced to work in rural areas. Sometimes they may not be able to maintain work-life balance. They may have shortage of staff. All this adds to, their stress and, of course, tells on their mental well-being. So where do you store all these stresses? You can't express them, and there are no means in which you can go and express them. Where do you store it? Because most of the stresses, most of the emotions are stored in the body. You know that? Doctors, most of the stresses are stored in your body. Sometimes it is in the shoulders, so you have a stiff shoulder, a shoulder, which has gone frozen shoulder. You can store it in your chest. You can store it in your pelvis, in your legs, knee pain. This is where you store. And so what do you do? How do you get out of this? So whenever you feel any tension, just give yourself a shake and shake it off. Say to yourself that I choose not to have this tension in my body, to be embedded in your body. Would you like to do that? Shake it off? Why don't you shake? Just shake it off. All the tensions that you may have. In fact, stretching helps a lot. It helps to release the tension from your body. So, if anybody does yoga over here, Baddha Konasana and all those stretching exercises, as soon as you get up in the morning, what you can do is give yourself a good stretch. At the end of the day, shake off all the tension that you have taken on. Another thing that you can do is, you could write 3 of your worries on a piece of paper. Whatever is immediate, whatever is present for you at the moment. You have a garbage bin. Say, I release all these worries, tear it up and throw it into the garbage bin. Would you like to do that? No? Or would you like to do something else? Can you think of let's do a little exercise and see if it really works. Okay? Are you game? Are you game? Yeah? Okay. Think of something that is worrying you at the present moment. Something which is really bothering you. Close your eyes. Now put that worry into a balloon. Blow up the balloon. Tie it up. And let the balloon fly. Flies away from you. Watch it go away with all your worries. Watch it going over the horizon and it's gone. How do you feel? Do you feel good? No? You should do it a little more seriously, okay? Another thing is, we've just finished Ganesh Chaturthi. You know what is the significance of Ganesha coming to your home? Do you know why he comes there? Just so that we can have fun and enjoyment? No, he also comes to take away all your troubles. That's the reason when you're sending him away, you say, okay, Ganapati Bappa Moria, all right, but then please take away all our worries that we have had from the past 1 year. And then when you come back next year, we'll give you all our worries again. And he really does that. If you pray to him, he really will take away all your worries. So you immerse him in the water. In fact, what we psychologists say is that water is a great detox for you. So when you have your bath, you just imagine that all the worries and the tension in your body is just flowing away with the water. That's another exercise that you could do. Now, I specifically want to deal with burnout, because that has been found to be a major problem especially for women. And burnout is insidious. You'd hardly know that it's coming on, but it can have a lot of repercussions afterwards. So how do you know that you are in burnout? Burnout is emotional exhaustion amongst professionals, and it is a clinical syndrome. It is characterized by emotional exhaustion. You no longer, you feel tired, you no longer feel great emotions, you don't feel like giving anything to anyone, you feel exhausted emotionally. Also, it is characterized by depersonalization, that is, you have a lack of sympathy, empathy for patients, or being negative or cynical towards them. You have reduced personal accomplishment, that you feel that you're inadequate, feeling trapped, or a feeling of inner emptiness. So this can occur with individuals who are dealing with people in some capacity, and of course doctors experience burnout, and when they are in burnout, they can make poor decisions and have difficult relationships with people, and of course all the other things like sleep disturbance, depression, anxiety, and may also even want to quit. So supposing you find that one of your colleagues is isolating themselves, they're not able to interact with others, they've got strained relationships, they're developing an addiction, which is a maladaptive coping strategy. Some may even want to quit, or they're feeling hopeless and life is not worth living. That's a signal, a red signal. Please take them to a psychologist or a therapist. Now, what are the remedies for all this? I've explained a lot about what are the kind of stresses that you can go through, the pressure, and how prevalent it is amongst doctors. Because why I was very interested in talking to the doctors is because you have their outreach to many other people. If you know more about how mental health well-being can be addressed, then you can in turn pass it on to your patients, your families, and everybody else. Because the information about psychological treatment is much less. It's not as much as should be there. Doctors themselves feel a little hesitant to go and meet the psychiatrist or a counselor or a psychotherapist, because they think that everything can be made all right with just a pill. You have depression, take anti-anxiety or antidepressants. If you have any psychosomatic, everything can be dealt with pills. But it is not so. Anybody amongst over here who's a psychiatrist will be able to tell you that along with the drugs, you do need counseling, because we are not just a physical being. We are a thinking, feeling, behaving individual. And all these aspects have to be dealt with before any mental wellness can be brought about in an individual. So when stresses are mild, it's very easy. I mean, we have got lots of information about how to set your, this thing. Do I have 5 minutes? That's it? Can I go on? Yeah, okay. If you have mild stresses, that's fine. You know about it. You take rest and you eat properly. You see to that you get your diet all right. You have regular exercise and all the rest of it. But the psychological techniques, especially when it becomes a little more serious, you may think that why not just talk to another colleague? What's wrong with talking to a colleague See, psychotherapists are trained in psychological theory as well as a therapy. I'm trained in cognitive behavior therapy, that is basically looking at your belief system and your thinking patterns. If you go to a person and you talk to them about your problems, you could be ridiculed, you could be judged, you could also find that have told them may come back to you in a gossip form later. So confidentiality is very important for us. It's ethics that we follow. So, and we do not give advice. It's very easy to go to a doctor, to a colleague and say, you know what, I'm feeling tired. They'll say, oh, you know what, you should rest, you should do this, you should do that. But when you come to a psychologist, we basically go behind that and find out what are your capabilities that you can use, what are the solutions that you can come out with to deal with your problem. A lot of lack of awareness is there also about the psychological techniques that we use. What are the problems that you can go to a psychologist? Right from small things like coping with work challenges with colleagues, to emotional health, to the various clinical syndromes like post-traumatic stress, depression, loneliness, listlessness, and so there are various things. Now, when you come to a counselor, it's objective. See, we don't have anything to do with you. So we're here to help you out, to find out the capabilities and the strengths that you have to be able to handle and come to a solution in yourself for a problem that you have. All right. Some of the things that we can. What are the things? I mean, I don't tell you only about meditation and all that, but one example I'll give you about cognitive therapy, a belief. Okay? Some of you may say that you may be using a dysfunctional belief system like mind reading. I know what you're thinking of, because I think that this is what you're thinking of. You don't have any information about what that person is thinking. So how do you know? Or some people say that, they generalize from one instance to the whole. So supposing you have misdiagnosed one patient's problem, okay? And you generalize and you label yourself as a failure. And you generalize it to, I can't do well in my work. Or you catastrophize, you think of the worst case scenario. All these are dysfunctional thinking patterns. And so in cognitive therapy, you examine the beliefs and we tell you how to set it right. Now, before I end, I want you to all think of an easy way to keep yourself mentally well. All of you hug yourselves like you would hug a child. Okay? Hug yourselves like you would hug a child. Close your eyes. Just look down like as though you're looking at your own heart. And tell to yourself, I love myself very much. I am my best friend. I will always support you. You can open your eyes. So this is a very simple thing that you can do to just make yourself feel good anytime. And nobody need know. You can just hug yourself. Nobody will know what you're saying to yourself, right? So whatever you say to yourself should be positive. And look out for that. The bell has rung, so I can't speak anymore. But anything else that you would like to ask me? Any questions that you would like to ask me? I think I have 5 minutes. You can ask. Yeah.
Problems more compared to men.
Yeah.
Is it, I think, is it same as saint syndrome?
Saint, is it?
Saint, Santa.
Okay. Now, supposing you're feeling guilty, you're feeling angry, what do? Do you express it to anybody? You say, no, you samjawfy with yourself and say, no, it's okay, it's all right, let them do it. I should be better, I should be more forgiving, and you internalize it. And that internalization, you see, emotion is an energy. And if you internalize it, it creates problems in your body. A saint, on the other hand, is a person who has risen above all emotions. I don't think many of us have gone there.
Any more questions?
Excellent talk, madam. You talked of Indra Nooyi. Definitely in that she has told we have to learn coping up mechanism because that's very important. We can't...
See, what is perfection? Perfection is defined by somebody else. And when somebody else defines who you should be, they can always raise the expectations. But supposing you define for yourself what is okay with you, realizing that you're just a normal human being, then you're going to be less punishing towards yourself. And the second thing, very well said, is that yes, especially if you're professionals, you do need that support. You do need to delegate, time manage, okay? Also find out people who can support you in your work as well as at home.
Small question. As new mothers, women being doctors, we tend to feel more guilty And when we are around other women, they make us feel more guilty that we are not tending to our kids or whenever we try to balance. So how to overcome that?
And all these emotions, we internalize them. Guilt is what? It's a totally useless emotion. Okay? What is the guilt about? That you're not a good mother? Yeah? You compare. Oh, she's doing better, she's doing... Everybody does to the extent that they know how and how much ever they can. All right? And this whole thing about comparing to each other is the worst thing that you can do to yourself. Because all of us are unique individuals. How can you compare apples and mangoes? All right? And each one, see, no mother purposely tries to do harm to their child or to their family. Because, we Indian mothers are not like that. So when you are good, all that you say is, I am the best. I don't need to do anything else. So, what you need to do is go to the mirror every morning and say to yourself, I am the best. I am fine. I am taking good care of my children or whatever to the best of my ability, and this is the best I can do. And it's fine. It's totally fine. Guilt is a useless emotion. Never go that way.
Good morning, everyone. Very nice topic. At the same time, I thank the organization who has selected this topic. Very informative. Very nice messages Madam has given. Don't run behind perfection. Don't collect and store the stress. And she has also told, and we forget. So let us make up our mind to follow all the remedies given by Madam Baligar. Thank you.
The need of the hour. Now I request Dr. Vinaya Madam to please accept a small token of appreciation from our side. Made products made by all our Maitris. You can just take a walk there and see what all they did. Really, you'll be surprised by all the wonderful and creative work they did. And the second stall is Banana Handicraft Stall, which they include all the sustainable, eco-friendly products like banana fiber bag.
Senior obstetrician and gynecologist at Kottareshwara Nursing Home, Koppal, and Kottareshwara MRI Scan Center, Gangavathi. Welcome, madam. I would like to invite Dr. Padma B. Patil, practicing obstetrician and gynecologist at Annadaneshwara Nursing Home, Sindhanur. We welcome you, madam. They are made through all the furies that life has thrown on them. They are strengthened by the fire they had to walk through. Dear fearless woman, you are your own story. To get to know more about this fearless woman, let us call upon stage one such we all know, Dr. Shilpa Diwatar Madam. I request Anita Madam to escort. I request Dr. Meda Mallan Gowda, consultant gynecologist practicing at Mallikarjuna Multi-Speciality Hospital, Gangavathi, to introduce our speaker to our delegates. Thank you, ma'am.
It gives me immense pleasure to introduce my dearest friend, Dr. Shilpa, Women Empowerment, and also holds an LLB degree. She has almost 15 years of teaching experience. She always had a vision and a fire in her heart to help people and make people smile. She heads an NGO called EDGE, which aims at empowering women and making women self-sufficient. With even more determination to make women financially independent, she has also started a self-help group program at state level. Over to you, Dr. Shilpa.
Thank you, madam. Good morning, all. Dear fearless and empowered women. So, ivattu nanna topic. So, what is fear? I don't believe in, yaru believe madala, fearlessness annadu illa. What is fear? Fear annadu ellarallu nide. I am live example. Right now I am feeling very fear. ಯಾಕಪ್ಪ ಅಂತಂದರೆ ಐ ಹ್ಯಾವ್ ಅ ಸ್ಟ್ರೆಸ್. ಯು ಆರ್ ಆಲ್ ಎಂಪವರ್ಡ್ ವುಮನ್, ದೊಡ್ಡ ದೊಡ್ಡ ಡಾಕ್ಟರ್ಸ್ ಇದ್ದೀರಿ, ಇಂಟೆಲೆಕ್ಚುವಲ್ಸ್ ಇದ್ದೀರಿ, ಎಲ್ಲರೂ ಇದ್ದೀರಿ. ಐ ಆಮ್ ಫೀಲಿಂಗ್ ದ್ಯಾಟ್ ನಾನು ಭಾಳ ಚಿಕ್ಕವಳು ನಿಮ್ಮ ಮುಂದೆ ಮಾತಾಡಲಿಕ್ಕೆ ಅಂತ ಹೇಳಿ ರೈಟ್ ನಾವು ಆಲ್ಸೋ ಮೈ ಹ್ಯಾಂಡ್ ಈಸ್ ಶೇಕಿಂಗ್ ಹಿಯರ್, ಧಕ್ ಧಕ್ ಅಂತ ಇದೆ. ಏನು ಮಾತಾಡಬೇಕಪ್ಪ ಅಂತ ಹೇಳಿ, ಬಿಕಾಸ್ ಆಫ್ ಮೈ ಫಿಯರ್ ಐ ಕಾಂಟ್ ಸ್ಟೆಪ್ ಬ್ಯಾಕ್. ಇಫ್ ಐ ವುಡ್ ಹ್ಯಾವ್ ಸ್ಟೆಪ್ ಬ್ಯಾಕ್ ಅಲ್ಲ, ಐ ಡಿಂಟ್ ಹ್ಯಾವ್ ಗಾಟ್ ಆನ್ ಅಪಾರ್ಚುನಿಟಿ ಟು ಮೀಟ್ ಸಚ್ ಅ ಬ್ಯೂಟಿಫುಲ್ ಎಂಪವರ್ಡ್ ಫಿಯರ್ಲೆಸ್ ವುಮನ್ಸನ್ನು ಮೀಟ್ ಮಾಡುವಂಥ ಗೋಲ್ಡನ್ ಅಪಾರ್ಚುನಿಟಿ ನನ್ನ ಲೈಫ್ ಒಳಗೆ ಮಿಸ್ ಮಾಡಿಬಿಡ್ತಿದ್ದೆ. ಸೊ ಐ ಹ್ಯಾವ್ ಫೇಸ್ಡ್, ನನ್ನ ಕರೇಜನ್ನೆಲ್ಲ ನನ್ನ ನೈಟಿನಿಂದ ಐ ಹ್ಯಾವ್ ಗ್ಯಾದರ್ಡ್ ಆ್ಯಂಡ್ ಐ ಸ್ಟ್ಯಾಂಡ್ ಬಿಫೋರ್ ಯು. ಯಾಕಂದರೆ ವುಮನ್ಸಿಗೆ ಲಾಟ್ಸ್ ಆಫ್ ಸ್ಟ್ರೆಸ್ ಇರ್ತದೆ. ಅವ್ರ ಸ್ಟ್ರೆಸ್ ಏನಿರ್ತದಲ್ಲ ಫಿಯರಾಗಿ ಕನ್ವರ್ಟ್ ಆಗ್ತದೆ. ಯಾಕಪ್ಪ ಅಂತಂದರೆ ವಿ ಹ್ಯಾವ್ ಲಾಟ್ಸ್ ಆಫ್ ಸ್ಟ್ರೆಸ್. ಏನದು ಸ್ಟ್ರೆಸ್ಸು ಅಂತಂದರೆ ಮೇನ್ ಥಿಂಗ್ ಅವರ್ ಪ್ರೆಸೆಂಟಬಿಲಿಟಿ. ವಿ ಆರ್ ವೆರಿ ಕಾನ್ಷಿಯಸ್ ಅಬೌಟ್ ದ ಪ್ರೆಸೆಂಟಬಿಲಿಟಿ. ನಮಗೆ ನಮ್ಮ ಡ್ರೆಸ್ಸು, ನಮ್ಮ ಜ್ಯುವೆಲ್ರಿ, ನಮ್ಮ ಮೇಕಪ್ಪು, ಫೇಸು, ಎವ್ರಿಥಿಂಗ್ ಶುಡ್ ಬಿ ಇನ್ ಅ ಪ್ರೆಸೆಂಟಬಲ್ ಮ್ಯಾನರ್ ಆ್ಯಂಡ್ ಅಪ್ರಿಷಿಯೇಬಲ್ ಮ್ಯಾನರ್ ಅನ್ನೋದು ಭಾಳ ಇರ್ತದೆ. ಅದು ಇಟ್ಸ್ ಅ ಸ್ಟ್ರೆಸ್. ಆ ಸ್ಟ್ರೆಸ್ ಏನಿದೆ ಅಲ್ಲ ನಮ್ಗೆ ಫಿಯರ್ ಆಗಿ ಹಿಂಡರೆನ್ಸ್ ಆಗಿ ತೊಗೊತದೆ. ಸೊ ಅದನ್ನು ನಾನು ಮತ್ತು ಅಬೌಟ್ ಅವರ್ ನಾಲೆಜ್ ಆ್ಯಂಡ್ ಎಕ್ಸ್ಪ್ರೆಷನ್, ಸೊ ಅದನ್ನು ನಾನು ಏನು ಮಾಡಿದೆ, ಸ್ವಲ್ಪ ಲೈಟಾಗಿ ಸ್ಟೆಪ್ ಬ್ಯಾಕ್ ಮಾಡಿಕೊಂಡು ಲೆಟ್ ಇಟ್ ಬಿ. ನಾನು ಒಬ್ಬ ಸಾಮಾನ್ಯ ಹೆಣ್ಮಗಳಾಗಿಯೇ ಡೆಲಿಗೇಟ್ಸ್ ಮುಂದೆ ಐ ಆಮ್ ನಾಟ್ ಎ ಡೆಲಿಗೇಟ್ ಹಿಯರ್. ನಾನು ಸಾಮಾನ್ಯ ಹೆಣ್ಮಗಳು, ಅಸಾಮಾನ್ಯರ ಮುಂದೆ ಮಾತಾಡುವಂಥ ಗೋಲ್ಡನ್ ಅಪಾರ್ಚುನಿಟಿ ನನಗೆ ಸಿಕ್ಕಿದೆ ಅಂತ ಹೇಳಿ ಐ ಆಮ್ ವೆರಿ ಮಚ್ ಹ್ಯಾಪಿ. ಸೊ ಇದಕ್ಕೆ ಇನ್ನೊಂದು ಫಿಯರ್ಲೆಸ್ ಅಪಾರ್ಚುನಿಟೀಸ್ ಕ್ರಿಯೇಟ್ ಮಾಡಿದವರು ಅಂತಂದರೆ ಅವರ್ ಆರ್ಗನೈಸರ್ಸ್. ಅವರಿಗೇನು ಫಿಯರ್ ಇತ್ತು, ದೇ ಹ್ಯಾವ್ ಆಲ್ಸೋ ಫಿಯರ್. ಯಾಕಂದರೆ ಇಟ್ಸ್ ನಾಟ್ ಅ ಸಿಂಪಲ್ ಥಿಂಗ್ ಟು ಆರ್ಗನೈಸ್ ಸಚ್ ಅ ಸ್ಟೇಟ್ ಲೆವೆಲ್ ಕಾನ್ಫರೆನ್ಸಸ್. ಫಸ್ಟಿಗೆ ಆ ಪ್ರಪೋಸಲ್ ಬಂದಾಗ ಅವರೆಲ್ಲರೂ ಭಾಳಷ್ಟು ವಿಚಾರ ಮಾಡಿದರು. ವೈ ಟು ಟೇಕ್ ಸಚ್ ಅ ರಿಸ್ಕ್, ಯಾಕೆ ಬೇಕು? ಯಾಕಂದರೆ ಅಲಾಂಗ್ ವಿತ್ ದೇರ್ ಆಲ್ ದ ರೆಸ್ಪಾನ್ಸಿಬಿಲಿಟೀಸ್ ಅಲ್ಲ, ಇಟ್ಸ್ ಅ ಗ್ರೇಟ್ ಟಾಸ್ಕ್. ಇಟ್ ನೀಡ್ ಲಾಟ್ಸ್ ಆಫ್ ಎಫರ್ಟ್ಸ್ ಬೇಕು, ಎನರ್ಜಿ ಬೇಕು, ಟೈಮ್ ಬೇಕು. ಸೊ ವೈ ಟು ಪುಟ್ ಅದನ್ನೆಲ್ಲ ಯಾಕೆ ಇದರಲ್ಲಿ ಹಾಕಬೇಕು ಅಂತ ಹೇಳಿ ಅವ್ರಿಗೊಂದು ಥಾಟ್ ಬಂತು. ಬಟ್ ಸ್ಟಿಲ್ ಆ ಥಾಟ್ ಫಿಯರ್ ಆಗಿದ್ರೂ ಸಹಿತ ದೇ ಹ್ಯಾವ್ ಫೇಸ್ಡ್ ಆ್ಯಂಡ್ ಆರ್ಗನೈಸ್ಡ್ ಸಚ್ ಅ ಬ್ಯೂಟಿಫುಲ್ ಒಂದು ಕಾನ್ಫರೆನ್ಸ್ ಆರ್ಗನೈಸ್ ಮಾಡಿದ್ದಾರೆ ಅಂತಂದರೆ ವಿ ಆಲ್ ಗಾಟ್ ದ ಅಪಾರ್ಚುನಿಟೀಸ್ ಟು ಕಮ್ ಫ್ರಮ್ ದ ನೂಕ್ ಆ್ಯಂಡ್ ಕಾರ್ನರ್ ಆಫ್ ದ ಸ್ಟೇಟ್ ಆ್ಯಂಡ್ ಗ್ಯಾದರ್ ಹಿಯರ್ ಆ್ಯಂಡ್ ಟೇಕ್ ದ ಬ್ಲೆಸ್ಸಿಂಗ್ಸ್ ಆಫ್ ದ ಆಂಜನೇಯ. ಅಂಜನಾದ್ರಿ ಈಸ್ ಅ ಗ್ರೇಟ್ ಪ್ಲೇಸ್, ವಿ ಆಲ್ ನೋ. ಸೊ ಅದಕ್ಕೆ ನಮ್ಮ ಆರ್ಗನೈಸರ್ಸ್ದು ಒಂದು ಫಿಯರ್ಲೆಸ್ ಸ್ಟೆಪ್ ಹ್ಯಾಸ್ ಕ್ರಿಯೇಟೆಡ್ ಎ ಲಾಟ್ಸ್ ಆಫ್ ಅಪಾರ್ಚುನಿಟಿ ಆ್ಯಂಡ್ ಐ ಹ್ಯಾವ್ ಟೇಕನ್ ದ್ಯಾಟ್ ಫಿಯರ್ಲೆಸ್ ಸ್ಟೆಪ್ ಆ್ಯಸ್ ನನ್ನದೊಂದು ಇನ್ಸ್ಪಿರೇಷನ್ ಅಂತ ತೊಗೊಂಡಿದ್ದೀನಿ. ಅದಕ್ಕೆ ದ ಪ್ರೆಸೆಂಟ್ ಪ್ರೆಸಿಡೆಂಟ್ ಆ್ಯಂಡ್ ದ ಪಾಸ್ಟ್ ಪ್ರೆಸಿಡೆಂಟ್ಸ್ ಆಲ್ಸೋ ಇನ್ಸ್ಪೈರ್ಡ್ ಮೀ ಅ ಲಾಟ್ ಅಂತ ಹೇಳಿ ಐ ವಿಲ್ ಜಸ್ಟ್ ಸ್ಟಾರ್ಟ್ ವಿತ್ ಮೈ ಟಾಕ್. ಸೊ ಇಲ್ಲಿ ಒಂದು ಸ್ಲೈಡ್ ಕಾಣ್ತಾ ಇದೆ. ಆ ಸ್ಲೈಡ್ ನೋಡಿದರೆ ನನಗೆ ಒಂದು ಸಣ್ಣ ಸ್ಟೋರಿ ನೆನಪು ಬರ್ತಾ ಇದೆ. ಒಂದು ಸಣ್ಣ ಎಲಿಫೆಂಟ್ ಇತ್ತು. ಆ ಸಣ್ಣ ಎಲಿಫೆಂಟನ್ನು ತೊಗೊಂಡು ಬಂದುಬಿಟ್ಟು ಹಗ್ಗದಿಂದ ಟೈ ಮಾಡಿರ್ತಾರೆ. ಸಮಯ ಹೋದಂಗೆ ಆ ಎಲಿಫೆಂಟು ದೊಡ್ಡದಾಗ್ತದೆ, ಅದರ ಹಗ್ಗ ಸಣ್ಣದಾಗ್ತದೆ. ಆದರೂ ಸಹಿತ ಆ ಎಲಿಫೆಂಟು ಅದೇ ಒಂದು ಹಗ್ಗಕ್ಕೆ ಟೈ ಮಾಡಿ ಅಲ್ಲೇ ಇರ್ತದೆ. ಏನಿದ್ರ ಅರ್ಥ? ಇದರ ಅರ್ಥ ಏನಪ್ಪ ಅಂತಂದರೆ, ನಾವು ಚಿಕ್ಕವರಿದ್ದಾಗ ನಮಗೆ ಏನೋ ಒಂದು ಹಿಂಡರೆನ್ಸ್ ಇರ್ತದೆ. ಇಟ್ ಹ್ಯಾಸ್ ಬಿಕಮ್ ಲೈಕ್ ಅ ರೋಪ್, ಇಟ್ ಹ್ಯಾಸ್ ಟೈಡ್. ಟೈಮ್ ಪಾಸ್ ಆದಂಗೆ ಆ ರೋಪ್ ಸಣ್ಣದಾಗ್ತದೆ, ನಾವು ದೊಡ್ಡವರಾಗ್ತೀವಿ. ಬಟ್ ವಿ ಡೋಂಟ್ ರಿಯಲೈಸ್ ದಟ್ ರೋಪ್ ಆಫ್ ಫಿಯರ್ ಹ್ಯಾಸ್ ಬಿಕಮ್ ವೆರಿ ಲೆಸ್ ಸ್ಮಾಲರ್ ದ್ಯಾನ್ ಮೀ ಅನ್ನೋದು ನಮಗೆ ಯಾವತ್ತೂ ರಿಯಲೈಸ್ ಆಗೋದಿಲ್ಲ. ಸೊ ವಾಟ್ ಈಸ್ ಫಿಯರ್? ಫಿಯರ್ ಅಂತಂದರೆ ಇಟ್ಸ್ ಅ ಕಂಫರ್ಟ್ ಝೋನ್. ನಮ್ಮದು ಒಂದು ಕಂಫರ್ಟ್ ಝೋನ್. ಐ ಟ್ರಾವೆಲ್ ಗಂಗಾವತಿಗೆ ಟ್ರಾವೆಲ್ ಮಾಡ್ತೀನಿ, ಐ ಟ್ರಾವೆಲ್ ಟು ಸಿಂಧನೂರ್ ಆಲ್ವೇಸ್. ಅದೇ ನನಗೆ ಬೇರೆ ಸ್ಟೇಟಿಗೆ ಹೋಗೋದು ಬಂತು, ಆಂಧ್ರ ಪ್ರದೇಶ, ತಮಿಳ್ನಾಡು, ಕಾಶ್ಮೀರ್ಗೋ ಇಫ್ ಐ ವಾಂಟ್ ಟು ಟ್ರಾವೆಲ್ ಅಂದಾಗ ಐ ಗೆಟ್ ಸಮ್ ಫಿಯರ್. ಯಾಕಪ್ಪ ಅಂತಂದರೆ ನಮಗೆ ಯಾವಾಗ ಫಿಯರ್ ಆಗ್ತದೆ? ವೆನ್ ವಿ ಗೆಟ್ ಫಿಯರ್ ವೆನ್ ವಿ ಡೋಂಟ್ ನೋ ದ ಥಿಂಗ್ಸ್. ನಮಗೆ ಎರಡೇ ಟೈಮಲ್ಲಿ ಫಿಯರ್ ಆಗ್ತದೆ. ಒಂದು, ನಮಗೆ ಯಾವ ವಿಚಾರದ ಬಗ್ಗೆ ಗೊತ್ತಿರೋದಿಲ್ವೋ ಅದ್ರ ಬಗ್ಗೆ ಭಯ ಆಗ್ತದೆ. ಇನ್ನೊಂದು ಏನಪ್ಪ ಅಂತಂದರೆ ಪಾಸ್ಟ್ ಎಕ್ಸ್ಪೀರಿಯನ್ಸಸ್, ನಮ್ಮದು ಬಿಟರ್ ಎಕ್ಸ್ಪೀರಿಯನ್ಸಸ್ ಏನಿರ್ತೈತಲ್ಲ ಅದು ಎರಡೇ ಫಿಯರ್ ಇರ್ತದೆ ನಮಗೆ. ಸೊ ನಮಗೆ ಫ್ಯೂಚರ್ ಅನ್ನೋನ್ ಥಿಂಗ್ಸೂ ಬಾದರ್ ಮಾಡೋದಿಲ್ಲ, ಪಾಸ್ಟೂ ಬಾದರ್ ಮಾಡೋದಿಲ್ಲ. ಅದು ಏನು ಬಾದರ್ ಮಾಡ್ತದೆ ಅಂತಂದರೆ ಅದು ನಮ್ಮ ಮೈಂಡ್ ಸೆಟ್ ಬಾದರ್ ಮಾಡ್ತದೆ. ಸೊ ದೆರ್ ಈಸ್ ನೋ ಕಾನ್ಸೆಪ್ಟ್ ಲೈಕ್ ಫಿಯರ್ಲೆಸ್ನೆಸ್ ಅನ್ನೋ ಕಾನ್ಸೆಪ್ಟ್ ಇಲ್ಲ. ಮತ್ತು ಫಿಯರಿಗೆ ಡೋಂಟ್ ಹ್ಯಾವ್ ಡೆಫಿನಿಷನ್ ಅನ್ನೋದಿಲ್ಲ. ವಾಟ್ ಈಸ್ ಫಿಯರ್? ಸಂಬಡಿ ಲಿಜಾರ್ಡ್ ನೋಡಿ ಹೆದರ್ಬೋದು, ಕೆಲವೊಬ್ಬರು ಸಿಂಹನ್ ನೋಡಿದರೂ ಹೆದರದೇ ಇರ್ಬೋದು, ಆರಾಮಾಗಿ ಹೋಗಿ ಫೋಟೋ ತೆಗೆಸ್ಕೋಬೋದು. ನಾವು ಏನು ನಮ್ಮಲ್ಲಿ ಕಂಫರ್ಟ್ ಝೋನ್, ಈ ಆನೆ ತನ್ನ ರೋಪಿನ ಸುತ್ತಮುತ್ತ ಇರೋ ಏರಿಯಾನೇ ಅದನ್ನು ಕಂಫರ್ಟ್ ಝೋನ್ ಮಾಡ್ಕೊಂಡಿದೆ. ಇಟ್ ಡೋಂಟ್ ವಾಂಟ್ ಟು ಮೂವ್ ಔಟ್ಸೈಡ್ ಬಿಕಾಸ್ ಅಲ್ಲಿನೇ ಅದಕ್ಕೆಲ್ಲ ಸಿಗೋದ್ರಿಂದ ಅದು ಅಲ್ಲೇ ಸುತ್ತುವಂತಹ ಒಂದು ಕೆಲಸ ಮಾಡ್ತದೆ. ಸೊ ವಾಟ್ ಈಸ್ ಅವರ್ ಫಿಯರ್? ನಮ್ಮ ಕಂಫರ್ಟ್ ಲೆವೆಲ್ನ ಮೀರಿ ನಾವು ಹೋಗಬಾರ್ದು, ಹೋದರೆ ನಮಗೆ ಸ್ಟ್ರೆಸ್ ಆಗ್ತದೆ, ಕಷ್ಟ ಆಗ್ತದೆ ಅನ್ನೋವಂಥದ್ದು ಏನಿದೆ ಅಲ್ಲ, ಅದು ಫಿಯರ್ ಅಷ್ಟೇ. ಸೊ ಈ ಮೈಂಡ್ಸೆಟ್ ನಮಗೆ ಯಾಕೆ ಬರ್ತದೆ? ವೈ ವಿ ಗೆಟ್ ಫಿಯರ್? ಇದು ನಮಗೆ ಬರೀ ಪ್ರೆಸೆಂಟ್ ಸೊಸೈಟಿಯಿಂದ ನಾವು ಬೆಳೆದು ಬಂದಿರೋದ್ರಿಂದ ಅಲ್ಲ. ಇಟ್ ಈಸ್ ದೇರ್ ಇನ್ ನಾವು ಬೇಸಿಕಲಿ ವಿ ಆರ್ ಆಲ್ ಹಂಟರ್ ಗ್ಯಾದರರ್ಸ್. ನಮ್ಮದು ಹಂಟರ್ ಪ್ರಿಮಿಟಿವ್ ಮೈಂಡ್ಸೆಟ್ ಏನಿರುತ್ತಲ್ಲ, ಹಂಟರ್ ಪ್ರಿಮಿಟಿವ್ ಮೈಂಡ್ಸೆಟ್ಟಲ್ಲಿ ನಮ್ಮ ಬ್ರೈನ್ ಆಲ್ವೇಸ್ ಏನಿರ್ತೈತಲ್ಲ, ಡೇಂಜರ್ ಬಗ್ಗೆ ಅಲರ್ಟ್ ಮಾಡ್ತಾ ಇರ್ತದೆ. ಅದು ಏನಿದೆ ಅಲ್ಲ, ನಮಗೆ ಕಂಟಿನ್ಯೂಸ್ ಆಗಿ ಆಂಥ್ರೋಪಾಲಜಿಸ್ಟ್ ಹೇಳೋ ಪ್ರಕಾರ ಆ ಹಂಟರ್ ಪ್ರಿಮಿಟಿವ್ ಮೈಂಡ್ಸೆಟ್ ನಮ್ಮಲ್ಲಿ ಇನ್ನೂ ಇದೆ. ಸಣ್ಣದೊಂದು ಡೇಂಜರಿಗೂ ಸಹಿತ ನಮ್ಮ ಬ್ರೈನ್ ಇದೆಲ್ಲ ಓವರ್ ರಿಯಾಕ್ಟ್ ಮಾಡಿ ಓವರ್ ಮೆಸೇಜಸ್ಸನ್ನು ಕಳಿಸ್ಬಿಡ್ತದೆ. ಇಟ್ಸ್ ಅ ಬಿಗ್ ಥಿಂಗ್ ಅಂತ ಹೇಳಿ ಅವರ್ ಮೈಂಡ್ ವಿಲ್ ಪ್ರೆಸೆಂಟ್. ಅದನ್ನು ಅಕ್ಸೆಪ್ಟ್ ಮಾಡಬೇಕಾ? ವಾಟ್ ಎವರ್ ಅವರ್ ಮೈಂಡ್ ನಮಗೆ ಕೊಡುವಂತಹ ಒಂದು ಡೇಂಜರ್ ಸೈನ್ ಏನಿರುತ್ತಲ್ಲ, ಅದನ್ನು ಆಕ್ಸೆಪ್ಟ್ ಮಾಡಬೇಕಾ? ಪ್ಲೀಸ್ ಎನಿಬಡಿ ವಾಂಟ್ ಟು ಆನ್ಸರ್? ಆಕ್ಸೆಪ್ಟ್ ಮಾಡಿಬಿಡ್ಬೇಕಾ? ವಾಟ್ ಎವರ್ ಅವರ್ ಬ್ರೈನ್ ಸೆಟ್ ಮಾಡಿಬಿಡ್ಬೇಕಾ? ನೋ, ವಿ ಶುಡ್ ನಾಟ್ ಡೂ. ವಿ ಶುಡ್ ಟೆಲ್ ಅವರ್ ಮೈಂಡ್ ದಟ್ ಓಕೆ, ಯು ಹ್ಯಾವ್ ಗಿವನ್ ಮೀ ದ ಒಂದು ಸೈನ್ ಕೊಟ್ಟಿದೀಯಾ ನೀನು, ಇಟ್ಸ್ ಫೈನ್, ಐ ವಿಲ್ ಟೇಕ್ ಆಲ್ ದ ಕಾಷನ್ಸ್ ಆ್ಯಂಡ್ ಐ ವಿಲ್ ಪ್ರೊಸೀಡ್, ಐ ವಿಲ್ ನಾಟ್ ಸ್ಟೆಪ್ ಬ್ಯಾಕ್. ಇಷ್ಟೇ ಹೇಳಿ ಇಫ್ ವಿ ಮೂವ್ ಆನ್ ಆದ್ವಿ ಅಂತಂದರೆ ವಿಲ್ ಸಿ ದ ಸಕ್ಸಸ್ಫುಲ್ ವರ್ಲ್ಡ್. ಸೊ ಬಿಕಾಸ್ ಆಫ್ ದಟ್ ಹಂಟರ್ ಗ್ಯಾದರರ್ಸ್, ಆ ಪ್ರಿಮಿಟಿವ್ ನಮ್ಮದು ಮೆಂಟಾಲಿಟಿಯಿಂದನೇ ನಮ್ಮ ಬ್ರೈನ್ನಲ್ಲಿ ಏನಾಗಿದೆ ಅಂತಂದರೆ ಅದು ಎಲ್ಲ ಲೈಕ್ ಸ್ಟೋರೇಜ್ ಆಗಿಬಿಟ್ಟಿದೆ. ವಿ ಆರ್ ಎಂಜಿನಿಯರ್ಡ್ ಲೈಕ್ ದ್ಯಾಟ್. ಅಂದರೆ ಈ ಥರ ಆದರೆ ಹಿಂಗಾಗುತ್ತೆ, ಹಾಗಾಗುತ್ತೆ ಅಂತ ಹೇಳಿ ವಿ ಆರ್ ಆಲ್ ಪ್ರೀ ಆಕ್ಯುಪೈಡ್. ಸಡನ್ ಆ್ಯಕ್ಷನ್, ನಮಗೆ ಏನಾದರೂ ಒಂದು ಆ್ಯಕ್ಷನ್ ಬಂದುಬಿಟ್ರೆ ಸಡನ್ನಾಗಿ ರಿಯಾಕ್ಷನ್ ಬರ್ತದೆ. ಯಾಕೆ ಆ ರಿಯಾಕ್ಷನ್ ಬರ್ತದೆ ಅಂತಂದರೆ ವಿ ಆರ್ ಆಲ್ ಪ್ರೀ ಆಕ್ಯುಪೈಡ್. ಆಲ್ರೆಡಿ ನಮ್ಮಲ್ಲಿ ಏನಿದೆ ಎಲ್ಲ ನಾವು ಇಂಜಿನಿಯರ್ಡು, ಎಲ್ಲ ಟೆಕ್ನಿಕಲ್ಲಿ ನಾವು ಇದು ಆಗಿರ್ತೀವಿ. ಸೊ ಹೆಂಗಪ್ಪ ನಾವು ರಿಯಾಕ್ಟ್ ಮಾಡ್ತೀವಿ? ಹೆಂಗೆ ರಿಯಾಕ್ಟ್ ಮಾಡ್ತೀವಿ? ಯಾವುದೇ ಒಂದು ಸಿಚುವೇಷನ್ನಿಗೆ ಫಸ್ಟ್ ಸಿಚುವೇಶನ್ ಬಂದ ತಕ್ಷಣ ಅದ್ರ ಬಗ್ಗೆ ನಾವು ಭಾಳಷ್ಟು ವಿಚಾರ ಮಾಡೋದಿಲ್ಲ. ವಾಟ್ ಈಸ್ ಇಟ್, ವಾಟ್ ಈಸ್ ದ್ಯಾಟ್ ಅಂತ ಏನು ಯೋಚನೆ ಮಾಡೋದಿಲ್ಲ. ವಿ ಜಸ್ಟ್ ರಿಯಾಕ್ಟ್. ಹೆಂಗೆ ಅಂತಂದರೆ ನೆಕ್ಸ್ಟ್ ಸ್ಲೈಡ್ ಪ್ಲೀಸ್. ಮಂಕಿ ಸಿ ಮಂಕಿ ಡೂ. ವಾಟ್ ಡಸ್ ಇಟ್ ಮೀನ್? ಮಂಕಿ ಸಿ ಮಂಕಿ ಡೂ ಅಂದರೆ ವಿ ಆಲ್ ನೋ ದ ಸ್ಟೋರೀಸ್. ಹೆಂಗೆ ದಟ್ ಹ್ಯಾಟ್ ಸೆಲ್ಲರ್ ಹ್ಯಾಸ್ ಕಲೆಕ್ಟೆಡ್ ಹಿಸ್ ಹ್ಯಾಟ್ ಬ್ಯಾಕ್ ಫ್ರಮ್ ದ ಮಂಕೀಸ್ ಅಂತಂದರೆ ಮಂಕೀಸ್ ಆಲ್ವೇಸ್ ಇಮಿಟೇಟ್. ಸೊ ವಿ ಆರ್ ಆಲ್, ಅವರ್ ancestors ಆರ್ monkeys, ಸೊ ವಿ ಆಲ್ಸೋ ಇಮಿಟೇಟ್ ಅಲ್ಲ. ಸೇಮ್ ಥಿಂಗ್ ವಿ ಇಮಿಟೇಟ್. ಯಾವುದರಿಂದ ಇಮಿಟೇಟ್ ಮಾಡ್ತೀವಿ? ಹೌ ಅವರ್ ಬ್ರೈನ್ ಈಸ್ ಇನ್ಫ್ಲುಯೆನ್ಸ್ಡ್, ಹೌ ಅವರ್ ಥಾಟ್ ಪ್ರಾಸೆಸ್ ಈಸ್ ಇನ್ಫ್ಲುಯೆನ್ಸ್ಡ್ ಅಂತಂದರೆ ಫಸ್ಟ್ ಬೈ ಅವರ್ ಫ್ಯಾಮಿಲಿ ಆ್ಯಂಡ್ ಪೇರೆಂಟ್ಸ್. ವಾಟ್ ಬಿಲೀಫ್ ದೇ ಹ್ಯಾವ್, ಹೌ ನಮ್ಮನ್ನು ಅವ್ರು ಯಾವ ರೀತಿ ಬೆಳೆಸಿದ್ದಾರೆ, ಫ್ಯಾಮಿಲಿ ಮೆಂಬರ್ಸ್ ಥಾಟ್ ಪ್ರಾಸೆಸ್ ಹೆಂಗಿದೆ, ಫ್ಯಾಮಿಲಿ ಏನಿದೆ ಅಲ್ಲ ಅದು ಬಹಳ 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 ಪ್ರಭಾವ ಬೀರ್ತದೆ. ಸೊ ಆ ಮೈಂಡ್ಸೆಟ್ ಇರ್ತದೆ. ಅಂದರೆ ಇಲ್ಲಿ ಇಮಿಟೇಷನ್ ಬಗ್ಗೆ. ನೆಕ್ಸ್ಟ್ ಕಮ್ಸ್ ದ ಸೊಸೈಟಿ. ಸೊಸೈಟಿ ಏನಿದೆ ಅಲ್ಲ, ಹೆಂಗೆ ಸೊಸೈಟಿ ಇರ್ತದೆ, ವಿ ಆ್ಯಕ್ಟ್ ಲೈಕ್ ದ್ಯಾಟ್. ಸೊ ಫಿಯರ್ ಹೆಂಗೆ ಕ್ರಿಯೇಟ್ ಆಗ್ತದೆ ಅಂತಂದರೆ ಸೊಸೈಟಿಯಿಂದ ನಮಗೆ ಫಿಯರ್ ಕ್ರಿಯೇಟ್ ಆಗ್ತದೆ. ಸೊಸೈಟಿ ಏನು ಮಾಡಿದೆ ಅಂತಂದರೆ ಸಮ್ ಜೆಂಡರ್ ಬಯಾಸ್ನೆಸ್ ಇದೆ ಸೊಸೈಟಿನಲ್ಲಿ. ವಿ ಹ್ಯಾವ್ ಟು ಆಕ್ಸೆಪ್ಟ್. ದೋ ವಿ ಗಾಟ್ ಸೋ ಮಚ್ ಅಪಾರ್ಚುನಿಟೀಸ್ ಅಲ್ಲ, ವಿ ಆರ್ ನಾಟ್ ಬ್ಲೇಮಿಂಗ್, ಬಟ್ ವಿ ಹ್ಯಾವ್ ಟು accept that there is some bias in the society. ಸಮಾಜ ಏನು ಹೇಳ್ತದೆ ನಮಗೆ? ವಾಟ್ ಸೊಸೈಟಿ ಟೆಲ್ಸ್ ಅಸ್? ಏನು ಹೇಳ್ತದಪ್ಪ ಅಂತಂದರೆ ಯು ಆರ್ ಅ ವುಮನ್, ಯು ಹ್ಯಾವ್ ಸಮ್ ಲಿಮಿಟೇಷನ್ಸ್. ಓಕೆ, ಇಲ್ಲಿ ನಮ್ಗೆ ಆರ್ಗನೈಸೇಷನ್ನಲ್ಲಿನೇ, ಈ ಕಾನ್ಫರೆನ್ಸ್ ಆರ್ಗನೈಸೇಷನ್ನಲ್ಲಿನೇ ನಾವು ವುಮನ್ಗೆ ಸಮ್ ಸೆಲೆಕ್ಟೆಡ್ ಕೆಲಸಗಳನ್ನು ಆಯ್ಕೆ ಮಾಡ್ಕೊಂಡಿದ್ವಿ, ಮೆನ್ನಿಗೆ ಸಮ್ ಸೆಲೆಕ್ಟೆಡ್ ಕೆಲಸವನ್ನು ನಾವು ಬಿಟ್ಬಿಟ್ಟಿದ್ವಿ. ಹೌ ವಿ ಹ್ಯಾವ್ ಅದನ್ನು ಹೆಂಗೆ ಬೈಫರ್ಕೇಟ್ ಮಾಡಿದ್ವಿ ನಾವು? ಆನ್ ದ ಬೇಸಿಸ್ ಆಫ್ ದ ಸೊಸೈಟಲ್ ನಾರ್ಮ್ಸ್. ಹೋಟೆಲ್ ಬುಕ್ಕಿಂಗು, ರೆಸಿಡೆನ್ಷಿಯಲ್ ಬುಕ್ಕಿಂಗು, ಟ್ರಾನ್ಸ್ಪೋರ್ಟೇಷನ್ನು, ಇಟ್ಸ್ ಆಲ್ ಲೆಫ್ಟ್ ಟು ಮೆನ್. ಡೆಕೋರೇಷನ್ನು, ರಂಗೋಲಿ ಹಾಕೋದು, ಫುಡ್ಡು, ಇದೆಲ್ಲ ಲೆಫ್ಟ್ ಟು ವುಮನ್. ಈವನ್ ಇನ್ ಆರ್ಗನೈಸೇಷನ್, ಮನೆಯಲ್ಲಿನೂ ಸಹಿತ ವಿ ಚೂಸ್ ದ ಸೇಮ್ ಟೈಪ್ ಆಫ್ ವರ್ಕ್. ಯಾರು ಹೇಳ್ತಾರೆ ನಮಗೆ? ಎಲ್ಲನ ಕಾಂಟ್ರಾಕ್ಟ್ ಇದೆನಾ, ವುಮೆನ್ಸ್ ಇದನ್ನೇ ಮಾಡಬೇಕು ಅಂತಂದರೆ ವಿ ಫಾಲೋ ಸೊಸೈಟಿಯಲ್ ರೂಲ್ಸ್. ನಮ್ಮ ಫ್ಯಾಮಿಲಿನಲ್ಲಿ ಏನಿರ್ತದೆ, ಸೊಸೈಟಿನಲ್ಲಿ ಏನಿರ್ತದೆ, ಸೇಮ್ ವಿ ಫಾಲೋ. ನೆಕ್ಸ್ಟ್ ಕಮ್ಸ್ ದ ರಿಲಿಜನ್ ಆ್ಯಂಡ್ ರಿಲಿಜಿಯಸ್ ಟೀಚರ್ಸ್. ನಮ್ಮ ರಿಲಿಜನ್ ಏನು ಹೇಳ್ತದೆ, ವಿ ಫಾಲೋ ದಟ್. ಏನು ಹೇಳ್ತದೆ, ಒಂದು ಸೈಡು ಯತ್ರ ನಾರ್ಯಸ್ತು ಪೂಜ್ಯಂತೆ ರಮಂತೆ ತತ್ರ ದೇವತಃ. ಮತ್ತೆ ಏನು ಹೇಳ್ತದೆ, ಕಾರ್ಯೇಶು ದಾಸಿ ಕರ್ಣೇಶು ಮಂತ್ರಿ ಭೋಜೇಶು ಮಾತಾ ಕ್ಷಮಯ ಧರಿತ್ರಿ. ಹೆಣ್ಮಕ್ಳಿಗೆ ಏನಿದೆ, ಕಾರ್ಯೇಶು ದಾಸಿ ಇರಬೇಕು, ಶಯನೇಶು ರಂಭ ಇರಬೇಕು, ಕರ್ಣೇಶು ಮಂತ್ರಿ ಇರಬೇಕು. ಸೋ ಮೆನಿ ರೆಸ್ಪಾನ್ಸಿಬಿಲಿಟೀಸ್ ಇಟ್ ಹ್ಯಾಸ್ ಗಿವನ್. ಮತ್ತೆ ಏನು ಹೇಳ್ತದ್ರಿ, ಯತ್ರ ನಾರ್ಯಸ್ತು ಪೂಜ್ಯಂತೆ ರಮಂತೆ ತತ್ರ ದೇವತಃ ಅಂತ. ದೇವ್ರ ಹತ್ರ ಯಾರಾದರೂ ಕೆಲಸ ಮಾಡಿಸ್ತಾರೆ ರೀ? ಕಾಂಟ್ರವರ್ಸಿ ಸೊಸೈಟಿನಲ್ಲಿ ರಿಲಿಜನ್ ಟೀಚಿಂಗ್ಸ್ನಲ್ಲಿನೇ ಇದೆ. ಹಿಪೋಕ್ರಸಿ ಈಸ್ ದೇರ್ ಇನ್ ರಿಲಿಜನ್ ಟೀಚಿಂಗ್ ಓನ್ಲಿ. ಅದನ್ನೇ ಕೇಳ್ತಾ ಕೇಳ್ತಾ ನಾವು ಬೆಳೆದಿದ್ದೀವಿ. ನಮ್ಮನ್ನು ಏನು ಮಾಡಿಬಿಟ್ಟಿದ್ದಾರೆ, ಅಷ್ಟಲಕ್ಷ್ಮಿಯರಿಗೆ ಹೋಲಿಸ್ಬಿಟ್ಟಿದ್ದಾರೆ. ಸಿಂಗಲ್ ಟಾಸ್ಕ್, ನಾವು ಸಿಂಗಲ್ ಟಾಸ್ಕ್ ಅಲ್ಲದೆ ಆಲ್ವೇಸ್ ವಿ ಹ್ಯಾಂಡಲ್ ಮಲ್ಟಿ ಟಾಸ್ಕರ್ಸ್ ಬೈ ಬರ್ತ್. ಬಟ್ ಸ್ಟಿಲ್ ವಿ ಡೋಂಟ್ ಹ್ಯಾವ್ ಕಾನ್ಫಿಡೆನ್ಸ್. ಒಂದು ಆರ್ಗನೈಸೇಷನ್ನಲ್ಲಿ ವಿ ಡೋಂಟ್ ವಾಂಟ್ ಟು ಟೇಕ್ ದ್ಯಾಟ್ ರೆಸ್ಪಾನ್ಸಿಬಿಲಿಟಿ ವಿಚ್ ಅ ಮೆನ್ ಟೇಕ್ಸ್. ಯಾಕೆ? ದೋ ವಿ ಆರ್ ಮಲ್ಟಿ ಟಾಸ್ಕರ್ಸ್. ನಮ್ಮನ್ನು 8-10 ಕೈಯಿಂದ ಪ್ರೆಸೆಂಟ್ ಮಾಡಿದ್ದಾರೆ, ಹೌದಾ? ಎಲ್ಲಾದರೂ ಅಷ್ಟು ಕೈಯಿಂದ ಏನೆಲ್ಲ ಮಾಡ್ಬೋದು, ಬಟ್ ಸ್ಟಿಲ್ ವಿ ಡೋಂಟ್ ಟೇಕ್ ಸಚ್ ವರ್ಕ್ಸ್. ಯಾಕೆ ಮಾಡಲ್ಲ ಅಂತಂದರೆ ನಮ್ಮ ಕಂಫರ್ಟ್ ಝೋನ್ನಲ್ಲಿನೇ ಇದ್ದೀವಿ ನಾವು. ವಿ ಆರ್ ಗ್ರೋನ್ ಅಪ್, ವಿ ಆರ್ ನೌ ಬಿಗ್ ಎಲಿಫೆಂಟ್, ಬಟ್ ವಿ ಆರ್ ಟೈಡ್ ಅಪ್ ಟು ದ ಸ್ಮಾಲ್ ರೋಪ್ ವಿಚ್ ವಿ ಡೋಂಟ್ ವಾಂಟ್ ಟು ಬ್ರೇಕ್ ಅಪ್. ಅಷ್ಟೇ, ಅದನ್ನು ಬ್ರೇಕ್ ಮಾಡೋಕ್ಕೆ ನಾವು ನೋಡೋದೇ ಇಲ್ಲ ರೀ. ವಿ ಆರ್ ಸ್ಟಿಲ್ ಇನ್ ಅವರ್ ಕಂಫರ್ಟ್ ಝೋನೇ. ನಮ್ಮ ಡ್ರೆಸ್ ಪ್ರೆಸ್ ಆಗಲಿಲ್ಲ, ವಿ ಡೋಂಟ್ ವಾಂಟ್ ಟು ಗೋ ಎನಿವೇರ್. ನಮಗೆ ಪಾರ್ಲರ್ ಆಗಿರಲಿಲ್ಲ, ವಿ ಡೋಂಟ್ ವಾಂಟ್ ಟು ಗೋ ಎನಿವೇರ್. ಅದು ಒಂದು ನಮ್ಮ ಕಂಫರ್ಟ್ ಝೋನ್ ಆಗಿಬಿಟ್ಟಿರ್ತದೆ. ವಿ ಏನು ಮಾಡ್ತೀವಿ ಅಂತಂದರೆ, ವಿ ಕನ್ಫೈನ್, ನಾವು ನಮ್ಮನ್ನೇ ನಮಗೆ ಲಿಮಿಟ್ ಮಾಡ್ಕೊಂಡ್ಬಿಡ್ತೀವಿ. ಸೊ ಫೇಸ್ ದ ಫಿಯರ್ಸ್. ವಾಟ್ ವಿಲ್ ಹ್ಯಾಪನ್? ಒಂದು ದಿವಸ ನಾನೇನಾದರೂ ಮ್ಯಾಚಿಂಗ್ ಡ್ರೆಸ್ ಹಾಕೊಂಡು ಹೋಗಲಿಲ್ಲ ಅಂದರೆ ಈಸ್ ಎನಿಥಿಂಗ್ ವಿಲ್ ಹ್ಯಾಪನ್? ನಥಿಂಗ್. ಯಾವುದೇ ಒಂದನ್ನು ನಾವು ಎಷ್ಟು ಟ್ರೈ ಮಾಡಿ ಮುಚ್ಚಾಕ್ಲಿಕ್ಕೆ ನೋಡ್ತೀವಲ್ರಿ, ಅದನ್ನೇ ಜಾಸ್ತಿ ಕಾಣಿಸ್ತದೆ. ಈಗ ನಾವು ಮ್ಯಾಚಿಂಗ್ ಸ್ಲಿಪ್ಪರ್ ಹಾಕ್ಕೊಂಡಿಲ್ಲ, ಯಾರಾದರೂ ನೋಡಬೇಕಾದ್ರೆ ಹಿಂಗ ಮಾಡ್ತಾ ಇದ್ದರೆ ಅವ್ರು ಅದನ್ನೇ ನೋಡ್ತಾರೆ, ಓ ಸಮಥಿಂಗ್ ಶಿ ಈಸ್ ಹೈಡಿಂಗ್, ವಾಟ್ ಈಸ್ ದೇರ್ ಅಂತ ಹೇಳಿ. ಅದು ಬಿಟ್ಬಿಟ್ಟು ಮೂವ್ ಫ್ರೀಲಿ. ಯಾರೂ ನಮ್ಮ ಸ್ಲಿಪ್ಪರ್ಸೇ ನೋಡೋದಕ್ಕೆ ಯಾರೂ ಬರೋದಿಲ್ಲ ರೀ. ಆರಾಮವಾಗಿದ್ದರೆ ನೋಬಡಿ ವಿಲ್ ನೋಟಿಸ್ ವಾಟ್ ಯು ವಾಂಟ್ ಟು ಪ್ರೆಸೆಂಟ್ ಅಲ್ಲ, ಹೌ ಯು ಆರ್ ಅಲ್ಲ, ದ್ಯಾಟ್ ದೇ ವಿಲ್ ನೋಟಿಸ್. ಅದಕ್ಕೆ ನಾವು ಫಿಯರ್ನೆಸ್, ಹೆಣ್ಣು ಮಕ್ಕಳಿಗೆ ಹೆಚ್ಚು ಫಿಯರ್ ಇರೋದು ಅಂತಂದರೆ ಅವರ್ ಪ್ರೆಸೆಂಟಬಿಲಿಟಿ ಆ್ಯಂಡ್ ಸೊಸೈಟಿನಲ್ಲಿ ನಮ್ಮ ರೋಲ್. ವಿ ಡೋಂಟ್ ವಾಂಟ್ ಟು ಸ್ಪಾಯ್ಲ್ ಅವರ್ ನೇಮ್. ಹೆಂಗಿರ್ಬೇಕ್ರಿ ಅಂತಂದರೆ, ಬಹಳ ಮಹಾನ್ ಹೆಣ್ಮಗಳು ಇವಳು, ಶಿ ಡೂ ಆಲ್ ದ ವರ್ಕ್. ಈಗ ಜಸ್ಟ್ ಪ್ರೀವಿಯಸ್ಲಿ ಸ್ಪೀಕರ್ ಮಾತಾಡಬೇಕಿದ್ರೆ ಡಾಕ್ಟರ್ ಸುಮತಿ ಗೌಡ ಅವರು ಭಾಳ ಒಂದು ಉತ್ತಮವಾದ ಪ್ರಶ್ನೆ ಕೇಳಿದರು. ಗಿಲ್ಟ್ ಫೀಲಿಂಗ್. ನಾವು ಮಕ್ಕಳನ್ನ ಇಗ್ನೋರ್ ಮಾಡಿಬಿಟ್ರೆ, ವೆನ್ ವಿ ಕಂಪೇರ್ ಟು ದ ಅದರ್ ಮದರ್ಸ್ ಎಲ್ಲ ನಮಗೆ ವಿ ಫೀಲ್ ವೆರಿ ಮಚ್ ಗಿಲ್ಟಿ ಅಂತ. ವೈ ಟು ಫೀಲ್ ಗಿಲ್ಟಿ? ಯಾಕೆ ಫೀಲಿಂಗ್ ಗಿಲ್ಟಿ ಆಗಬೇಕ್ರಿ? ವಿ ಆರ್ ದ ಒನ್ ಹೂ ಹ್ಯಾವ್ ಟು ಟೇಕ್ ಆಲ್ ದ ರೆಸ್ಪಾನ್ಸಿಬಿಲಿಟಿ. ನಮ್ಮನ್ನು ಅದಕ್ಕೋಸ್ಕರನೇ ದೇವ್ರು ಮಾಡಿದಾನ. ವಿ ಡೋಂಟ್ ಹ್ಯಾವ್ ಅವರ್ ಪ್ರಯಾರಿಟೀಸ್. ನಮಗೆ ಪ್ರಯಾರಿಟೀಸೇ ಬೇಡವಾ? ಪ್ರಯಾರಿಟೀಸ್ ಬೇಕಲ್ವಾ? ವಿ ಆರ್ ಆಲ್ಸೋ ಇಂಡಿವಿಜುವಲ್ ಹ್ಯೂಮನ್ ಬೀಯಿಂಗ್ ಅಲ್ಲ. ನಾವು ಮದರು, ಸಿಸ್ಟರು, ಏನ್ರಿ, ಡಾಟರು, ವೈಫ್, ಸೋ ಮೆನಿ ರೋಲ್ಸ್ ಪ್ಲೇ ಮಾಡಬೇಕಾದ್ರೆ ಕ್ಯಾನ್ ವಿ ಬಿ ಇನ್ ಪರ್ಫೆಕ್ಟ್ ಇನ್ ಆಲ್ ದ ಥಿಂಗ್ಸ್? ಐ ಜಸ್ಟ್ ವಾಂಟ್ ಟು ಆಸ್ಕ್ ಒನ್ ಕ್ವಶನ್ ಎಲ್ಲ ಆಡಿಯನ್ಸಲ್ಲಿ. ನಿಮಗೆ ಈ ನೇಚರಲ್ಲಿ ಯಾವುದಾದ್ರೂ ಒಂದು ವಸ್ತು, ಇಟ್ ಶುಡ್ ಬಿ ಸಾಫ್ಟ್ ಲೈಕ್ ಫ್ಲವರ್ ಆ್ಯಂಡ್ ಹಾರ್ಡ್ ಲೈಕ್ ಡೈಮಂಡ್, ಮೃದುಲಪಿ ಪುಷ್ಪಂ ಕಠೋರದಪಿ ವಜ್ರಂ ಅಂತ ಎಲ್ಲಾದರೂ ಕಾಣಿಸ್ತದೆ ಯಾವುದಾದ್ರೂ ವಸ್ತು? ಇದೇನಾ ನೇಚರಲ್ಲಿ? ಇದೇನಾ? ಇಲ್ಲಲ್ಲ. ನೇಚರಲ್ಲಿ ಡೈಮಂಡ್ ಇದೆ, ಹಾರ್ಡ್ ಇದೆ, ಫ್ಲವರ್ ಇದೆ, ಸ್ಮೂತ್ ಇದೆ, ಎರಡೂ ಇರುವಂಥದ್ದು ಇದೇನಾ? ಇಲ್ಲಲ್ಲ. ಸೊ ವಿ ಆರ್ ಎಸ್ ವುಮನ್ ಈಸ್ ಮೃದುಲಪಿ ಪುಷ್ಪಂ ಕಠೋರದಪಿ ವಜ್ರಂ. ಹೌದಾ? ಅಷ್ಟು ನಾವು ಏನಿದ್ದೀವಲ್ರಿ, ವಿ ಆರ್ ಸ್ಟ್ರಾಂಗ್ ಎನಫ್. ಬಟ್ ಏನು ಪ್ರಾಬ್ಲಮ್ ಆಗ್ತಾ ಇದೆ ಅಂದರೆ, ವಿ ಡೋಂಟ್ ನೋ ಅವರ್ ಸ್ಟ್ರಾಂಗ್ನೆಸ್. ನಮಗೆ ಗೊತ್ತಿದ್ರೂ ವಿ ಆರ್ ನಾಟ್ ಲೆಟ್ ಟು ಎಕ್ಸ್ಪೋಸ್ ಅವರ್ ಸೆಲ್ಫ್. ನಮಗೆ ಆ ಅಪರ್ಚುನಿಟಿ ಸಿಗೋದಿಲ್ಲ. ಬಿಕಾಸ್ ಯಾಕಪ್ಪ ಅಂತಂದರೆ ಗಿಲ್ಟ್. ನಮ್ಮ ಪ್ರಯಾರಿಟೀಸನ್ನ ನಾವೇನಾದರೂ ಹಾಕ್ಕೊಂಡು ಮುಂದೆ ಹೋದ್ವಿ ಅಂತಂದರೆ, ಶಿ ನೆಗ್ಲೆಕ್ಟ್ಸ್ ಹರ್ ಫ್ಯಾಮಿಲಿ. ನಮ್ಮಂಥವ್ರೆ ಹೇಳ್ಬಿಡ್ತೀವಿ ರೀ, ಇಲ್ಲಿ ಬಂದಿದ್ದಾಳೆ ನೋಡು ಅಪ್ಪ, ಹರ್ ಡಾಟರ್ ಹ್ಯಾಸ್ ಅ ಎಕ್ಸಾಮಿನೇಷನ್ ಟುಮಾರೋ, ಶಿ ಕೇಮ್ ಹಿಯರ್ ಫಾರ್ ಟಾಕ್, ಯೂಸ್ಲೆಸ್ ಫೆಲೋ ಅಂತ. ಸೋ ಮಚ್ ಇಲ್ಲಿ ಇಗ್ನೋರ್ ಮನೆಗೆ ಕುಕ್ಕು ಬರಲಿಲ್ಲ ಅಂತಂದರೆ ಹೊರಗಡೆಯಿಂದ ತರಿಸ್ಕೊತಾರೆ. ವಿ ಆಲ್ಸೆಲ್ಫ್ ವಿಲ್ ಟೆಲ್. ಯಾಕೆ? ಆಲ್ ದ ರೆಸ್ಪಾನ್ಸಿಬಿಲಿಟಿ ಇನ್ ವುಮೆನ್ಸ್ದೇನಾ? ತರಿಸ್ಕೋಬಾರ್ದ? ವಿ ಆಲ್ಸೆಲ್ಫ್ ವಿ ಆರ್ ನಾಟ್ ರೆಡಿ ಟು. ನಮಗೆ ಜೆಂಡರ್ ಈಕ್ವಾಲಿಟಿ ಕೊಡ್ತಾ ಇದ್ದಾರೆ, ಬಟ್ ವಿ ಆರ್ ನಾಟ್ ರೆಡಿ ಟು ಟೇಕ್ ಇಟ್. ನಾವು ಫಸ್ಟ್ ಅದನ್ನು ತಯಾರು ಮಾಡ್ಕೋಬೇಕು ಅಂತಂದರೆ ವಿ ಹ್ಯಾವ್ ಟು ಫೇಸ್ ಅವರ್ ಆಲ್ ಫಿಯರ್ಸ್. ಇದೆಲ್ಲ ಏನಿದೆ ಅಲ್ರಿ, ದೀಸ್ ಆರ್ ಆಲ್ ಫಿಯರ್ಸ್ ವಿಚ್ ಈಸ್ ಹೋಲ್ಡಿಂಗ್ ಅಸ್ ಬ್ಯಾಕ್. ನಾವು ಮೆನ್ನನ್ನು ಬ್ಲೇಮ್ ಮಾಡೋದಲ್ಲ, ಅವ್ರು ಸರ್ವ್ ಮಾಡಿದರೆ ಅಟ್ಲೀಸ್ಟ್ ನಾವು ತಗೊಳ್ಳೋದು ಒಂದು ಮೆಂಟಲ್ ಸ್ಟೇಟಸ್ಸಿಗಾದರೂ ನಾವು ಬರಲೇಬೇಕು. ದೆರ್ ಆರ್ ಸೋ ಮೆನಿ ವಿಮೆನ್ಸ್ ಈಗೂ ಇದ್ದಾರೆ, ಇಫ್ ದೇ ಗಾಟ್, ಪ್ಲೀಸ್ ಡೋಂಟ್ ಫೈಂಡ್ ಮಿ ರಾಂಗ್, ಅವರಿಗೆ ಒಂದು ಪೀರಿಯಡ್ಸ್ ಬಂದಿದ್ದರೆ ಅಕಸ್ಮಾತಾಗಿ ಅವರು ದೇವ್ರನ್ನೇನಾದರೂ ಮುಟ್ಟಿಬಿಟ್ರು, ದೇವ್ರ ಮನೇಲಿ ಹೋಗ್ಬಿಟ್ರು ಅಂತಂದರೆ ಈಗೂ ಅವ್ರಿಗೆ ನಂಬಿಕೆ ಇದೆ ಅವ್ರ ಫ್ಯಾಮ್ಲಿಗೆ ಏನೋ ಆಗಬಾರ್ದಾಗ್ಬಿಡ್ತದೆ, ಏನೋ ಆಗಬಾರ್ದಾಗ್ಬಿಡ್ತದೆ ಅಂತ. ಸೋ ಮೆನಿ ಫಿಯರ್ಸ್ ದೆ ಗಾಟ್. ಅದರಿಂದ ಅವ್ರು ಏನು ಮಾಡ್ತಾರೆ, ವಾಂಟ್ ಟು ಡೂ ಎನಿಥಿಂಗ್, ಬೇಡಪ್ಪ ಸುಮ್ಮನೆ ನಾವು ಏನು ಮಾಡಿಬಿಡೋಣ, ಯಾಕಂದರೆ ಫ್ಯಾಮಿಲಿ ಈಸ್ ಪ್ರಯಾರಿಟಿ, ಹಸ್ಬೆಂಡ್ ಈಸ್ ಪ್ರಯಾರಿಟಿ, ಚಿಲ್ಡ್ರನ್ಸ್ ಆರ್ ಪ್ರಯಾರಿಟಿ ಆ್ಯಂಡ್ ಸೋಷಿಯಲ್ ರೆಪ್ರೆಸೆಂಟೇಷನ್ ಈಸ್ ಅ ಗ್ರೇಟ್ ಪ್ರಯಾರಿಟಿ. ಯಾರು ನನ್ನನ್ನು ಎಂಥ ಹೆಣ್ಮಗಳಪ್ಪ ಅಂತ ಅನ್ನಬಾರ್ದು ಅನ್ನೋದು. ದೀಸ್ ಆರ್ ಆಲ್ ಏನ್ರಿ, ಅದು ಫಿಯರ್ ವಿಚ್ ಹ್ಯಾಸ್ created from our family, society and religion beliefs, and the environment is a great contribution biologically. You all know better than me, gender is just a matter of x and y ಅಷ್ಟೇ ಅಲ್ರಿ, ಎಲ್ಲರಿಗೂ ಗೊತ್ತಿದೆ ಅದು. ಬಟ್ ಸ್ಟಿಲ್ ಬಯೋಲಾಜಿಕಲಿ ವಿ ಆರ್ ಏನ್ರಿ ವೀಕ್ ಮಾಡಿದೆ ಏನು ಅಂತಂದರೆ ನೇಚರು ನಮ್ಗೆ ಒಂದು ಸ್ಪೆಷಲ್ ಟು ಕ್ರಿಯೇಟ್ ಅ ನೆಕ್ಸ್ಟ್ ಜನರೇಷನನ್ನು ಕ್ರಿಯೇಟ್ ಮಾಡೋ ಶಕ್ತಿ ಕೊಟ್ಟಿದೆ. ಅದೇ ನಮ್ಮ ವೀಕ್ನೆಸ್ ಕೂಡ ಆಗಿದೆ. ಹೀಗೆ ನಮಗೆ ನೇಚರೂ ಪ್ರಾಬ್ಲಮ್ ಮಾಡ್ತದೆ. ನೆಕ್ಸ್ಟ್ ಕಮ್ಸ್ ದ ರೋಲ್ ಆಫ್ ಮೀಡಿಯಾ. ದ ವರ್ಸ್ಟ್ ಥಿಂಗ್ ಹ್ಯಾಪನಿಂಗ್ ಆರ್ ದ ಮೀಡಿಯಾ ನ್ಯೂಸ್ ತೊಗೊಳ್ರಿ, ಏನು ತೋರಿಸ್ತಾ ಇರ್ತಾರೆ, ಆಲ್ವೇಸ್ ಯಾವುದೋ ಒಂದು ಹೆಣ್ಮಗಳು ಯಾವುದೋ ಒಂದು ಫ್ಯಾಮಿಲಿ ಕ್ವಾರಲ್ನಲ್ಲಿ ಇನ್ವಾಲ್ವ್ ಆದರೆ ದೆ ಕೀಪ್ ಆನ್ ಶೋಯಿಂಗ್ ದ ಥಿಂಗ್ಸ್. ಯಾವುದೋ ಪೊಲಿಟಿಷಿಯನ್ಸ್ ಇಫ್ ಶಿ ಗೋಟ್ ಇನ್ವಾಲ್ವ್ಡ್ ಇನ್ ಸಮಥಿಂಗ್ ಅಲ್ಲ ದೆ ಕೀಪ್ ಆನ್ ಶೋಯಿಂಗ್ ಒಂದು ಕಡೆ. ಆದರೆ ದಿ ಸೀರಿಯಲ್ಸ್ ಆ್ಯಂಡ್ ದ ಫಿಲಮ್ಸ್ ಏನಿದಾವಲ್ರಿ ಎಲ್ಲ ವುಮನ್ ಓರಿಯೆಂಟೆಡ್ ರೀ. ಹೆಣ್ಮಕ್ಳೇನು ಅಳ್ತಾ ಇರಬೇಕು, ಸಫರಿಂಗ್ ಫೇಸ್ ಮಾಡ್ತಾ ಇರಬೇಕು. ಶಿ ಶುಡ್ ಬಿ ಅ ಗ್ರೇಟ್ ಹೀರೋಯಿನ್ ಸೊ ದ್ಯಾಟ್ ಅವ್ರ ಗಂಡ ಒದ್ದು ಅವಳ ಕೊಂದ್ರೂ ಸಹಿತ ಶಿ ಶುಡ್ ನಾಟ್ ಸ್ಪೀಕ್ ಇನ್ ದ ಸೊಸೈಟಿ. ಶಿ ಹ್ಯಾಸ್ ಟು ಫೇಸ್ ಆಲ್ ದ ಥಿಂಗ್ಸ್ ಆ್ಯಂಡ್ ಕರೆಕ್ಟ್ ಆಲ್ ದ ಫ್ಯಾಮಿಲಿ ಪ್ರಾಬ್ಲಮ್ಸ್ ಆ್ಯಂಡ್ ಶಿ ಈಸ್ ರೆಸ್ಪಾನ್ಸಿಬಲ್ ಫಾರ್ ಆಲ್ ದ ಪ್ರಾಬ್ಲಮ್ ಆ್ಯಂಡ್ ಶಿ ಈಸ್ ದ ಸಾಲ್ವರ್ ಅನ್ನೋದು ಒಂದು ಗ್ರೇಟ್ ಕ್ರೌನ್ ಹಾಕಿಬಿಟ್ಟು ಎಲ್ಲ ಹೀರೋಯಿನ್ ಓರಿಯೆಂಟೆಡ್ ಸೀರಿಯಲ್ಸ್ ರೀ. ಆಲ್ವೇಸ್ ವಿ ಕೀಪ್ ಆನ್ ಸೀಯಿಂಗ್ ದ್ಯಾಟ್ ಆ್ಯಂಡ್ ವಿ ವಿಲ್ ಫಾಲೋ. ಮೀಡಿಯಾದವರು ಯಾವುದಾದ್ರೂ ಒಂದು ಸಕ್ಸಸ್ಫುಲ್ ವುಮನ್ದು, ಯಾವುದಾದ್ರೂ ಒಂದು ಫಿಯರ್ಲೆಸ್ ವುಮನ್ದು ಸೊಸೈಟಿಯಲ್ಲಿ ನಾರ್ಮ್ಸನ್ನು ಫೇಸ್ ಮಾಡಿ ಮುಂದೆ ಬಂದಿರೋದನ್ನು ಯಾವತ್ತಾದರೂ ತೋರಿಸಿದಾರೇನ್ರಿ? ದೇ ಜಸ್ಟ್ ವಾಂಟ್ ದ TRPs ಆ್ಯಂಡ್ ವಿ ವಿಲ್ ಕೀಪ್ ಆನ್ ಎಂಜಾಯಿಂಗ್ ಬಿಕಾಸ್ ವಿ ವಾಂಟ್ ದ್ಯಾಟ್ ಆಲ್ಸೋ ಎಂಜಾಯ್ಮೆಂಟ್. ಸೊ ಈ ಥರ ನೆಕ್ಸ್ಟ್ ಸ್ಲೈಡ್. ಸೊ ದೀಸ್ ಆರ್ ದ ಫ್ಯಾಕ್ಟರ್ಸ್ ವಿಚ್ ಅಫೆಕ್ಟ್ಸ್ ಅವರ್ ಮೆಂಟಲ್ ಸ್ಟೇಟಸ್ ಅಂತ. ಇವೆಲ್ಲ ನಮ್ಮಲ್ಲಿ ಏನು ಮಾಡಿಬಿಡ್ತದೆ, ಫಿಯರನ್ನು ಕ್ರಿಯೇಟ್ ಮಾಡ್ತದೆ. ಸೊ ಫಿಯರ್ನ ಕ್ರಿಯೇಟ್ ಮಾಡಿದರೆ ವಾಟ್ ವಿ ಡೂ ಔಟ್ ಆಫ್ ಫಿಯರ್ನಲ್ಲಿ ಏನು ಮಾಡಿಬಿಡ್ತೀವಪ್ಪ ಅಂತಂದರೆ ವೆನ್ ವಿ ಗೆಟ್ ಸ್ಟ್ರೆಸ್ಡ್, ಫಿಯರ್ ಇದ್ದಾಗ ಯು ಜಸ್ಟ್ ಇಮ್ಯಾಜಿನ್, ನಿಮಗೆ ಯಾವುದೋ ಒಂದು ಈಗ ರೈಟ್ ನಾವು ಐ ವಿಲ್ ಗಿವ್ ಮೈ ಎಕ್ಸಾಂಪಲ್ ಓನ್ಲಿ. ಟುಡೇ ನಾನು ಕಾನ್ಫರೆನ್ಸಿಗೆ ಬರಬೇಕು ಅಂತಂದರೆ ಐ ನೀಡ್ ಅ PPT. ಸೊ ನನಗೆ ಸ್ವಲ್ಪ PPT ಪ್ರಾಬ್ಲಮ್ ಆಯಿತು, ಗಾಟ್ ಸ್ಟ್ರೆಸ್ಡ್. ಎಷ್ಟು ನನಗೆ ಸಿಟ್ಟು ಬಂತು ಅಂತಂದರೆ ಐ ಸ್ಕೋಲ್ಡ್ ಮೈ ಡಾಟರ್. ಎಲ್ಲ ನೆಗೆಟಿವ್ ಆಗಿಬಿಡ್ತ್ರಿ ಎಸ್ಟರ್ಡೇ ಇನ್ ಮೈ ಹೌಸ್ ಓನ್ಲಿ ಬಿಕಾಸ್ ಏನಪ್ಪ ಅಂತಂದರೆ ಐ ಗಾಟ್ ದಟ್ ಫಿಯರ್. ಅಯ್ಯೋ ಡಾಕ್ಟರ್ಸ್ ಎಲ್ಲ ಬಂದಿರ್ತಾರೆ, ಅವ್ರ ಮುಂದೆ ನಾನು ನೀಟಾಗಿ PPT ಪ್ರೆಸೆಂಟ್ ಮಾಡಲಿಲ್ಲ ಅಂದರೆ IM has given me such a responsibility, ನನ್ನ ಇಲ್ಲಿ ರೆಪ್ರೆಸೆಂಟ್ ಮಾಡಿದ್ದಾರೆ. ಐ ಗಾಟ್ ದಟ್ ಸ್ಟ್ರೆಸ್. ಔಟ್ ಆಫ್ ಸ್ಟ್ರೆಸ್ ಅಲ್ಲ, ಐ ಹ್ಯಾವ್ ಶೌಟೆಡ್ ಅ ಲಾಟ್. ಸೊ ಏನಾಗ್ತದೆ ರೀ, ಸ್ಟ್ರೆಸ್ ಏನಾಗ್ತದೆ, ನಮ್ಮ ಫಿಯರ್ ಏನಾಗ್ತದಲ್ಲ, ಲಾಟ್ಸ್ ಆಫ್ ನೆಗೆಟಿವಿಟಿನ ಕ್ರಿಯೇಟ್ ಮಾಡ್ಕೊಂಡ್ಬಿಡ್ತದೆ. ಔಟ್ ಆಫ್ ಫಿಯರ್ ನಾವು ಎಲ್ಲ ಸಿಚುವೇಶನ್ಸನ್ನು ಏನು ಮಾಡಿಬಿಡ್ತೀವಿ ರೀ, ಕೆಡಿಸ್ಕೊಂಡ್ಬಿಡ್ತೀವಿ. ಬಟ್ ಇಫ್ ವಿ ಆರ್ ಪಾಸಿಟಿವ್ ಅಲ್ಲ, ನಮ್ಮಲ್ಲಿ ಪಾಸಿಟಿವ್ ಇಮೋಷನ್ಸ್ ಇತ್ತು, ಫಿಯರ್ಲೆಸ್ನೆಸ್ ಇತ್ತು ಅಂತಂದರೆ ಇಟ್ ಕಮ್ಸ್ ಅ ಕಾನ್ಫಿಡೆನ್ಸ್. ನೌ ಐ ಆಮ್ ವೆರಿ ಕಾನ್ಫಿಡೆಂಟ್. ಯು ಕ್ಯಾನ್ ನೋಟಿಸ್, ನಾನು ಸ್ಟಾರ್ಟಿಂಗಲ್ಲಿ ಬಂದಾಗ ಲಿಟಲ್ ಐ ವಾಸ್ ನರ್ವಸ್. ಈಗ ನನಗೆ ಐ ಆಮ್ ಫೀಲಿಂಗ್ ವೆರಿ ಮಚ್ ಹ್ಯಾಪಿ. ಯಾಕಪ್ಪ ಅಂತಂದರೆ ಬೈ ಸೀಯಿಂಗ್ ಆಲ್ ಯುವರ್ ಹ್ಯಾಪಿ ಫೇಸಸ್, ಯುವರ್ ಆಲ್ ಅಟೆನ್ಷನ್ ಕೊಡ್ತಾ ಇದ್ದಾರೆ. ಮೇಡಮ್ ಈಸ್ ಸ್ಮೈಲಿಂಗ್ ಅ ಲಾಟ್. ಸೊ ಮಂಜುಳಾ ಮೇಡಮ್ ಈಸ್ ಸಿಟ್ಟಿಂಗ್ ನೆಕ್ಸ್ಟ್ ಟು ಮೇ. ಹೀಗೆಲ್ಲ ಇದನ್ನೆಲ್ಲ ನೋಡಿದ ತಕ್ಷಣ ಐ ಫೀಲ್ ವೆರಿ ಮಚ್ ಹ್ಯಾಪಿ. ಸೊ ದಿಸ್ ನಮ್ಮದು ಸ್ಟ್ರೆಸ್ಸನ್ನು ನಾವು ಕಂಟ್ರೋಲ್ ಮಾಡಲಿಲ್ಲ, ಫಿಯರ್ಲೆಸ್ನೆಸ್ನ ಕಂಟ್ರೋಲ್ ಮಾಡಲಿಲ್ಲ ಅಂದರೆ ದಿಸ್ ವಿಲ್ ಬಿ ದ ಪ್ರಾಬ್ಲಮ್. ಒಂದೇ ಒಂದು ಎಕ್ಸಾಂಪಲ್ ಹೇಳಿ ಐ ವಿಲ್ ಜಸ್ಟ್ ಸ್ಟಾಪ್ ಮೈ ಥಿಂಗ್ಸ್. ಸ್ವಲ್ಪ ಫಸ್ಟ್ ಸ್ಲೈಡಿಗೆ ಬರ್ರಿ. ಫಸ್ಟ್ first one. I just want to give a two example. The person here I'm showing, you know who she is? Sindhu Tai Sakpal. Sindhu Tai Sakpal and ಸ್ವಲ್ಪ ಮೇಲ್ ತಗೊಳ್ರಿ. ಅಕ್ಕ ಮಹಾದೇವಿ ಫೋಟೋ ವಾಸ್ ದೇರ್. ವೇರ್ ಇಟ್ ಈಸ್ ಐ ಡೋಂಟ್ ನೋ. ಅಕ್ಕ ಇದೇನಾ? ಓಕೆ, ಅಕ್ಕ ಮಹಾದೇವಿ ಇಸ್ ದೇರ್, ಸಿಂಧು ತಾಯಿ ಇಸ್ ದೇರ್, ಆಮೇಲೆ ಮಾಯಾ ಆಂಜಲೋ ಇಸ್ ದೇರ್. ಇವರೆಲ್ಲ ಯಾರು? ಮಲಾಲಾ ಇಸ್ ದೇರ್, ಕಲ್ಪನಾ ಚಾವ್ಲಾ ಇಸ್ ದೇರ್. ಯಾರು ಇವರು? ಜೋಫ್ರಾ ಆರ್ಫರ್ ಇಸ್ ದೇರ್. ಯಾರು ಇವರೆಲ್ಲ? ಅವರೆಲ್ಲ ಏನು ಮೇಲ್ಗಡೆಯಿಂದನೇ ಯಾರು ಕ್ರಿಯೇಟ್ ಆಗಿ ಕೆಳಗಡೆ ಬಿದ್ದಿಲ್ಲ. ಐ ಜಸ್ಟ್ ವಾಂಟ್ ಟು ಗಿವ್ ಎಕ್ಸಾಂಪಲ್ ಆಫ್ ಸಿಂಧು ತಾಯಿ ಸಕ್ಪಾಲ್. ಯಾರಂತ ಗೊತ್ತಲ್ಲ? ಪದ್ಮಶ್ರೀ ಅವಾರ್ಡ್ ಬರಬೇಕು ಅಂತಂದರೆ ಯಾರಿಗೆ ಬರ್ಬೋದ್ರಿ? ದೊಡ್ಡ ಪರ್ಸ್ನಾಲಿಟೀಸ್ ದಿಲ್ ಗೆಟ್ ದ ಪದ್ಮಶ್ರೀ, ಪದ್ಮವಿಭೂಷಣ, ಆಮೇಲೆ ಏನ್ರಿ ರಾಷ್ಟ್ರಪತಿ ಅವಾರ್ಡು, ಭಾರತ ರತ್ನ, ಅವೆಲ್ಲ ದೊಡ್ಡ ದೊಡ್ಡ ಜನರಿಗೆ ಬರ್ತದೆ. ವಿ ಆಲ್ ನೋ. ಕ್ಯಾನ್ ಯು ಇಮ್ಯಾಜಿನ್ ಅ ಬೆಗ್ಗರ್ ವುಮನ್? ಒಬ್ಬ ಯಕ್ಕಶ್ಚಿತ್ತ ಭಿಕ್ಷುಕಿಗೆ ಪದ್ಮಶ್ರೀ ಸಿಗುತ್ತಾ ಅಂತ ಹೇಳಿ ನಾವು ವಿಚಾರ ಮಾಡ್ಬೋದಾ? ಶಿ ಈಸ್ ಜಸ್ಟ್ ಅ ಬೆಗ್ಗರ್. ಸಿಂಧು ತಾಯಿ ಸಕ್ಪಾಲ್ ಅವಳಿಗೆ ಲೈಫಲ್ಲಿ ಬಂದಿರೋ ಪ್ರಾಬ್ಲಮ್ ಎಂಥದ್ದು ಬಂದಿತ್ತಪ್ಪ ಅಂತಂದರೆ, ಅವಳ ಪ್ರಾಬ್ಲಮ್ಗೋಸ್ಕರ ಅವಳು ಎಲ್ಲಿ ಮಲಗ್ತಿದ್ಲು ಅಂದರೆ ಸುಡುಗಾಡಿನಲ್ಲಿ ಹೋಗಿ ಶಿ ಹ್ಯಾಸ್ ಟೇಕನ್ ಎ ಶೆಲ್ಟರ್ ಇನ್ ಅ ಗ್ರೇವಿಯಾರ್ಡ್. ನಮ್ಮ ಎದೆ ನಡಕ್ತದ್ರಿ ಸುಡುಗಾಡಿಗೆ ಹೋಗಬೇಕು ಅಂದರೆ ಡೇ ಟೈಮಲ್ಲಿ. ಆ ರಾತ್ರಿ ಟೈಮಲ್ಲಿ ಅವಳು ಹೋಗ್ತಿದ್ಲು ಅಂತಂದರೆ ಎಷ್ಟು ಫಿಯರ್ನ ಫೇಸ್ ಮಾಡಿರಬಾರ್ದು ಅವಳು. ಸೊ ನಾವು ಶೀಸ್ ಅವ್ರ ಆರ್ಗನೈಸೇಷನ್ನು ಲ್ಯಾಕ್ಸ್ ಟುಗೆದರ್ ಏನ್ರಿ ಮಕ್ಕಳಿಗೆ ಗಿವನ್ ಅ ಶೆಲ್ಟರ್. ಒಂದು ಫಿಯರ್ ಶಿ ಹ್ಯಾಸ್ ಫೇಸ್ಡ್ ಆ್ಯಂಡ್ ಶಿ ಹ್ಯಾಸ್ ಕ್ರಿಯೇಟೆಡ್ ಅ ಲಿಮಿಟ್ಲೆಸ್ ಅಪಾರ್ಚುನಿಟೀಸ್. ಅಕ್ಕ ಮಹಾದೇವಿ 12th ಸೆಂಚುರಿ, ಈಗಿಂದ ಬಿಟ್ಬಿಡ್ರಿ, 12th ಸೆಂಚುರಿನಲ್ಲಿ ನಾವು ಇವತ್ತು ನಮ್ಮ ಗಂಡಂದ್ರೆ ನಾವು ಒಂದು ಮಾತು ಇಗ್ನೋರ್ ಮಾಡಿದರೆ, ಅತ್ತೆ ಮಾವ ಒಂದು ಹೇಳಿದ್ದನ್ನು ಮಾಡಿದರೆ ನಮಗೆ ಎಷ್ಟು ಒಂದು ಪಾಪ ಪ್ರಜ್ಞೆ ಕಾಡ್ತದೆ. ಯು ಜಸ್ಟ್ ಇಮ್ಯಾಜಿನ್, ಅವಳ ಗಂಡ ದೊಡ್ಡ ಮಹಾರಾಜ ಅಂತಹ ಮಹಾರಾಜನನ್ನು ಅವಳು ಏನು ಮಾಡ್ರಿ ಧಿಕ್ಕರಿಸಿದಳು. ಯಾಕಪ್ಪ ಅಂದರೆ ಶಿ ಹ್ಯಾಸ್ ಹರ್ ಓನ್ ಪ್ರಯಾರಿಟೀಸ್. ಅವಳು ಆಧ್ಯಾತ್ಮದೆಡೆಗೆ ಇದ್ಲು, ಇಂಟೆಲೆಕ್ಚುವಲ್ ಪರ್ಸನ್ ಅವಳು. ಅದನ್ನು ಜಸ್ಟ್ ಸ್ಟಾಪ್ ಮಾಡಿ ಶಿ ಮೂಡ್ ಔಟ್. ಇಲ್ಲಿಯವರೆಗೂ ಅಕ್ಕನಂಥವರ ಒಂದು ವೈರಾಗ್ಯ ಮಣಿಯನ್ನು ನಾವು ಆಧ್ಯಾತ್ಮದಲ್ಲಿ ಇಲ್ಲಿವರೆಗೂ 21ನೇ ಶತಮಾನಕ್ಕೆ ಬಂದರೂ ಸಹಿತ ನಾವು ಯಾರನ್ನೂ ಕಾಣ್ತಾ ಇಲ್ಲ ರೀ. ಶಿ ಹ್ಯಾಸ್ ಸೋ ಮಚ್ ಕೆಪಾಸಿಟಿ. ಒಂದೇ ಒಂದು ಫಿಯರ್, ಆ ಗಂಡ ಮತ್ತು ಸೊಸೈಟಿ ಅನ್ನೋ ಫಿಯರನ್ನು ಅವಳು ಬಿಟ್ಟಿದ್ದರಿಂದ ಶಿ ಹ್ಯಾಸ್ ಕ್ರಿಯೇಟೆಡ್ ಅ ಸೋ ಮಚ್ ಆಫ್ ಲಿಬರೇಷನ್ ಅಮಾಂಗ್ ದ ವುಮನ್. ಇಷ್ಟು ಸಾಕಲ್ರಿ. ಒಂದು ಸಣ್ಣ ಮಲೈಲಾನ್ ತಗೊಳ್ರಿ. ಮಲಾಲಾ ಏನಿದ್ಲಲ್ಲ, ಶಿ ವಾಸ್ ಅ ಸ್ಕೂಲ್ ಗರ್ಲ್. ಒಂದು ಸ್ಕೂಲ್ ಗರ್ಲ್, ಕ್ಯಾನ್ ಯು ಇಮ್ಯಾಜಿನ್ ಅ ಸ್ಮಾಲ್ ಸ್ಕೂಲ್ ಗರ್ಲ್ ಕ್ಯಾನ್ ಏನ್ರಿ ಇವರು ಒಂದು ಗ್ರೂಪ್ ಆಫ್ ಟೆರರಿಸ್ಟನ್ನ ಫೇಸ್ ಮಾಡ್ಬೋದು ಅಂತ ಹೇಳಿ ಕ್ಯಾನ್ ಯು ಇಮ್ಯಾಜಿನ್? ಶಿ ಹ್ಯಾಸ್ ಫೇಸ್ಡ್ ಆ್ಯಂಡ್ ಶಿ ಹ್ಯಾಸ್ ಕ್ರಿಯೇಟೆಡ್ ಅಪಾರ್ಚುನಿಟೀಸ್. ಸೊ ಇಲ್ಲಿ ಎಲ್ಲರೂ ಏನ್ರಿ ಭಾಳ ಫಿಯರ್ಲೆಸ್ ವುಮನ್ ಇದ್ದೀರಿ, ಎಂಪವರ್ಡ್ ವುಮನ್ ಇದ್ದೀರಿ, ಹ್ಯಾವ್ ಆಲ್ ದ ಕ್ವಾಲಿಟೀಸ್. ಸೊ ಫ್ರಮ್ ದ ಕೋರ್ ಆಫ್ ಮೈ ಹಾರ್ಟ್ ಐ ವಿಲ್ ರಿಕ್ವೆಸ್ಟ್, ದಯವಿಟ್ಟು ಸ್ವಲ್ಪ ಸೊಸೈಟಿನಲ್ಲಿ ಓಪನ್ ಅಪ್ ಆಗ್ರಿ. ಸೊ ನಿಮ್ಮಂಥ ಎಂಪವರ್ಡ್ ವುಮನ್ನು ಸೊಸೈಟಿನಲ್ಲಿ ಓಪನ್ ಅಪ್ ಆದರೆ ಕ್ಯಾನ್ ಕ್ರಿಯೇಟ್ ಅ ಲಿಮಿಟ್ಲೆಸ್ ಅಪಾರ್ಚುನಿಟೀಸ್ ಅಂತ ಹೇಳಿ, ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್ ಫಾರ್ ದ ಗ್ರೇಟ್ ಅಪಾರ್ಚುನಿಟೀಸ್. ಥ್ಯಾಂಕ್ ಯು.
Thank you, madam, for the elaborate talk. Indeed, facing a fear opens up a lot of opportunities for a woman. I would request our chairpersons to add on to their views and give their opinions.
Search the power in her. And recently I had been to Delhi. What I saw in the flight was there were 2 lady pilots and all 4 ladies. Only with the women we traveled up to Delhi who are driving a flight means think over where we can reach. Thank you, madam. It was wonderful.
ಚಾರ್ಜ್ ಇದೆಯಲ್ಲ ಅಷ್ಟೊಂದು ಬರುತ್ತೆ. ಇಲ್ಲ ಅದೇ ಕರೆಕ್ಟ್.
I would like to call upon stage Dr. Veena Satish, practicing obstetrician and gynecologist at Sri Channabasava Swami Nursing Home, Gangavathi. We welcome you, madam. Our next talk is on the topic endocrine disruptive chemicals and women's health. For this, I would like to invite on stage our next speaker. Please escort madam on stage. Rane Bannoor, practicing gynecologist at Vidya Hospital, Rane Bannoor, to please introduce Dr. Chandan Kamath to our delegates.
She is an expert in managing disorders of thyroid, pituitary and reproductive system. Welcome you, madam. And I also thank organizers for giving me this opportunity. Thank you so much.
Good morning to all of you. Thank you very much for the kind introduction, and I'd like to thank the organizing committee as well for giving me this opportunity. I think we've had two brilliant, powerful and empowering talks today. And I firmly believe that when you have knowledge, we are bound by duty to use it, to make use of this knowledge. And this is a famous quote by a very famous scientist, Albert Einstein, and I firmly believe in it as well. So my today's topic or talk is going to be on endocrine disruptors. Now it's a slightly different topic, and I didn't want to bore you with diabetes and other endocrine problems like thyroid. So what are endocrine disruptors? And how do they affect us in our day-to-day life, our health, and even our progeny, so our children, our grandchildren in the future. So I'd like to start with this famous quote: poison is in everything, and no thing is without poison. Now, what matters is the dosage. The dose makes it either a poison or a remedy. I think we all firmly believe in this as well. So, has anybody heard of atrazine? Anybody who's heard of atrazine? It's a very, very commonly used herbicide all over the world, a lot in our country as well. Ideally, it should have been banned, but it hasn't been banned, unfortunately, even though there are a lot of studies, thousands of studies, which have shown how harmful it is. It's commonly used in sugarcane and cornfields. So all the sugar that we're consuming, all the maize, corn that we're eating is laced with atrazine. And why is it so important? So a few years ago, they did a study. Am I clear? So a few years ago, they did a study on frogs in America. Okay, so what they found was when male frogs were exposed to tap water containing atrazine, the male frogs developed female anatomy. Okay, and that is very disturbing. So they had the male organs as well as they grew female organs. And how did and why did this happen? So what atrazine does is, and most of the other endocrine disruptors, what they do is they interfere with the hormones. So atrazine, especially atrazine, it interferes with aromatase enzyme. So I think we have a lot of gynecologists here, yeah, and I think a lot of oncologists as well. So testosterone gets converted to estrogen by aromatase. And letrozole is an anti-aromatase. It's an aromatase inhibitor. So atrazine was actually converting males to females. Confusing? So if this can happen in frogs, and this is just one herbicide, one pesticide that is doing it, can you imagine the cumulative effect of numerous pesticides? So we're not just going to talk about pesticides, we're going to talk about other endocrine disruptors as well. But I think just going back to physiology, MBBS days, why is the endocrine system so important? So there are two main systems in the body that are very important. One is the nervous system, the second is the endocrine system. So both these are interlinked. Any problem with one, the other is affected, and it can cause a lot of disorders. So as we all know, the endocrine system is made up of many glands that produce and secrete hormones that regulate growth. They are involved in metabolism, sexual development and function. So hormones, they are chemical messengers which signal, transfer information from one set of cells to the other. And that is how a homeostasis is maintained. So when we look at endocrine disruptors, so what is an endocrine disruptor? Now the WHO says that if any substance meets these three criteria, which is a substance is considered as having an endocrine disrupting property if it shows an adverse effect in an intact organism and its progeny. So not just the organism, maybe the organism is not affected, maybe I am not affected, but if my child or my grandchild is affected because of me being exposed to this substance, and if it has an endocrine mode of action, so it has to alter the endocrine system. And the adverse effect is a consequence of the endocrine mode of action. Now, endocrine disruptors, or shortly we'll call them as EDCs, they are present all over the place, everywhere, in the soil, in the water, in every food product that you eat, in the things that you use, plastics, your utensils, everywhere. The clothing, sometimes you have flame retardant clothing, those all have EDCs. So in 2015, the Endocrine Society in America, they analyzed over 1,800 studies on EDCs, and what they found was that there was clear evidence showing that there was a link that these endocrine disruptors disrupted the hormone system between males and the female reproductive, and caused female reproductive disorders. Also led to obesity, diabetes, hypertension, immune problems, a whole set of anything and everything that has got to do with your health. So how do this work? So if you look at the first picture on the right, what you see is when these endocrine disruptors are absorbed, they can either increase or decrease your hormone levels. So endocrine disruptors mimic hormones. So you have hormone receptors in the cell. These endocrine disruptors, they compete with the actual hormone in the blood, and they go and either stimulate or inhibit the hormone receptors. They can also mimic the natural hormones of the body and cause the same effect as the hormones, or they can alter the signaling. So they can actually cause disorders by inhibiting the signaling. So either ways, what they do is they throw off our hormone balance. And from a physiological perspective, an endocrine disrupting substance is a compound that interferes with the synthesis, secretion, transport, metabolism, binding action, or even elimination of natural hormones. And they're responsible for the homeostasis, reproduction, and developmental process. So should we care about endocrine disruptors? Should we? Yes or no? We should. I think we should. It is the need of the hour now that we should care about these endocrine disruptors because now there is a lot of information that is available, which was not available about 20 years ago when actually we were getting exposed to all these endocrine disruptors. This didn't start today or yesterday. This has started a few decades ago when the industrialization happened, everything flourished, agriculture flourished, but it all came at a cost. And that cost is going to be either borne by us or by our progeny. So not just you, your children, your grandchildren are going to be affected. Because I'm not sure how many of you are aware that research has recently shown that you are not what your parents, your mother ate, you are what your grandmother ate. So if your grandmother ate well, so you're a tiny little egg, so I'm talking about the females. You're a tiny little egg in the ovary of your mother who's a fetus in your grandmother's womb. So whatever your grandmother ate has a direct effect on what you are today. So if you have any health issues, or if anybody has any cancers or anything, this is because your grandmother was exposed to these endocrine disruptors. So I think my grandmother did well so far. I'm doing well. So why should we care, right? So endocrine disruptors, why should we care? There are at least 3 good reasons, I think, that we all should be worried about. Now, endocrine disruptors can harm every organ in our body. So there's no one organ that is spared, okay? And this danger starts in the womb, like I said. And they're everywhere. In the air that you're breathing right now, I may have a lot of endocrine disruptors in my body. You may have a lot of endocrine. We don't know about it. We only know when we actually have a problem. Okay? And lastly, this is very sad but very important. Even though there is research that shows that endocrine disruptors are causing havoc with our health, are going to cause havoc with our children's health and our future generations, we don't have strict regulations. I don't know how many of you follow, but there were a lot of pesticides which were banned, and the ban was recently revoked in India. I'm just talking about India. And I just gave you an example of atrazine, which is still freely available, manufactured, sold, used abundantly in all the fields. Maybe the farmers are not aware, maybe the regulatory authorities don't want to take action. We still don't have a strong voice against this. So endocrine disruptors, like I said, are present everywhere, and the top 5 classes of endocrine disruptors are metals, synthetic or naturally occurring hormones, pesticide, herbicides and fungicides, and all our food is laced with it. Personal care products, okay, and pharmaceutical drugs. Most of them are man-made, they're manufactured, and there are over 80,000 endocrine disruptors, and thousands of them are probably responsible for causing all health problems. But unfortunately, because whenever you do a study or research, you look at only one compound. So we know the effect of only one compound. We don't know the effect, the cumulative effect. Maybe there are 5 or 6 or 10 of them. We don't have pooled data for that. And let's start with metals, okay? Now with metals, unfortunately, so you have, heavy metals like lead, cadmium, mercury. These are toxic to humans even in very, very minuscule amounts. Even very tiny doses are very, very harmful. And the problem with heavy metals is they are non-biodegradable. So if you look at biodegradable compounds, sometimes they may degrade into less harmful products, but with heavy metals, they stay as it is for thousands of years. So if I have lead in my body, it'll probably be there till I die, stored in my organs. So there are certain metals like copper, zinc and manganese which are required for our functioning, but in very tiny amounts. So when these amounts exceed the permissible values, that is when the problem starts. And I think at the moment there is a lot of fad about drinking, water in copper bottles. Have you checked your copper levels? No. But because somebody forwarded a message on WhatsApp or Instagram or whatever, drink water in copper. How do you know how much copper is already present in your body? And after drinking water from these copper bottles, how do you know what it's going to do to your body? We never think of it. We just follow, okay, this is good, let's do it. Because Dr. WhatsApp has said it. So coming to synthetic and naturally occurring hormones, I think we're all aware of phytoestrogens. So there's a lot of people who consume a lot of soya products. And they all contain phytoestrogens. Yes, they can be helpful in patients who are perimenopausal or menopausal, helps in relieving symptoms, but at what dosage? How much estrogen are you using? What is it going to cause later on? Now you may be feeling great because it's herbal. Yeah, there's this fad about consuming everything that is labeled herbal, but you don't know what it's going to do. And estrogen, most of the tumors, most of the cancers, you take breast cancer, endometrial cancer, they're all estrogen dependent. Okay? Then coming to DES, this was I think in the 1970s. Probably a long time before most of you. So diethyl stilbestrol was a synthetic estrogen which was given in women having miscarriages, so to prevent miscarriages. But what it did was, if there was a male fetus, it caused problems in the male fetus. So the male fetus could be born with congenital abnormalities like hypospadias, cryptorchidism, later on develop prostate cancer. The females again had a very high risk of breast cancer later on in life. And these women were called DES women. So all these offsprings were born to women who were exposed to DES. So I don't think we use it now anymore. And lastly, androgenic steroids or anabolic steroids, which a lot of fitness enthusiasts and bodybuilders use in your gyms because they want to have a muscle mass, they want to have a great body. What does it do? Oligospermia, azoospermia, infertility, subfertility, hypogonadotrophic hypogonadism in the men. And they don't realize, they only, when these young chaps who want to get, fit or have a Sylvester Stallone or a Hrithik Roshan body, and then once they get married, they find out they have all these problems, and then they come, and most of these are irreversible. So they become infertile at a very young age. At what cost? So coming to pesticides, herbicides, most pesticides will have an adverse effect on thyroid hormones. I think about 15-20 years, we didn't hear men having thyroid problems. It was always the women who had more thyroid problems. What do we see now? At least I see in my clinic an almost equal male to female ratio of thyroid problems. And why is this happening? They say, my parents, nobody has it. There's no family history of thyroid problems, but I've still got this. And endocrine disruptors could be one of the causes. Our food is laced with pesticides, which we don't realize because we can't see it, so we don't know about it, we don't think about it. And I think gynecologists here, you're seeing a lot of precocious puberty, before the age of 8. Young girls, they're still children, and they already hit puberty. There's also an increased risk of cervical cancer, endometriosis, a lot of PCOS now. There's like a huge rush of PCOS. The incidence has gone up drastically. Recurrent abortions, recurrent miscarriages, that is all happening. And the most common, I think you're all familiar with DDT. I think 15-20 years ago, everybody, even now, everybody was very fond of DDT. You see ants put DDT. That all goes and sits in the soil, percolates through the layers of the soil, contaminates the groundwater. And where does it end up? How much ever you filter, you boil your water, this is not going to go away. It goes into your body. And all these endocrine disruptors, majority of them are fat-loving, they're lipophilic. So go and settle in your fat. So there is no way to get rid of it. You cannot detoxify. That is one more different area I don't want to get into. Personal care products, all ladies, all beautiful ladies here. Starts from shampoos, powder, lipstick, mascaras, whole lot of makeup products. I don't know what all is there in the market already. All your makeup products. Have you ever checked the contents? Does anybody actually read the content? Actually, even if you try to look at the contents, it is in such a tiny, print that you actually can't read it. But majority of the cosmetics, they contain paraben, which is a preservative, which is very, very harmful. Very harmful. Then you have triclosan. COVID came, everybody started using antibacterial hand washes. Triclosan is an antibacterial. What does it do? It is an endocrine disruptor. What should you do instead of antibacterial hand wash? Use plain soap and water. Use the 2-minute rule, which is very easy, isn't it? But we don't want to do that. We want high funda, antibacterial, anti-COVID, anti-everything, which is laced with triclosan. Phthalates, keratin shampoos, you have all these hair straightening treatments, hair fall shampoos, laced with phthalates. What does it do? Gets absorbed through your skin. So there is dermal absorption as well with all these chemicals. Goes, sits inside your body. It won't cause any harm to you. Maybe you might get away with it, but your grandchildren, your child, your daughter, or if somebody is pregnant, that fetus is going to get affected and the next progeny is going to get affected. So maybe your granddaughter might question you, what did you eat when you're pregnant with mommy? Yeah? Because we never think about all these things. Drugs, again, man-made drugs. You have birth control or OC pills. Sometimes if there is abuse, yes, they can cause problems. Not if they're prescribed and you've been taking it, in a therapeutic dose. Some people can abuse them. Hormone replacement therapies as well. If somebody's on thyroxine and starts abusing it, for weight loss, which it is not meant for, this can cause problems. Steroid medications, again, we see a lot of steroid being prescribed in a lot of over-the-counter medications. Again, herbal. You don't know what is there in that powder. Is it steroid? Is it prednisolone? Is it dexamethasone that has been crushed and given to you? Because The first week when you get steroids, you feel like a superman, you feel energetic, you think, oh, this doctor is great, I feel great. And then the problem starts later on. So what are the effects? So endocrine disruptors, like I said, they affect every organ, every part of every system in your body. So it can cause metabolic disorders like obesity, diabetes, hypertension, reproductive health issues, infertility, irregular menses, menorrhagia, PCOS, everything. Thyroid-related disorders. It can affect your immunity. It can cause osteoporosis. It can cause neurological disorders. You see a lot of children with ADHD now. This was unheard of in the past. We didn't have so many children with ADHD, attention deficit. And this is all because of what we are feeding them. We don't realize. And hormone-related cancers. So I'm going to stress more on the reproductive effects in women, like I've already mentioned. So it mainly affects the fertility of women. So exposure to high level of PCB. So PCB is polychlorinated biphenyls. And these have shown in studies to affect the, not just reproductive system, it affects the immune system as well. Endometriosis, a lot of patients with endometriosis, irregular menses, PCOS, precocious puberty, again, like I've mentioned. And there's a whole lot of chemicals there, the list, I won't go into details. But this is where, either the mother or the grandmother has been exposed, and that's how the child ends up with these. In the main, I'm going to briefly touch upon, but mainly it affects the sperm quality. So the decrease in sperm count, decrease in quality, decrease in semen volume, and it can lead to infertility. So some of the EDCs that we use on a daily basis, I think commonly found in every household. Sugary beverages. How many of you don't drink sugary beverages, carbonated drinks? I want a hand raise. I'm so glad I'm seeing more than 10 hands. Okay? And in the next slide, you will be very happy why you're not using it. The dirty dozen fruits and vegetables. Has anybody heard of it? No? So these are a dozen of fruits and vegetables that have been laced with herbicides or pesticides. I'll be done. Plastic toys, food grade plastics and Teflon coated. So I'll quickly go through. So this is the amount of sugar. These that is present in each, in a can, in a 100 ml bottle and in a 500 ml bottle of sugary beverages. So apart from causing obesity and diabetes, this also contains, the plastic bottles contain BPA. You must have heard of this, BPA free. Okay, these cans and bottles are laced with BPA, and what BPA can do is it can cause hypertension, and it also alters the estrogen receptors, so increasing risk of cancer. Dirty dozen fruits are, the apples, pears, your cherries, strawberries, a lot of strawberries in the market. We don't know whether they are organically grown, but they're laced with pesticides. Simple things like tomatoes that we use on a daily basis, highly contaminated. Whether you wash them or peel them, they're fully laced with pesticides. Plastic toys. The kids are very fond of slime and molding clay. That is highly laced with boron, and boron can affect children's reproductive system. So you won't know now what is affecting your child. When your child grows up, when your patient comes, this is what is happening. Lead, cadmium and phthalates, again, they're all found in toys. There's no regulation what toys are sold in the market. So we just buy it and hand it to the child. Cadmium, again, is can cause lung damage and cancer. Lead can cause anemia. You see a lot of chronic anemia in certain places where there is high agriculture. It is because of lead poisoning in the groundwater. Food grade plastics, I think you're all aware of these numbering system. Yeah, one is one-time use. So if you look at the bottom, yeah, and number 6 is plastic cutlery and styrofoam cups, which we never should be using for food, but they're used everywhere. Biggest endocrine disruptors. And black plastic of all. Anybody who orders takeaway, I think majority all families do now. Black plastic is the worst compared to all other food grade plastics because it cannot be recycled. It contains a carbon black pigments. They are carcinogenic, even in small amounts. Even if you get it and take the food out immediately, you're still exposed to a carcinogen. Teflon coated utensils. How many of you don't use it? Dosas come out really well on non-stick. Yeah? So ideally you should not be using Teflon coated utensils, whatever it is. And if you do have to use, please use it at a medium-low heat, clean it properly, don't heat it to over 298 degrees because that is when all the chemicals, the PFS, leaches into your food. So you're literally eating the Teflon. Okay? What is a good alternative? Cast iron pans, stainless steel. Use stainless steel, use cast iron. I think cast iron is making a comeback now in the market. So like I said, effects of endocrine disruptors, affects the endocrine system, nervous system, causes cancer, affects your immune system. So what can we do? You know, what can you do? We can't stop eating, we can't stop living, we can't, ladies, can we live without makeup? Can we? No. Yes? Okay. So we can't do that, but at least we can take some measures to reduce the exposure. So reduce the use of your shampoos, your hair products, hair dyes, you know, every kind of polish and paints that you're using. Minimize it. Maybe use it on occasions rather than using it every day. Reduce the use of pesticides, promote organic farming. I think we can grow few vegetables in our terrace gardening or even in your garden or your balcony. Start from there. Consume less pre-packaged food. Everything that comes in a packet is laced with endocrine disruptors. No doubt about it. Everything that comes in a packet. Okay, your chips, your food products, anything that you're eating, your biscuits, everything is laced with endocrine disruptors. Young children, better to avoid soft plastic. Let them play out in the garden, you know, let them play in the mud. That's okay. You know, rather than exposing them to carcinogens. You know, go back to 20 years back. What did you do? What did you eat? You know, there was no Swiggy, no Zomato. I don't want them suing me, but you didn't have all these apps, you know. And reduce the use of heatable food-grade plastic. If you're using a microwave to heat your food, use a glass bowl. Don't use the plastic container. Because as soon as you heat food in a plastic container, all the toxins leach into your food. Okay, I think that's it. Thanks.
It was very nice and wonderful in their routine life, those which affect the endocrine disorders of our body. Thank you very much, Chandan.
All the viricides, fungicides, pesticides, insecticides, and weedicides are extensively used. And all this, when there is a rain, it is going into the soil, from there into the rivers again, as you already suspected. Very unfortunate, we are unable to stop. But the organisms have become so resistant that ordinary pesticides are not working anymore. And extensive use of these pesticides certainly do something to stop such wide and toxic use of these insecticides, madam.
Yes. So the farmer cannot survive. And if you do use, you're harming everybody around you. And I think there are certain ways that the government could take steps. But again, a lot of money is involved. This is money power. Because if you shut down industries producing all these herbicides and pesticides, I think the tax and the, whatever income the government gets goes down. But yes, I think there are certain places which have resorted to organic farming. So going back to using what is available in the nature, we have something like we used to have peacocks, and there were some birds that used to help the farmers, eat the insects. But now, unfortunately, with the concrete jungle that we have around ourselves, the birds have perished. We don't see sparrows anymore, which we used to see in abundance before, and they actually were helping the farmers. So I think we need to go back.
It is absorbed by the cattle, again the milk, and our children are drinking the same milk.
Milk I didn't mention because there's not much milk. A lot of the farms, dairy farms, are injecting their cows with oxytocin and a lot of other hormones, which is coming in the milk. And this milk you're feeding your child, thinking that it is good for their health. But I would strongly advise against it, because if you're worried about giving calcium to your child, I think it is safer to give a tablet of calcium, because you know exactly how much calcium is going, and you're sure that there is no endocrine disruptor going into your child. because we don't know what the milk is laced with and whether it's actually milk. There's a lot of paneer also. There's no research on it. But have you ever thought of where the paneer comes from? We are not a milk producing country. We are more agriculture, but we are not the largest producer of milk in the world. European countries are the largest producer of milk. So have you ever thought every dhaba, every small restaurant, every takeaway has at least minimum 10 items of paneer on their list? Have you ever wondered where this paneer is coming from? Is it really paneer? So every time you put something in your mouth now, I want you to think, where is this coming from? Where is this sourced from? At least that way your calorie intake also will be better, I think.
Indeed, madam. For weight loss also a lot, there's Herbalife is a fad nowadays. So what is your opinion and what is your take on that?
I would ask you to Google Herbalife. There is a very good paper by a very famous gastroenterologist from Kerala who has now been sued by this company that you've just mentioned. I'm not going to take the name because I don't want to get sued because there's a lot of big parties involved. But we have seen a lot of cases with liver failure. If you really want to lose weight the healthy way, go back 20 years. Start walking at least 30 minutes a day, which nobody does. I'll go to the gym, I'll join this, I'll do keto diet and I'll do this diet. No, go back 20 years. What did you eat? Roti, kal palya, tarkari, salad, mosru. Very healthy North Karnataka diet. Please follow it. No, what do? I'm really tired. 20 minutes delivery. Nobody wants to even walk nowadays. When I ask my patients, please walk 30 minutes every day. I don't have time. I'm really busy. If you can't take out 30 minutes out of your life for yourself, there's no point living. If you can't take 30 minutes out of 24 hours for yourself, only 30 minutes. Instead of sleeping 8 hours, sleep 7 hours. Spend 1 hour for your health. Drink 8 glasses of water. Nobody wants to do that. What do they want to do? Drink beverages, Coke, your Pepsis, your whole lot of carbonated beverages. Quick instant food, all the noodles. I might get sued after this, I think. All the instant noodles that you're feeding your children, that is poison. I don't have any word for it. Junk food should not be called junk food. It should be called only junk. What is junk? Kabad, raddi. What do you do with raddi? You don't even keep it at home. But what are we doing? We are putting it inside our body. We are wearing branded clothes, the topmost quality clothes. But what are we putting inside our body? Junk. And we don't even think twice about it. I had a doctor patient and she was very addicted to one of the very popular noodles. And I said, you have to stop eating it. That's the first thing. I can't give you any medications. She stopped coming to me.
What about RO water? Hello. Kindly tell us about RO water, ma'am. RO water.
RO water, it's good if it's filtered and it's good, but the TDS level has to be maintained. And I think there is a 150 to 200, if I'm not right, has to be maintained. If it is too low, it means your water doesn't contain any of the essential minerals. So always check the setting of your RO water. And it's very simple. You get this device online and you can do a home check.
Thank you, madam. Thank you for the elaborate and very informative talk. Chairpersons to please accept a
Ladies and gentlemen, there's a small announcement about the banana fiber stall. Actually, I give a small introduction about this. In 1998, TKT founder focus was on developing local livelihood opportunities for women based on the natural ecology of the region. All proceeds from product sales support these livelihood initiatives and help the women of the village to earn an independent income while also creating a space where they can work together, share their experiences, and learn from one another as a family. And this reflects the core values of creativity, friendship, and community that underpin all of the Kishkinda Trust initiatives. This is purely made from sustainable, environmental friendly products, banana fiber, and water hyacinth. So, ladies and gentlemen, whenever you're free, you can just feel free to walk around Lions Bhavan. It's just adjacent to the left of the hall. There are many products for sale. You can just have a token of it as a remember piece. Thank you.
Kind attention, dear delegates. There is a creative made in Gangavathi art store in the Lions Bhavan, the building beside the IMA, where all unique items have been displayed, ranging from home decor to clothing to diyas to artworks. These have been exclusively handmade by our talented Maitris and few artists. Please take time to stroll around. In fact, this has an interesting story behind this. This art journey of ours started 2 years back when we attended a Madhubani folk art online workshop conducted by artist Shilpa Kalburgi from Bangalore as a part of Women's Division Wing activity last year. You can please turn around and just graze around, and you can see all the artworks that have been displayed, which are adding more charm and elegance to our IMA hall. This art exploration of ours also continued this year with a different office bearers, but with the same enthusiasm. This year we have tried our hands on the very famous Tanjavur painting, and those are the peacock art motifs which have been used to decorate our photo booth. This never-ending exploration of more and more art forms, digging deep into Indian history and culture, prompted us to come with an unique idea of setting up a stall to exhibit all the art pieces done by our very own Maitris. This in turn gave birth to our Made in Gangavathi art store, which is being more inclusive because each art piece is unique and there is no duplicate. The intention of this whole concept was to open a new corridor for Make in India, and also to introduce you and also to encourage others to enter into this art journey. Hope this idea triggers more and more artworks. It's now time for the official inauguration of Anjana 2023. The theme of this conference being Dream, Believe and Achieve, celebrating all that we are. At the outset, I welcome all the dignitaries to Gangavathi, the rice bowl of Karnataka. We hope your Creation Wing of IMA award function will be conducted after the last talk before the cultural program begins.
Gather in the IMA hall for the official inauguration ceremony.
We shall now start our inauguration ceremony. I request President of IMA Gangavathi, Dr. K.N. Madhusudan sir, to preside over the function. We welcome you, sir.
Next guest, I request Dr. Indumati. She is the Director of Health and Family Welfare Services, Bangalore. I request Dr. Medha to escort Dr. Manjula is escorting her. I request Dr. Rajeshri Anagol, Women Vice President, IMA KSB, to please come onto the dais. Welcome you, ma'am.
We request Dr. V.V. Chiniwala, sir, President-elect IMA KSB 2324 to please come over to the stage.
I request Dr. Anita D., Joint Secretary, IMA KSB, to please come onto the stage.
I request Dr. LD.
Next guest, I request Dr. Manpreet Kaur, our Chairman, WDW, IMA KSB, to please come onto the dais. Welcome you, ma'am.
Please grace the stage.
I request Dr. Anita Shashidhar, who is the Organizing Secretary for Anjana 2023, to please come onto the stage.
I request Dr. Mahantesh Patan Shetty, Honorary Secretary, IMA Gangavathi, to please grace the stage.
I request Dr. Vinay Gunjali, he is the Honorary Treasurer of IMA Gangavathi, to please come onto the stage.
We request Dr. Sulochana Venkatesh, Honorary Treasurer, IMA Women's Division in Maitri, to please come out to the stage. We shall now start the inauguration ceremony by seeking the blessings of the Almighty. For this, I request Dr. Rajashree Haivadana and Srimati Shanta Joshi Madam on stage.
Jaya 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 He Bhagavati Sura Bharati Tava Charanau Pranamamaha. Jaya Jaya He Bhagavati Sura Bharati Tava Charanau Pranamamaha. Nada Brahmamayi Jaya Vageshwari. Nada Brahmamayi Jaya Vageshwari. Sharanam Te Gacchamaha. Jaya Jaya He Bhagavati Sura Bharati Tava Charanau Pranamamaha. Tvamasi Sharanya Tribhuvana Dhanya Suramuni Vandita Charana. Tvamasi Sharanya Tribhuvana Dhanya Suramuni Vandita Charana. Navarasa Madhura Kavita Mukhara. Navarasa Madhura Kavita Mukhara. Smita Ruchi Ruchira Bharana. Jaya Jaya He Bhagavati Sura Bharati Tava Charanau Pranamamaha. Asina Bhava Manasa Hamse Kundatu Hina Shashi Dhavale. Asina Bhava Manasa Hamse Kundatu Hina Shashi Dhavale. Hara Jadatam Kuru Buddhi Vikasam. Hara Jadatam Kuru Buddhi Vikasam. Sita Pankaja Tanu Vimale. Jaya Jaya He Bhagavati Sura Bharati Tava Charanau Pranamamaha. Lalita Kalamayi Gnana Vibhamayi Veena Pustaka ललितकलामयी ज्ञानविभामयी वीणापुस्तकधारिणी मतिरास्तानो तव पदकमले मतिरास्तानो तव पदकमले ऐकुण्ठविषहारिणी जय जय हे भगवति सुरभारती तव चरणौ प्रणमामः 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 प्रणमामः.
Thank you. Now I request our Secretary IMA Gangavathi, Dr. Mantesh Patan Shetty, to deliver the IMA prayer and flag salutation.
ಪ್ರಾರ್ಥನೆ. ಎಲ್ಲರೂ ಸಂತೋಷವಾಗಿರಲಿ, ಎಲ್ಲರೂ ಆರೋಗ್ಯವಾಗಿರಲಿ, ಎಲ್ಲರೂ ನೋವಿನಿಂದ ಮುಕ್ತವಾಗಿರಲಿ, ಎಲ್ಲರೂ ದುಃಖದಿಂದ ಮುಕ್ತವಾಗಿರಲಿ, ಎಲ್ಲ ಆಸೆ ಆಮಿಷಗಳನ್ನು ಮೀರಿ ಗುಣಪಡಿಸುವವರು ನಾವಾಗಿರಲಿ. ಧ್ವಜವಂದನೆ. ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘದ ಸದಸ್ಯರಾದ ನಾವು ನಮ್ಮ ರಾಷ್ಟ್ರಧ್ವಜಕ್ಕೆ ವಂದನೆ ಸಲ್ಲಿಸಲು ಇಲ್ಲಿ ನಿಂತಿದ್ದೇವೆ. ಅದರ ಗೌರವ ವೈಭವವೇ ನಮ್ಮ ಬೆಳಕು ಮತ್ತು ಶಕ್ತಿ, ಅದರ ಪಥವೇ ನಮ್ಮ ಪಥವು. ಈ ರಾಷ್ಟ್ರೀಯ ಸಂಸ್ಥೆಯ ಮಾನ್ಯತೆ ಪಡೆದ ಸದಸ್ಯರಾದ ನಾವು ನಮ್ಮ ಜವಾಬ್ದಾರಿಗಳನ್ನು ಅರಿಯುವ ಮೂಲಕ ಅದಕ್ಕೆ ನಮ್ಮ ನಿಷ್ಠೆಯನ್ನು ತೋರಿಸುವ ಪ್ರತಿಜ್ಞೆ ಮಾಡುತ್ತಿದ್ದೇವೆ. ದೇಶ ಸಮೂಹಗಳ ನಡುವೆ ನಮ್ಮ ರಾಷ್ಟ್ರಧ್ವಜವು ಉನ್ನತ ಮಟ್ಟದಲ್ಲಿ ಹಾರಾಡುವ ಸಲುವಾಗಿ ನಮ್ಮ ಅಧಿಕಾರದಲ್ಲಿರುವ ಎಲ್ಲವನ್ನೂ ಅದಕ್ಕೆ ಸಮರ್ಪಿಸುವ ಪ್ರಮಾಣ ಮಾಡುತ್ತಿದ್ದೇವೆ. IMA ಚಿರಾಯುವಾಗಿರಲಿ. Please sit down.
Secretary of IMA Women's Division Wing, Gangavathi, the SG, to please welcome this August gathering.
Good afternoon, everyone. A big change is a result of hundreds of tiny steps, and they all count. I welcome Dr. Indumati Madam, Director of Health and Family Welfare Services, Bengaluru. I welcome Dr. Shivkumar Lakhol Sir, State President, IMA, Karnataka. I welcome Dr. Rajashri Angol, Women Vice President, IMA, KSB. I welcome Dr. Venkata Chalapati, Balke, Assistant Secretary, IMA, KSB. I welcome Dr. Manpreet Kaur, Telia, Chairman, WDW, IMA, KSB. I welcome Dr. V.V. Chinwalar, Sir, President-elect, IMA, KSB. Sorry, sir. I welcome Dr. Sulochana Chinivalar, Organizing Chairman, Anjana 2023. I welcome Dr. Mahantesh Patan Shetty, Honorary Secretary, IMA, Gangavathi. I welcome Dr. Vinay Gunjali, Honorary Treasurer, IMA, Gangavathi. I welcome Dr. Sulochana Venkatesh, Honorary Secretary, Treasurer, IMA, Maitri. I welcome all the delegates to Gangavathi to attend this conference and make it successful. You welcome everybody.
We heartfully welcome the media also, the press persons who came over here and taking all the pains. Thank you so much. And now it's time for the official inauguration of the conference. Light is a symbol of knowledge and wisdom. It's a symbol of happiness and prosperity. Let us all get together and formally inaugurate
this event.
दीपज्योतिर्जनार्दनः दीपो हरतु मे पापम् सन्ध्यादीपनमोऽस्तु ते ओ दीपब्रह्मरूपस्त्वं ज्योतिषां प्रभुरव्ययः ओ दीपब्रह्मरूपस्त्वं ज्योतिषां प्रभुरव्ययः आरोग्यं देहि पुत्रांश्च मतिं स्वच्छां हि मे सदा रवेरस्तं समारभ्य यावत् सूर्योदयो भवेत् रवेरस्तं समारभ्य यावत् सूर्योदयो भवेत् यस्य तिष्ठे गृहे दीपः तस्य नास्ति दरिद्रता शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय
I heartfully thank all the dignitaries for the honors.
दीपज्योतिर्नमोऽस्तु ते शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः शुभं
Delegates who have come all over from such long distances, and I think they're really enjoying the conference and will keep up to the expectation. Please stay up to the last.
As we proceed further, a heartfelt gratitude to all the delegates who have graced us with their presence and all the volunteers working tirelessly for things to run smoothly, and the media. I would now like to invite President of IMA Women's Division Wing, Karnataka State, Dr. Manpreet Kaur, Madam, to the dais and ask Madam to speak a few words. I request Dr. Shruti Bhavi Patil, Associate Professor of OBG, Gadag Institute of Medical Sciences, to please introduce Madam to our delegates.
Giving this opportunity. Manpreet ma'am is really a dear person to me since my undergraduate days. I'm really pleased and honored and more than happy to introduce her here today. During my undergraduate days, I first saw her as my external examiner, and I still remember her wearing that pink sari. And really, that was the stark which, I still remember her. We used to admire her, and we used to have crossover talks through our college, Alamein and Bijapur, that there's a very beautiful ma'am in OBG. So we used to always wanted to see her, and that was the first time when I saw her. And during my postgraduate days also, I had the opportunity to be in her unit as a postgraduate, and it was really wonderful. She was so meticulous, she was so passionate in her teaching, in her presentations, in her rounds. We could never be casual with her in her rounds. That was the fear we had with her as well. And just now my friend Ganga was saying, she's the same since 20 years. Yes, I do feel you're the same, ma'am, ever smiling, ever charming. And very few people, I think all of us have very few people in our life, like our parents, who are really caring, really genuine, a critic person who really cares for you, gives you the good advice. So, and I'm blessed to have Manpreet ma'am as one of them. Thank you so much, ma'am. And there's a very short and sweet CV which she has given, but I'm definitely sure she is more than her CV. Just to finish the formality, she's done her MBBS and MD in obstetrics and gynecology from Punjab. She's trained in GDM management and advanced obstetric ultrasound. She's a certified menopause practitioner and has a keen interest in cancer prevention. And she has a vast 23 experience of undergraduate and postgraduate teaching. Thank you so much, ma'am. We continue to admire you all my life. Thank you so much.
Indeed, it is such a pleasure, and it was a surprise, of course. It is such a pleasure to be introduced by our own student, a student who has, such a brilliant growth chart that I'm honored. And thank you so much, Shruti, for those words, those really kind words with your personal touch to it. I'm really humbled. Respected dignitaries and seniors on the dais and in the hall, dear friends and colleagues, at the outset, I wish to express my deep gratitude to the team of IMA KSP, Honorable President Dr. Shivkumar B. Lakkol sir, Dr. P.P. Karunakar sir, Honorary Secretary, Dr. Vijaya Sardi sir, Honorary Treasurer, Dr. Palke sir, Dr. Srinivas sir, the incoming President, Dr. V.V. Chenivalar sir, and all the other members of Team 22-23 for having given me this opportunity to work for IME KSP at the forefront as the chairperson of WTW IMA KSP. This has been a tenure in which the WTW branches continued rising up to everybody's expectations and doing activities which were empathetic, which were awe-inspiring, and also soul-satisfying for all the members. I am here to present the annual report of the WTW, and it is, believe me, very impressive. We have had 101 health camps done by the WT branches. There's too much to come. I think we'll have the claps. We will have to clap at the end of the tally that we have. We've had 139 health talks, 59 cancer-related activities, 32 school health camps, 35 school health talks, 14 activities dedicated to the girl child, 24 activities for the doctors, 10 yoga activities, 12 webinars, 8 awards won by the doctors, 22 health awareness walkathons, 5 rallies, 2 cyclothons, 12 TV talks on health radio talks, a series Namaste IMA started by the WTW branches, which has so far given 7 health awareness talks for the general public. We have had talks on mental health, involved parents in talks on mental health of children. Newspaper articles have been published on health awareness for the general public, 13 in total. YouTube videos on the girl child. We have had unique health talks like antenatal exercises and antenatal yoga, voters awareness talk on literature and religion, meditation and its role on cancer, stress management, behavioral problems in children, NSS awareness talk on first aid, financial literacy for women. We've had finally the state level conference which is being held in Gangavathi here. We've had another state level conference in which WTW Gadag took a part, that was Yuva Kasoga, and also the AMS state level conference at Tumkur annual AMS. We've had wonderful state level and workshops with a difference, that is CPR. We've had 4 workshops, BLS 2, this is all by WTW branches. Workshops on home composting, self-defense courses for doctors, first aid talks, street plays on health awareness, care of autistic children, and then we've had the reaching the unreached health checkup camps, checkups for in the destitute's homes, rag pickers colonies, senior citizens, grandparents of children. Finally, the feathers in the cap. A mammograph machine has been donated by IMA WTW Sirsi. A number of programs involving more than 75 free mammograms and 150 pap smears at one go in one camp done by the IMA WTW branches. We have ongoing free mammographies workshops. We have had donation of hearing aids, school bags and nutrition kits to pregnant women, cancer patients and patients belonging to the poorer societies. The torch bearers of WDW societies of IMA KSP, Gangavathi, Bhadravati, Hubli, Bangalore, Tumkur, Yelahanka, Gadag, Belagavi, Hassan, Dharwad, Sirsi, Hospite, Shivamoga, Udupi, Mangalore, Yelahanka, Bellary, Koppal. These are the pillars on which our WDW branches have been working strong and going ahead with a lot of enthusiasm. Bhadravati turned out to be the power-packed package with only 15 members and having won the prize for the most dynamic branch amongst the smaller branches. They have only 15 members. Gangavathi boldly stepped forward to host the annual WDW conference, and they have done a stupendous job, and I think I can see all the smiling faces, especially the photography corner, where a lot of different type of mood is prevailing, and then the scientific talks are in a different world itself. Now, the souvenir for this conference, the beautiful and meaningful souvenir that has been presented in the delegate kits, are the result of the hard work put in by Dr. Madhusudan Kariganur sir and Dr. Soumya YG ma'am. In the end, my annual report will not be complete till I mention the team WDW, IMA KSP, Dr. Anuradha Parmesh, Dr. Geeta Dopa ma'am, Dr. Shashikala Hosmani, Dr. Sulochana Chinivalar, Dr. Vidyavati Vaidya, and Dr. Soumya. These are the pillars on which the WDW subcommittee functioned this year. Their support was constant, enthusiastic, and unflinching. We conducted 7 webinars done by stalwarts in different subjects, 6 with the rising stars in their subjects. Shruti is one of them, and 8 PG Pathshalas. Also an old age camps, lepers colonies camps, and talks for inmates of correctional centers, were some of the activities which were conducted by us. And also a 4-line poem competition on the occasion of the National Girl Child Day. Overall, the year was full of activities for health and well-being. And with that, I'll end this talk, end this annual report, and make way for the interesting activities of the rest of the days. Thank you very much once again for giving me this opportunity. And I welcome wholeheartedly Dr. Indumati ma'am for having graced this occasion. Ma'am, it's an honor and a pleasure to have you with us. Thank you very much.
Dr. Sulochana Chinivalar madam, who is the organizing chairman, Anjana 2023, to please address the gathering.
ಆಸೀನರಾಗಿರುವ ನಮ್ಮ ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘದ ಅಧ್ಯಕ್ಷರಾದ ಡಾಕ್ಟರ್ ಲಕ್ಕೋಳ್ ಅವರೇ, ಹಾಗೂ ಇಂದಿನ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಮುಖ್ಯ ಅತಿಥಿಯಾಗಿ ಆಗಮಿಸಿದ ಮಹಿಳೆ ಮತ್ತು ಸಮಾಜ ಕಲ್ಯಾಣ ಇಲಾಖೆಯ ನಿರ್ದೇಶಕರಾದ ಡಾಕ್ಟರ್ ಇಂದುಮತಿ ಎಂ ಮೇಡಮ್ ಅವರೇ, ಹಾಗೂ ನಮ್ಮ ರಾಜ್ಯ ಶಾಖೆ ಚೇರ್ಮನ್ರಾದ ಮನ್ಪ್ರೀತ್ ಕೌರ್ ಮೇಡಮ್ ಅವರೇ, ಹಾಗೂ ಎಲ್ಲ ಉಳಿದ ನಮ್ಮ IMA ಅಧ್ಯಕ್ಷರಾದ ಡಾಕ್ಟರ್ ಮಧುಸೂದನ್ KN ಅವರೇ, ಹಾಗೂ ಎಲ್ಲ ರಾಜಶ್ರೀ ಅನ್ಗೋಳ್ ಮೇಡಮ್ ಅವರೇ, ಹಾಗೂ ಉಳಿದ ಎಲ್ಲ ವೇದಿಕೆ ಮೇಲೆ ಆಸೀನರಾಗಿರುವ ಗಣ್ಯಮಾನ್ಯರೇ, ಹಾಗೂ ಇಂದಿನ ಈ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಪಾಲ್ಗೊಂಡಿರುವ ನಮ್ಮ ಇಂದಿನ ಬೇರೆ ಬೇರೆ ಶಾಖೆಯಿಂದ ಆಗಮಿಸಿದ IMA WDW ಪದಾಧಿಕಾರಿಗಳು ಮತ್ತು ಸದಸ್ಯರುಗಳೇ, ಹಾಗೂ ಉಳಿದ ನಮ್ಮ ವೈದ್ಯ ವೃಂದದವರೇ, ಮಾಧ್ಯಮದವರೇ, ಹಾಗೂ ಇಲ್ಲಿಯ ನೆರೆದಿರುವ ಎಲ್ಲರಿಗೂ ನಾನು ನಮ್ಮ ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘ ಗಂಗಾವತಿ ಶಾಖೆಯ ಮಹಿಳಾ ವೃಂದದಿಂದ ಶುಭಾಶಯ ಮತ್ತು ಸ್ವಾಗತವನ್ನು ಕೋರ್ತಾ ಇದ್ದೇನೆ. ಇನ್ನು ಈ ಕಾರ್ಯಕ್ರಮ ಕುರಿತು ಒಂದೆರಡು ನನ್ನ ಅನಿಸಿಕೆಗಳನ್ನು ತಮ್ಮೊಂದಿಗೆ ಹಂಚಿಕೊಳ್ತಾ ಇದ್ದೇನೆ. ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮವನ್ನು ಗಂಗಾವತಿಯಲ್ಲಿ ಸಮಾವೇಶ ನಡೆಸಬೇಕೆಂದು ನಮ್ಮ ಅಧ್ಯಕ್ಷರಾದ ಲಕ್ಕೋಳ್ ಸರ್ ಹೇಳಿದಾಗ, ಕೇವಲ 1 ತಿಂಗಳು ಸ್ವಲ್ಪ ದಿನಗಳಿದ್ದಾಗ ಈ ಆಮಂತ್ರಣ ಬಂತು. ಇದನ್ನು ಹೇಗೆ ಮಾಡ್ತೀವಿ ನಾವು ಅನ್ನೋ ಒಂದು ಸ್ವಲ್ಪ ಅಡುಕುಂಟಾಗಿತ್ತು. ಆದರೂ ನಮ್ಮ ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘದ ಗಂಗಾವತಿ ಶಾಖೆಯ ಸದಸ್ಯರು ಹಾಗೂ ನಮ್ಮ ಮಹಿಳಾ ವೃಂದದವರು ಎಲ್ಲರ ಒಟ್ಟುಗೂಡಿ ಇದನ್ನು ಮಾಡೋಣ ಎಂಬ ತೀರ್ಮಾನಕ್ಕೆ ಬಂದು ತನು ಮನ ಧನ ಸಹಕಾರ ನೀಡಿ ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಈ ಹಂತಕ್ಕೆ ತಂದು ತಮ್ಮ ಮುಂದೆ ಇಟ್ಟಿದ್ದಾರೆ. ಇದಕ್ಕೆ ನಾನು ಎಲ್ಲರಿಗೂ ನಮ್ಮವರಿಗೆ ನನ್ನ ಹೃದಯಪೂರ್ವಕ ಅಭಿನಂದನೆಗಳನ್ನು ಸಲ್ಲಿಸ್ತಾ ಇದ್ದೇನೆ. ಇನ್ನು ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘ ಮಹಿಳಾ ಘಟಕ ಉದ್ದೇಶಗಳು ಏನು ಅಂದರೆ, ಇದನ್ನು ಕೇಂದ್ರ ಶಾಖೆಯವರು ನಾವು ಮಹಿಳೆಯರು ವೈದ್ಯರಾಗಿ ಬರೀ ಮಕ್ಕಳು, ಮನೆ, ಸಂಸಾರ, ವೃತ್ತಿ ಇಷ್ಟಕ್ಕೆ ಸೀಮಿತವಾಗಿರ್ತಾ ಇದ್ವಿ. ಹೀಗಾಗಿ ನಾವು ಯಾವ ಒಂದು ವೈದ್ಯಕೀಯ ಸಂಘದ ಕಾರ್ಯಕ್ರಮಗಳಲ್ಲಿ ಸಕ್ರಿಯರಾಗಿ ಪಾಲ್ಗೊಳ್ಳುತ್ತಿಲ್ಲ ಎಂದು ಕಂಡುಕೊಂಡು ಅವರು ನಮ್ಮನ್ನು ಮುಂಚೂಣಿಗೆ ತರುವ ಸಲುವಾಗಿ ಇಂಥ ಒಂದು ವುಮನ್ ಡಾಕ್ಟರ್ಸ್ ವಿಂಗ್ ಮಹಿಳಾ ವಿಭಾಗವನ್ನು ಪ್ರಾರಂಭಿಸಿದರು. ಅದಕ್ಕೆ ನಾವು ಅದಕ್ಕೆ ಸದಾ ಚಿರಋಣಿಯಾಗಿರಬೇಕು ಅಂತ ಹೇಳ್ಬೋದು. ಈಗ ನಮ್ಮ ಮಹಿಳಾ ವೃಂದದ ವೈದ್ಯರು ತಮ್ಮಲ್ಲಿರುವ ಕಲೆ, ಪ್ರತಿಭೆ, ಸಾಹಿತ್ಯದ ಅಭಿರುಚಿ ನೋಡ್ತಾ ಇದ್ದೀರಿ, ಎಲ್ಲವೂ ಪ್ರದರ್ಶನಗೊಳ್ಳಲಿದೆ. ಇಂಥದ್ರಲ್ಲೆಲ್ಲ ಪಾಲ್ಗೊಳ್ಳಲು ಒಂದು ವೇದಿಕೆ ಸೃಷ್ಟಿಯಾಯಿತು. ಇನ್ನು ನಮ್ಮ ಸಾಂಸ್ಕೃತಿಕ ಹಬ್ಬಗಳನ್ನು ಕೂಡ ನಮ್ಮ ಮಹಿಳಾ ವೃಂದದ ವೈದ್ಯರು ಎಲ್ಲರೂ ಒಟ್ಟಾಗಿ ನಾಗರ ಪಂಚಮಿ ಮುಂತಾದವುಗಳ ಹಬ್ಬಗಳ ಆಚರಣೆಯಲ್ಲಿ ಕೂಡ ತಮ್ಮನ್ನು ತೊಡಗಿಸ್ಕೊಳ್ತಾ ಇದ್ದಾರೆ. ಇದು ನಮಗೆ ಬಹಳ ಪ್ರಶಂಸನೀಯ ಅಂತ ಅನಿಸ್ತಾ ಇದೆ. ಇದನ್ನು ಒದಗಿಸಿಕೊಟ್ಟವರಿಗೆ ನಾವು ತುಂಬು ಹೃದಯದ ಅಭಿನಂದನೆಗಳನ್ನು ಸಲ್ಲಿಸ್ತಾ ಇದ್ದೇವೆ. ಇನ್ನು ನಾವು ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಅಂಜನಾ ಅಂತ ಯಾಕೆ ನಾಮಕರಣ ಮಾಡಬೇಕು ಅಂತ ಬಂದಾಗ, ಈ ಅಂಜನಾದ್ರಿ ಬೆಟ್ಟ ನಮ್ಮ ಊರಿನಿಂದ ಕೇವಲ 14 ಕಿಲೋಮೀಟ್ರ್ ದೂರದಲ್ಲಿದೆ. ಈ ಅಂಜನಾದ್ರಿ ಬೆಟ್ಟದ ಮೇಲೆ ಅಂಜನಾದೇವಿ ಮತ್ತು ಕೇಸರಿ ಎಂಬರು ಅಲ್ಲಿ ವಾಸಿಸ್ತಿದ್ದರು. ಅವರ ಉದರದಲ್ಲಿಯೇ ಜನಿಸಿದವನು ರಾಮದೂತ ಆಂಜನೇಯ ಅಂತ ಪ್ರತೀತಿಯಾಗಿದೆ. ಇದು ರಾಮಾಯಣ ಕಾಲದಿಂದಲೂ ಪ್ರತೀತಿಯಾದದ್ದು. ಅದಕ್ಕಾಗಿ ನಾವು ನಮ್ಮಲ್ಲಿಯೇ ಇರುವ ಒಂದು ಐತಿಹಾಸಿಕ ಇದನ್ನು ಎಲ್ಲರಿಗೂ ಸಾದರಪಡಿಸುವ ಸಲುವಾಗಿ ನಾವು ಅಂಜನಾ ಅಂತ ಇಟ್ಕೊಂಡ್ವಿ. ಇನ್ನು ನಾವು ವೈದ್ಯರಾಗಿ ಏನಂತ ಇದಕ್ಕೆ ಘೋಷವಾಕ್ಯ ಕೊಡುವುದು ಅಂತ ಬಂದಾಗ, ಕನಸು ಕಾಣಿ, ನಂಬಿಕೆ ಇಡಿ, ಸಾಧಿಸಿ, ಇವೆಲ್ಲವನ್ನು ಸಂಭ್ರಮಿಸಿ, ಇದೆಲ್ಲವೂ ನಾವು ಆಗಿದ್ದೇವೆ ಅಂತ ಹೇಳ್ಬೋದು. ನಾವು ವೈದ್ಯರಾಗುವ ಕನಸು ಹೊತ್ತು ಈ ಒಂದು ವೃತ್ತಿಯನ್ನು ಆಯ್ಕೆ ಮಾಡಿಕೊಂಡೆವು. ಅದರಲ್ಲಿ ನಮ್ಮ ಹೆಚ್ಚಿನ ಶ್ರದ್ಧೆಯನ್ನು ತೋರಿಸಿ ವೈದ್ಯರಾದೆವು. ವೈದ್ಯರಾದ ಮೇಲೆ ನಮ್ಮಲ್ಲಿ ರೋಗದಿಂದ ಬಳಲುತ್ತಿರುವ ವ್ಯಕ್ತಿಗಳು ಬಂದಾಗ ಅಥವಾ ಈ ರೋಗಿಗಳು ಬಂದಾಗ ಅವರಿಗೆ ನಾವು ಚಿಕಿತ್ಸೆ ನೀಡಲು ಸದಾ ಸಿದ್ಧ ಮತ್ತು ಸಮರ್ಥರು ಎಂದು ನಾವು ಅದನ್ನು ಮಾಡ್ತಾ ಇದ್ದೀವಿ. ಅದು ಎಲ್ಲರಿಗೂ ಅನ್ವಯಿಸ್ತದೆ. ಹೀಗಾಗಿ ಕನಸು ಕಾಣಿ, ನಂಬಿಕೆ ಇಡಿ, ಇದರೊಂದಿಗೆ ನಾವು ಮಾಡ್ತಾ ಇದ್ದೀವಿ. ಹಾಗೂ ಸಂಭ್ರಮಿಸಿ, ಇದೆಲ್ಲವನ್ನೂ ನಾವು ಈಗ ಮಾಡ್ತಾ ಇದ್ದೀವಿ. ನಮ್ಮಲ್ಲಿ ವೈದ್ಯರ ಮೇಲೆ ಬರುವಷ್ಟು ಹಲ್ಲೆಗಳಾಗಲಿ ಆಪಾದನೆಗಳಾಗಲಿ ಬೇರೆ ಯಾವ ವೃತ್ತಿಯಲ್ಲಿ ನಾವು ಕಾಣುವುದಿಲ್ಲ. ಅವೆಲ್ಲವನ್ನು ಎದುರಿಸಿ ನಾವು ಇನ್ನೂ ಒಳ್ಳೆಯ ವೈದ್ಯರಾಗಿ ನಮ್ಮನ್ನು ನಾವು ಸೇವೆಯಲ್ಲಿ ತೊಡಗಿಸ್ಕೊಂಡು ಅದನ್ನು ನಡೆಸ್ಕೊಂಡು ಬರ್ತಾಯಿದ್ದೀವಿ. ಇದು ನಮಗೆ ನಿಜವಾಗಲೂ ಸಂಭ್ರಮದ ವಿಷಯವೇ. ಇದಕ್ಕಾಗಿ ನಾವು ಇದನ್ನು ಘೋಷವಾಕ್ಯವಾಗಿ ತೆಗೆದುಕೊಂಡೆವು. ಇನ್ನು ಈ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಎಲ್ಲರೂ ಪಾಲ್ಗೊಂಡಿರೋದು ನನಗೆ ಭಾಳ ಸಂತಸದ ವಿಷಯ. ಎಲ್ಲ ದೂರದ ಊರುಗಳಿಂದ ಸಮಯಕ್ಕೆ ಸರಿಯಾಗಿ ಬಂದು ಈ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ತಾವೆಲ್ಲರೂ ಸಕ್ರಿಯವಾಗಿ ಭಾಗಗೊಂಡಿದ್ದೀರಿ ಹಾಗೂ ನಮ್ಮ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಮೆರುಗು ತಂದು ಕೊಟ್ಟಿದ್ದೀರಿ. ನಿಮ್ಮೆಲ್ಲರಿಗೂ ನನ್ನ ಹೃದಯಪೂರ್ವಕ ವಂದನೆಗಳು, ಅಭಿನಂದನೆಗಳು. ಹಾಗೂ ಈ ಎಲ್ಲಕ್ಕೆ ಮುಖ್ಯವಾಗಿ ಈ ಒಂದು ನಮ್ಮ ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಗಂಗಾವತಿ ಶಾಖೆ ಈ ಮಟ್ಟಕ್ಕೆ ಬರಬೇಕಾದರೆ ನಮ್ಮ ಹಿರಿಯ ವೃಂದದ ವೈದ್ಯರ ಒಂದು ಪರಿಶ್ರಮ ಇದಕ್ಕೆ ಕಾರಣ. ನಾವು ಗಂಗಾವತಿ ಶಾಖೆಯವರು ರಾಜ್ಯ ಶಾಖೆಯಲ್ಲಿ ಗುರುತಿಸಿಕೊಳ್ಳುವಂತಾಗಿದ್ದು ಇವರು ಹಾಕಿದ ಭದ್ರ ಬುನಾದಿಯಿಂದ. ಹೀಗಾಗಿ ನಾವು ಅವರಿಗೂ ಕೂಡ ಚಿರಋಣಿಯಾಗಿದ್ದೇವೆ. ಇನ್ನೆಲ್ಲರಿಗೂ ಇಲ್ಲಿ ಆಗಮಿಸಿದ ಎಲ್ಲ ಮಾಧ್ಯಮದವರಿಗೂ ಹಾಗೂ ನಮ್ಮ ಈ ಸೌಂಡ್ ಸಿಸ್ಟಮ್ ಹಾಗೂ ಟೆಕ್ನಿಕಲ್ ಇದಕ್ಕೂ ಎಲ್ಲ ಅಸಿಸ್ಟ್ ಮಾಡ್ತಾ ಇರೋರಿಗೂ ಕೂಡ ಹಾಗೂ ನಮ್ಮ ಸಿಬ್ಬಂದಿ ವರ್ಗದವರಿಗೆ ಎಲ್ಲರಿಗೂ ನಾನು ಆಭಾರಿಯಾಗಿದ್ದೇನೆ. ಇಷ್ಟು ಹೇಳಿ ನನ್ನ 2 ಮಾತು ಮುಗಿಸ್ತೇನೆ.
I now request the chief guest for today's event, Dr. Indumati, to deliver her inaugural address. I invite Dr. Manjula Patil Madam to introduce Madam to our audience.
To introduce Dr. Indumati Madam, and myself and Dr. Indumati know each other since 1998 when we were studying as PG students in WIMS Bellary. And I'm very grateful to Madam for inviting this invitation on spot. You know, when I called at 5 p.m., she didn't even ask, let me look at my schedule or let me ask my husband. Nothing she said. Yes, she said she's coming. And I'm very thankful for that. And me and myself, we have a mutual appreciation towards one another. And even though she's a health director now, she's very simple and easy to approach, and she's thankful to her for being remained as she was just 25 years back. Dr. Indumati Madam, she is a gynecologist by profession. She completed her MBBS from KIMS Bangalore and MD OBG from MIMS Bellary. And she served in Vane Vilas Hospital for almost 12 years. And then she was promoted as Divisional Joint Director in November 2019 and Project Director in 2021. She is now working as a Director of Health and Family Welfare since January 2023. Madam has many awards to her glory, which includes Chunchashri Award for Excellence in Career and Kitturu Rani Chennamma Award for Excellence in Women's Service. And I cordially welcome you to this IMA Gangavathi, Madam. Over to you.
Introduction. So, good afternoon to all. Respected dignitaries, on the dais and off the dais, dear friends and colleagues. As Director of Health and Family Welfare, I bring greetings to you all. On the onset, I thank the IMA Women's Wing Gangavathi for inviting me as the chief guest. My department is the second largest department after education and at the same time a major pillar of the society. For the 6 crore population of Karnataka, we provide comprehensive total quality health care through network of 9,000 plus sub-health centers, which are now called health and wellness centers. 2,117 rural PHCs, 367 urban PHCs, 207 CHCs, 146 taluka hospitals, 16 district hospitals, and 6 general hospitals, and around 300 Namma clinics and also Ayushmati clinics. For all the above facilities, we have a meager staff of 2,720 GDMO doctors, 1,937 specialists, 9,000 ANMs, 4,500 male workers, and our ground level committed 45,000 ASHA workers. With this meager health force, with annual OPD treated is around 8 crores, 61 lakhs IPD and IPD of 51 lakhs, 5.3 lakhs of deliveries, including cesarean sections, are rendered by us. We have unique maternal and child health hospitals to give care for women and children. Another feather in the cap is we have 35 DNB centers at district levels, 21 taluka hospitals, and 2 general hospitals. The feather in the cap is Gangavathi is one such taluka hospital where OBG DNB course is conducted. So we have 616 students from all over India getting educated in our Karnataka. We have 2 super specialty DNB courses started in Venlock hospitals. We also have ANM training centers, paramedical training colleges, and also GNM nursing colleges. From our facilities, many nursing and paramedical training students are getting clinical acumen. We have all our facilities certified under Lakshya for maternity services and NQAS for other general services to render quality services. The recent art of general hospitals have come up in many districts. We have IPHL labs under ABEAM and 15 Finance Commission. We have around 50 national programs. Every year, around 5 to 6 national programs are added. Without the help of NGOs and IMA Wing and other societies, it is really difficult to carry out this Herculean task. I request your kind cooperation to handhold us in achieving this target. I am grateful for the services rendered by you, people in Pulse Polio, and not to forget the COVID pandemic services. As the backbone of our society, your services rendered to humankind is laudable. I request you to continue the same support in future also. My sincere request is to hand over department to reduce the maternal mortality by participating in PMSMA, that is 9th of every month and an extended, that is 15th of 9, that is 23rd or 24th, to screen high-risk pregnancies and refer them to the higher care center for further management. Many of the posts in MCH hospitals and CHCs are vacant. So I request the youngsters to join these posts under NHM and give strength and also services to the society, what you have earned from it. You have earned, especially physicians, OBGYNs, pediatricians and radiologists. Kindly request you to get registered your facilities under KPME, PCPNDT and art and surrogacy activity. Request your participation to handholders in all the following program, just to name a few important, like strengthening of our SNCUs and NBSUs and NRCs to reduce the infant and neonatal mortality. We have Sam and Ma'am children where we are treating them, and so we also request your hand-holding in this respect. The present pandemic of non-communicable diseases like screening and treating of diabetes, hypertension and cancers. If we can join hands to prevent the complications of the above disease, our income can be diverted to other programs. Routine immunization, especially of the migratory lot, and to eliminate measles and rubella is another place where your role is crucial. We still have not eliminated an old disease, TB. Our target is to eliminate by 2025. Karnataka has got a death rate of 7 when compared to 4 as an Indian target. As philanthropists, your help in way of providing nutrition for 6 months, that is Nikshay Mitra, for the consented TB patients will help to reduce the mortality and morbidity of the TB patients. Organ donation pledging and motivating the brain death patients to donate the organ helps people who are in need of organs, and this is the need of the day. So each and every program will be incomplete without your participation. As we all know, the proverb, Vaggattinalli Balavide, we should forget all our differences and join hands in providing the services to the needy. Requesting you all to empanel under ABRK and ABDM and provide the services. Our health department is always open to join hands with you. The local administration like DHOs, THOs and other program officers can be contacted for all the necessary information about our national programs and also any help needed from them. I once again with folded hands request your help and support my department in implementing programs and make Karnataka a model state in providing health services. I once again thank the organizers for giving me this opportunity to be one among you and express my ideas. Thank you all. Jai Hind.
Thank you, madam, for your kind words. Next, we move on to the release of the souvenir. But after the inaugural ceremony, there's one more speech before the lunch. So please stay. After the lunch, another 2 more speeches are there. And after that, the cultural programs and award ceremony and the cultural program starts. So there are many, many programs. So please stay tuned.
Good afternoon all. It gives me immense pleasure to invite our state IMA President Dr. Shivkumar Lakkol sir. Dr. Shivkumar Lakkol sir has done his MBBS and FCGP from Government Medical College Hubli, completed his fellowship FCGP in 2005. He is practicing as family physician since 1977 in Roan, giving his valuable services to so many people in and around Roan. He started an educational institute at Roan by name Sri Sharanabaswa Shiksha Samiti, where so many students are getting benefited. At present, he is the president of IMA KSB 2022-23. He did enormous work in the IMA and has many feathers in his cap. He did extraordinary job in the social field by conducting so many health checkups, eye camps and operation camps. Once again, we welcome you all, sir, from IMA Gangavathi.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘ ರಾಜ್ಯ ಶಾಖೆಯ ಅಂಗವಾಗಿರತಕ್ಕಂಥ ಮಹಿಳಾ ವೈದ್ಯರ ಘಟಕದ 5ನೇ ಸಾಹಿತ್ಯ ಸಮ್ಮೇಳನವು ಅಂಜನಾ 2023 ಭತ್ತದ ಕಣಜ ಐತಿಹಾಸಿಕ ಪ್ರಸಿದ್ಧಿ ಹೊಂದಿರತಕ್ಕಂಥ ಗಂಗಾವತಿಯಲ್ಲಿ ನಡೀತಕ್ಕಂಥದ್ದು ಅವಿಸ್ಮರಣೀಯ. ಇದರ ಅಧ್ಯಕ್ಷತೆಯನ್ನು ಹೊಂದಿರತಕ್ಕಂಥ ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘ ಗಂಗಾವತಿ ಶಾಖೆಯ ಡಾಕ್ಟರ್ KN ಮಧುಸೂದನ್ ಅವರೇ, ಈ ಕಾರ್ಯಕ್ರಮದ ಮುಖ್ಯ ಅತಿಥಿಯಾಗಿರ್ತಕ್ಕಂಥ ಡಾಕ್ಟರ್ ಇಂದುಮತಿ ಮೇಡಮ್ ಅವರೇ, ಹಾಗೂ ವುಮನ್ ಡಾಕ್ಟರ್ಸ್ ವಿಂಗಿನ ಚೇರ್ಮನ್ರಾಗಿರ್ತಕ್ಕಂಥ ಡಾಕ್ಟರ್ ಮನ್ಪ್ರೀತ್ ಕೌರ್ ಅವರೇ, ಹಾಗೂ ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘ ರಾಜ್ಯ ಶಾಖೆಯ ಮಹಿಳಾ ವೈಸ್ ಪ್ರೆಸಿಡೆಂಟ್ ಆಗಿರ್ತಕ್ಕಂಥ ರಾಜಶ್ರೀ ಅನ್ಗೋಳ್ ಮೇಡಮ್ ಅವರೇ, ಹಾಗೂ ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘ ರಾಜ್ಯ ಶಾಖೆಯ ಅಸಿಸ್ಟೆಂಟ್ ಸೆಕ್ರೆಟರಿ ಆಗಿರ್ತಕ್ಕಂಥ ಡಾಕ್ಟರ್ LD ಬಾಕ್ಲೆ ಅವರೇ, ಹಾಗೂ ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘ ರಾಜ್ಯ ಶಾಖೆಯ ಮಾಜಿ ಅಧ್ಯಕ್ಷರು ಲೀಗಲ್ ಸೆರ್ಮನ್ರು ಆಗಿರ್ತಕ್ಕಂಥ ಡಾಕ್ಟರ್ YC ಯೋಗಾನಂದ ರೆಡ್ಡಿ ಅವರೇ, ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘ ರಾಜ್ಯ ಶಾಖೆಯ ಮಾಜಿ ಅಧ್ಯಕ್ಷರು ಬೈಲಾ ಕಮಿಟಿಯ ಚೇರ್ಮನ್ ಆಗಿರ್ತಕ್ಕಂಥ ಮಧುಸೂದನ್ ಕಾರಿಗ್ನವರವರೇ, ಹಾಗೂ ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘ ರಾಜ್ಯ ಶಾಖೆಯ ಮಾಜಿ ಅಧ್ಯಕ್ಷರು ಆಗಿರ್ತಕ್ಕಂಥ ಡಾಕ್ಟರ್ ಅನ್ನದಾನಿ ಮೇಟಿಯವರೇ, ಏಮ್ಸ್ನ ಚೇರ್ಮನ್ಸರಾಗಿರ್ತಕ್ಕಂಥ ಗೀತಾ ದೊಪ್ಪ ಅವರೇ, ಹಾಗೂ ಮಹಿಳಾ ಘಟಕದ ಗಂಗಾವತಿ ಶಾಖೆಯ ಪ್ರೆಸಿಡೆಂಟ್ ಆಗಿರ್ತಕ್ಕಂಥ ಸುಲೋಚನಾ ಚಿನ್ವಾಲ್ ಅವರೇ, ಹಾಗೂ ಕಾರ್ಯದರ್ಶಿಯಾಗಿರ್ತಕ್ಕಂಥ ಡಾಕ್ಟರ್ ಅನಿತಾ ಅವರೇ, ಹಾಗೂ ಟ್ರೆಜರರ್ ಇರ್ತಕ್ಕಂಥ ಸುಲೋಚನಾ ವೆಂಕಟೇಶ್ ಅವರೇ, ಹಾಗೂ ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘ ಗಂಗಾವತಿ ಶಾಖೆಯ ಕಾರ್ಯದರ್ಶಿಯಾಗಿರ್ತಕ್ಕಂಥ ಮಾಂತೇಶ್ ಪಟ್ಟಣಶೆಟ್ಟಿ ಅವರೇ, ಖಜಾಂಜಿಯಾಗಿರ್ತಕ್ಕಂಥ ವಿನಯ್ ಗುಂಜಳ್ಳಿ ಅವರೇ, ಅದ್ಭುತವಾಗಿ ಬೆಳಗ್ಗೆಯಿಂದ ಆ್ಯಂಕರಿಂಗ್ ಮಾಡಿರ್ತಕ್ಕಂಥ ರೇವಣ್ಕರ್ ಮತ್ತು ಉಮಾ ಮೇಡಮ್ ಅವರೇ, ಮಾಧ್ಯಮ ಮಿತ್ರರೇ, ಈಗಾಗಲೇ ಅನೇಕಾರು ವಿಚಾರಗಳನ್ನು ಚೀಫ್ ಗೆಸ್ಟ್ ಮತ್ತು ಪ್ರೆಸಿಡೆಂಟ್ ಸೆಕ್ರೆಟರಿ ಹಾಗೂ ಎಲ್ಲ ಗೌರವಾನ್ವಿತ ವೈದ್ಯರು ತಮಗೆ ತಿಳಿಸಿದ್ದಾರೆ. ಈ 5ನೇ ಮಹಿಳಾ ಘಟಕದ ಸಮ್ಮೇಳನವು ಅದ್ಭುತವಾಗಿ ಮೂಡಿಬರಲಿಕ್ಕೆ ಕಾರಣ ಗಂಗಾವತಿಯ ಎಲ್ಲ ವೈದ್ಯರು, ಅಧ್ಯಕ್ಷರು, ಕಾರ್ಯದರ್ಶಿ ಮತ್ತು ಗೌರವಾನ್ವಿತ ಎಲ್ಲ ವೈದ್ಯರ ಸಹಕಾರದಿಂದ ಅದ್ಭುತವಾಗಿ ಮೂಡಿಬಂದಿದೆ. ಅದಕ್ಕೆ ಎಲ್ಲ ಕಾರಣ ಈಗಾಗಲೇ ಮೇಡಮ್ ಅವರು ಹೇಳ್ತಾಯಿದ್ರು, 1 ತಿಂಗಳ ಹಿಂದೆ ಅಷ್ಟೇ ನಮಗೆ ಗಂಗಾವತಿಯಲ್ಲಿ ವುಮೆನ್ ಡಾಕ್ಟರ್ಸ್ ವಿಂಗಿನ ಕಾನ್ಫರೆನ್ಸ್ ಮಾಡಬೇಕು ಅಂತ ಅಧ್ಯಕ್ಷರು ಕೇಳಿಕೊಂಡ್ರು. ಆ ನಿಟ್ಟಿನಲ್ಲಿ ನಾವು ಕೆಲಸ ಮಾಡಿ ಈ ಒಂದು ಸಮ್ಮೇಳನವನ್ನು ಆಯೋಜಿಸಿವೆ ಅಂತ ನಿಜವಾಗಲೂ ಅದು ಅದು ಮಾತು. ಕಾರಣ ನಮಗೆ ಈ ವುಮೆನ್ ಡಾಕ್ಟರ್ಸ್ ವಿಂಗಿನ ಒಂದು ಸಮ್ಮೇಳನವನ್ನು ಬೇರೆ ಕಡೆ ಮಾಡ್ತಕ್ಕಂಥ ಒಂದು ವಿಚಾರ ಇತ್ತು. ಆದರೆ ಕೆಲವಾರು ಕಾರಣಗಳಿಂದ ನಮ್ಮ ಗಂಗಾವತಿಗೆ ಈ ಒಂದು ಪ್ರಸ್ತಾವನೆಯನ್ನು ಸಲ್ಲಿಸಿದಾಗ ಅವರು ತುಂಬ ಉತ್ಸಾಹದಿಂದ ಸಂತೋಷದಿಂದ ಒಪ್ಕೊಂಡು ಈ ಕಾರ್ಯಕ್ರಮನ ಇಷ್ಟು ನೀಟಾಗಿ ಈ ಒಂದು ಸುಂದರವಾಗಿ ವಿನ್ಯಾಸಗೊಂಡಿರ್ತಕ್ಕಂಥ ಈ IMA ಭವನದಲ್ಲಿ ನಡೆಸಿಕೊಂಡಿರ್ತಕ್ಕಂಥದ್ದು ಭಾಳ ಅವಿಸ್ಮರಣೀಯ. ನಾನು ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘದ ಪರವಾಗಿ ಮತ್ತೊಮ್ಮೆ ಅವರನ್ನು ಅಭಿನಂದಿಸ್ತೇನೆ. ನಾನು ನನಗೂ ಗಂಗಾವತಿಗೂ ಅಭಿನವ ಸಂಬಂಧ, ಸಾಕಷ್ಟು ಸಲ ಬಂದಿದ್ದೇನೆ. ಇದು 3ನೇ ಸಲ. ಮೊದಲು ಇನ್ಸ್ಟಾಲೇಷನ್ ಸೆರೆಮನಿಗೆ ಬಂದಿದ್ದೆ, ನಂತರ ಇದು ವಿನ್ಯಾಸವಾದ ಮೇಲೆ ಅದರ ಓಪನಿಂಗ್ಗೆ ಬಂದಿದ್ದೆ, ಈಗ ವುಮನ್ ಡಾಕ್ಟರ್ಸ್ ವಿಂಗಿನ ಸಮ್ಮೇಳನಕ್ಕೆ ಬಂದಿದ್ದೇನೆ. ನಿಮಗೆಲ್ಲ ಗೊತ್ತಿರುವಂತೆ ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘ ವುಮನ್ ಡಾಕ್ಟರ್ಸ್ನ ಕಾರ್ಯಚಟುವಟಿಕೆಗಳನ್ನು ಸಂಕ್ಷಿಪ್ತವಾಗಿ ವಿವರವಾಗಿ ತಿಳಿಸಿದ್ದಾರೆ. ನನಗೆ ಒಂದು ಹೆಮ್ಮೆ, ನಮ್ಮ ಅವಧಿಯಲ್ಲಿ ಅದ್ಭುತವಾದಂಥ ಕಾರ್ಯಕ್ರಮಗಳನ್ನು ಮಹಿಳಾ ಘಟಕವು ಮಾಡಿರುವುದು ಮತ್ತೊಮ್ಮೆ ನಮ್ಮ ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘ ಹೆಮ್ಮೆ ಮತ್ತು ಹಿರಿಮೆ ಅಂತ ಹೇಳ್ತಾ, ಈಗಾಗಲೇ ಮತ್ತೆ 3-4 ಕುಂದಾಪುರ ಬ್ರ್ಯಾಂಚು ಮತ್ತು ದಾವಣಗೆರೆ ಬ್ರ್ಯಾಂಚು ಇನ್ನು ಕೆಲವೇ ದಿವಸದಲ್ಲಿ ಮಹಿಳಾ ಘಟಕವನ್ನು ಉದ್ಘಾಟನೆ ಮಾಡಲಿಕ್ಕೆ ಮೊನ್ನೆ ಎಲ್ಲ ತಯಾರಿ ಮಾಡಿಕೊಂಡು ಉದ್ಘಾಟನೆಗೆ ಬರಬೇಕು ಅಂತ ಕೇಳ್ಕೊಂಡಿದ್ರು. ಇವೆಲ್ಲ ನಿಮ್ಮೆಲ್ಲರ ಕಾರ್ಯಚಟುವಟಿಕೆಗಳ ಫಲ. ನೀವು ನಮ್ಮ ಸಮಾಜಕ್ಕೆ ಕೊಟ್ಟಿರ್ತಕ್ಕಂಥ ಕಾಣಿಕೆ. ನೀವು ಮಹಿಳಾ ಘಟಕದವರು ಉತ್ಸಾಹದಿಂದ ಕಾರ್ಯಚಟುವಟಿಕೆಗಳನ್ನು ಮಾಡಿದ್ದೇ ಆದಂದರೆ ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘ ನಿಮಗೆ ಗಮನಿಸಿರ್ಬೋದು. ನಾನು 136 ಶಾಖೆಗಳನ್ನು ವಿಸಿಟ್ ಮಾಡಿದ್ದೇನೆ. ಅಲ್ಲಿ ನಾನು ಕಂಡಿರ್ತಕ್ಕಂಥ ಕೊರತೆಗಳನ್ನು ಏನು ಹೇಳಲಿಕ್ಕೆ ಇಷ್ಟಪಡೋದಿಲ್ಲ, ಆದರೆ ಬದಲಾವಣೆ ಆಗಿದೆ. ಆ ಬದಲಾವಣೆಯ ಪೂರಕವಾಗಿ ಇಂಥ ಅದ್ಭುತವಾದಂಥ ಕಾರ್ಯಕ್ರಮ ನಡೀತಿದೆ ಅಂತ ಹೇಳಲಿಕ್ಕೆ ನಾನು ಬಯಸ್ತೇನೆ. ಅದಕ್ಕೆ ನಿಮ್ಮ ಪಾತ್ರ ಹಿರಿದು. ನಿಮ್ಮ ಪಾತ್ರ ಸಮಾಜದ ಸರ್ವತೋಮುಖ ಏಳಿಗೆಗೋಸ್ಕರ ವೈದ್ಯರಲ್ಲದೆ ವೈದ್ಯೇತರ ರಂಗದಲ್ಲಿಯೂ ನಿಮ್ಮ ಚಟುವಟಿಕೆಗಳು ತಾಯಿಯಾಗಿ, ಗೆಳತಿಯಾಗಿ, ವೈದ್ಯೆಯಾಗಿ, ಸಮಾಜಮುಖಿಯಾಗಿ ಮಾಡತಕ್ಕಂಥ ಕೆಲಸಕ್ಕೆ ಪರಿಗಣಿಸಿ ನಿಮಗೆ ಘನ ಸರ್ಕಾರದವರು 33% ರಿಸರ್ವೇಷನ್ ಮಾಡಿರ್ತಕ್ಕಂಥದ್ದು ನಿಜವಾದ ಶ್ಲಾಘನೀಯ. ಅದು ನಿಜವಾಗಲೂ ನಿಮ್ಮೆಲ್ಲರಿಗೂ ಸಂದ ಜಯ ಅಂತ ಈ ಸಂದರ್ಭದಲ್ಲಿ ಹೇಳ್ತಾ, ಈ ಕಾರ್ಯಕ್ರಮವನ್ನು ಅದ್ಭುತವಾಗಿ ಮಾಡಿಕೊಂಡು ಬಂದಿದ್ದೀರಿ. ಹಾಗೆ ಇನ್ನೂ ಅನೇಕಾರು ಕಾರ್ಯಚಟುವಟಿಕೆಗಳು ಮುಂಬರುವ ದಿನದಲ್ಲಿ ಆಗಲಿ ಅಂತ ಆಶಿಸುತ್ತಾ, ಮತ್ತೊಮ್ಮೆ ಅವಾರ್ಡ್ಗಳನ್ನು ಮನ್ಪ್ರೀತ್ ಕೌರ್ ಅವರು ಆಯೋಜನೆ ಮಾಡಿದರು. ಯಾವ ರೀತಿ ಅವರು ಮಾನದಂಡಗಳನ್ನು ಇಟ್ಟುಕೊಂಡು ಗೈಡ್ಲೈನ್ಸನ್ನು ಅವಾರ್ಡ್ಗಳನ್ನು ಕೊಟ್ಟಿದ್ದಾರೆ ಅಂತಂದರೆ ಅದನ್ನು ಮುಂಬರುವ ದಿನಗಳಲ್ಲಿ ನಾವೆಲ್ಲರೂ ಅನುಸರಿಸತಕ್ಕಂಥ ಒಂದು ಮಾನದಂಡವನ್ನು ಹಾಕಿದರೆ ಈ ಅವಾರ್ಡ್ ಕಮಿಟಿಯ ಎಲ್ಲ ಮೆಂಬರ್ಸ್ಗಳು ನೋಡಿ ಆಶ್ಚರ್ಯಪಟ್ಟರು. ನಿಜವಾಗಲೂ ಸೂಕ್ತವಾಗಿದೆ, ಯಾರು ಬಯಾಸಾಗಿ ಏನು ಮಾತಾಡಲೇ ಇರತಕ್ಕಂಥ ಒಂದು ಗೈಡ್ಲೈನ್ಸನ್ನು ಹಾಕಿದ್ದಾರೆ. ಅಂಥ ಒಂದು ಗೈಡ್ಲೈನ್ಸ್ನಲ್ಲಿ ಸತೆಗೆ ಗಂಗಾವತಿ ಶಾಖೆಯು ಉತ್ತಮವಾದಂಥ ಬ್ರ್ಯಾಂಚ್ ಅಂತ ಶಾಖೆ ಅಂತ ಬಂದಿದ್ದಕ್ಕೆ ಮತ್ತೊಮ್ಮೆ ನಿಮಗೆಲ್ಲ ಅಭಿನಂದಿಸ್ತೇನೆ. ಹಾಗೆ ಮುಂಬರುವ ದಿನದಲ್ಲಿ ಇನ್ನೂ ಹೆಚ್ಚಿನ ನಿರೀಕ್ಷೆಯೊಂದಿಗೆ ಯಾವ ಬ್ರ್ಯಾಂಚುಗಳು, ಶಾಖೆಗಳು ಈ ಅವಾರ್ಡಿಗೆ ಅರ್ಹರಾಗಿದ್ದಾರೆ ಅವರಿಗೆಲ್ಲರೂ ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘದ ಪರವಾಗಿ ಅಭಿನಂದಿಸುತ್ತಾ ನನ್ನ ಮಾತನ್ನು ಮುಗಿಸ್ತೇನೆ. ನನಗೆ ಅವಕಾಶ ಮಾಡಿಕೊಟ್ಟಂಥ ನಿಮಗೆ ಮತ್ತೊಮ್ಮೆ ವಂದಿಸುತ್ತಾ, ಜೈ ಹಿಂದ್, ಜೈ ಕರ್ನಾಟಕ, ಲಾಂಗ್ ಲಿವ್ ಎಮ್ಮೆ ಯೂನಿಟಿ.
Our President IMA Gangavathi, Dr. Madhusudan KN sir, to give his presidential address.
Good afternoon, everyone. The chief guest of the function, Dr. Indumati Madam, IMA KSP President, Dr. Lakkol sir, IMA KSP WDW President, Dr. Manpreet Kaur, and the whole team of IMA Gangavathi. What an honor for me It's really a great pleasure that IMA WWD State Conference is being arranged for the first time in a taluka level branch. So that's a great honor for us. And we have showed we are no less than anybody by an proved year that we can do whatever job we get in a beautiful way. So IMA Gangavathi is a small medium branch of IMA KSB. The history goes back to 1975 when the IMA Gangavathi was started by a handful of doctors, and the founder president was my father, Dr. K. Narayanachar. Since then, IMA Gangavathi is a very vibrant branch which is very active in all its activities, being medico-social, academics, health-related, etc. Year by year, various specialties were added to our IMA branch. Now we have 110 active members of various specialties, including super specialists who have been added to our IMA family. This year, in November 22, we took charge along with IMA WWW office bearers. Since then, it has been a very busy year for us, and I proudly say we have completed 105 activities during our tenure. And I have made a booklet of the same and already submitted to IMA KSB. So, icing on the cake, the most important highlight of during our tenure was the renovation of this wonderful building, IMA Bhavan, which was completed in 3 months' time. Icing on the cake, when Dr. S.B. Lakol sir, IMA KSB, and Dr. Matsudan Karignur sir gave us a proposal to conduct a state-level IMA WDW conference at Gangavathi in September. We were really honored and overwhelmed and really wholeheartedly accepted the proposal. Before I end my tenure in October, it is another feather in my cap that during my tenure as president, it is really a great honor that this state conference was conducted in our branch, and we were all being a part of it. And this is going to be written in the history of IMA Gangavathi. Thank you for this opportunity, sir. I thank the state, IMA, KSB, the whole team, and especially Dr. S.B. Lakol sir for giving us this opportunity to host this conference at a taluka level. You had a great confidence in us that we will do it, and we have proved that we can do it. Thank you, sir. Thank you for this opportunity. I thank all the IMA KSB office bearers who have restored their confidence in us and gave this conference to us. And all the guest speakers, they have got wonderful topics today. All are really very nice topics which are away from our scientific talks. I really congratulate and all the speakers, guest speakers who have come all the way from various cities to give us this wonderful talks on this WDW conference. We are really honored, all of you. We are honored, Madam, Indumati Madam, for having accepted our proposal and coming and inaugurating our Women's Doctor Day conference. So I welcome all the delegates. Again, I welcome the press people who have come here to cover this epic event. And on this note, I really thank everybody who has participated in this event and whatever is there in the post-lunch. And we have got a wonderful cultural program which is being arranged by our WDW members. I think all of you should see the cultural programs and then say goodbye to this conference. Thank you. Thank you so much.
My guests for today's conference for the felicitation ceremony.
जित बिठरावे तित ही बैठूं, जो पहरावे पूजा गुरु गोविंद।
I would like to invite Dr. Manjula Shelgi to deliver Joint Secretary IMA Women's Division Wing Gangavathi to deliver the vote of thanks.
I take immense pleasure to deliver the vote of thanks for today's event. I would like to thank Chairman State WD Dr. Manpreet Kaur Madam for joining us and gracing this event. And I would like to thank our Secretary Dr. BP Karnataka Sir for attending, and I would like to thank all the members coming from different places and joining us and making this event a grand success. I would like
appreciation to our Vice President IMA KSB, Dr. Rajeshri Angol Madam. Because of Nipah virus, she could not go and she is with us. For that, we are very happy.
So on the day to give token of appreciation to our Assistant Secretary Dr. LD Bakale. Yoganand Reddy to come over and to accept the token of our. Next, I call upon Dr. Matsudan. Next, I call upon Dr. Annadani Meti, past president of our IMA KSB, who has come over to attend this conference.
Kind attention all delegates. The award function will be held after all the scientific sessions is over. For the conference have been completely borne by IMA KSB Women's Division Wing Chairman Dr. Manpreet Kaur Madam, and we are very thankful to her for that, and we appreciate her efforts and are totally humbled by this gesture.
It is first time and third.
This is the first time
Madam Manpreet Kaur took individual interest to appreciate the activities done by WDW and give awards. She has taken too much pain for selecting the branches also, and I personally and also from our one of the best branches of IMA KSB.
I'm sorry if everybody is under the impression that I have chosen the winners. It is all your work. We have just marked very impartial system. If you want to know also, whatever activities you have done, we've marked them, and suddenly we have all the winners with us. But it was a tough job because there are so much of stupendous activity taking place in WDW that sometimes when we were saying, okay, these three branches have won first, then we said, no, but this branch is also good, this branch is also good. So it's not just me, and because this is the least I could do for such a wonderful subcommittee that I was given the opportunity to be part of. Thank you so much, everyone, for all the WDW members and all the IMA members. Thank you so much. Thank you, ma'am.
Women and Science.
For this talk, I request surgeon at City Hospital, Hospete, and Srimati Kavita Gurumurthy ma'am, Advocate Gangavathi, to please accompany the trainee Gadagappa Godur on the stage. I request Dr. Anita Shashidhar to accompany madam on to the stage. For her introduction, I request Dr. Lakshmi Pavana ma'am. She is the consultant at SR Infertility Center, Ballari.
Kalabhushana. Recently, she has been awarded the Shiksha Seva.
ಮಂದಿರಕ್ಕಿಂತ ಕಡಿಮೆ ಯಹುದೆ, ದೇವ ಮಂದಿರಕ್ಕಿಂತ ಕಡಿಮೆ ಯಹುದೆ. ಆತ್ಮೀಯರೇ, ಇವತ್ತು ಭಾರತೀಯ ವಿಜ್ಞಾನ ಸಂಸ್ಥೆ ಆಯೋಜಿಸಿರ್ತಕ್ಕಂಥ ಅಂಜನಾ 2023 ಅಖಿಲ ಕರ್ನಾಟಕ ಮಹಿಳಾ ವೈದ್ಯರ ಸಮ್ಮೇಳನದಲ್ಲಿ ಮಹಿಳೆ ಮತ್ತು ವಿಜ್ಞಾನ ಎಂಬ ವಿಷಯವನ್ನು ಕುರಿತಾಗಿರ್ತಕ್ಕಂಥ ನನ್ನ ಸಂಪನ್ಮೂಲ ಉಪನ್ಯಾಸವನ್ನು ನೀಡಲಿಕ್ಕೆ ನನಗೆ ಬಹಳ ಸಂತೋಷ ಅನ್ನಿಸ್ತಾ ಇದೆ. ಕಳೆದ 25 ವರ್ಷಗಳಿಂದ ಒಬ್ಬ ಕನ್ನಡದ ಅಧ್ಯಾಪಕಳಾಗಿ, ಕನ್ನಡದ ಅಭ್ಯಾಸದ ವಿದ್ಯಾರ್ಥಿನಿಯಾಗಿ ನಾನು ಸಾಹಿತ್ಯದ ಕಾನ್ಫರೆನ್ಸ್ಗಳಲ್ಲಿ ಭಾಗವಹಿಸಿದ್ದೆ. ನಮ್ಮ ವಿಶ್ವವಿದ್ಯಾಲಯಗಳಲ್ಲಿ ನಾವು ಮಹಿಳಾ ವೈದ್ಯರನ್ನು ಕರೆಸಿ ನಾವು ಉಪನ್ಯಾಸಗಳನ್ನು ಕೊಡಿಸ್ತಿದ್ವಿ. ಆದರೆ ಇಷ್ಟೊಂದು ಮಹಿಳಾ ವೈದ್ಯರ ನಡುವೆ ನಾನೊಬ್ಬ ಕನ್ನಡದ ವಿದ್ಯಾರ್ಥಿನಿಯನ್ನು, ಒಬ್ಬ ಕನ್ನಡ ಅಧ್ಯಾಪಕಳನ್ನು ನೀವು ಕರೆಸಿದ್ದೀರಿ. ನಾನು ತುಂಬ ಆಭಾರಿಯಾಗಿದ್ದೇನೆ ಚಿನ್ವಾಲರ್ ಮೇಡಮ್ ಮತ್ತು ಕವಿತಾ ಗುರುಮೂರ್ತಿ ಮೇಡಮ್ ಅವ್ರಿಗೆ. ಇದು ಒಂದು ಏನು ಮೆಸೇಜ್ ಅಂದರೆ ಈ ಸಮ್ಮೇಳನದ್ದು, ಈ ಮಹಿಳೆಯ ಜ್ಞಾನ ಇದೆಯಲ್ಲ, ಅದು ಗಿವ್ ಆ್ಯಂಡ್ ಟೇಕ್ ಪಾಲಿಸಿ ಹೇಗಿರುತ್ತೆ ಅಂದರೆ ಅದು ಒಂದು ಇನ್ ನೇಚರ್ ಬೈ ನೇಚರ್ ಅಂತ ನಾನು ಭಾವಿಸ್ಕೊಳ್ತೀನಿ. ಅದನ್ನು ಆ್ಯಸ್ ಎ ಟೀಚರ್ ಆಗಿರ್ಬೋದು, ಆ್ಯಸ್ ಎ ಡಾಕ್ಟರ್ ಆಗಿರ್ಬೋದು, ಅವಳ ನಾಲೆಡ್ಜ್ ಶೇರಿಂಗ್ ಇದೆಯಲ್ಲ, ಈ 21st ಸೆಂಚುರಿಯಲ್ಲಿ ಇಟ್ ಈಸ್ ವೆರಿ ಮ್ಯಾಂಡ್ರೇಟ್ರಿ ಅಂತ ನಾನು ಭಾವಿಸ್ಕೊಳ್ತಾ ಇದ್ದೀನಿ. ಹೀಗಾಗಿ ನನಗೆ ಮೇಡಮ್ ಅವ್ರು ಕೊಟ್ಟಿರ್ತಕ್ಕಂಥ ಟಾಪಿಕ್ಕು ಕೂಡ ನನಗೆ ತುಂಬ ಬಹಳ ಪ್ರೀತಿಯಿಂದ ಆಯ್ಕೆ ಮಾಡ್ಕೊಂಡಿರ್ತಕ್ಕಂಥ ಟಾಪಿಕ್ ಅದು. ಹೀಗಾಗಿ ಈ ಸಮ್ಮೇಳನದಲ್ಲಿ ನನಗೆ ನನ್ನ ಈ ಟಾಪಿಕ್ಕಿಗೆ ನ್ಯಾಯವನ್ನು ಒದಗಿಸ್ಕೊಡ್ತಕ್ಕಂಥ ಪ್ರಯತ್ನವನ್ನು ನಾನು ಮಾಡ್ತಾಯಿದ್ದೀನಿ. ನಾನಿವತ್ತು ತುಂಬ ಸಹಜ ಮತ್ತು ಸರಳವಾಗಿ ಈ ವಿಷಯವನ್ನು ನಾನು ಪ್ರಸ್ತುತಪಡಿಸಬೇಕಾಗಿದೆ. ನಮ್ಮ ತಲೆಯಲ್ಲಿ ಮೊದಲಿಂದನೂ ಕೂಡ ಏನಿದೆ ಅಂತಂದರೆ, ವಿಜ್ಞಾನ ಅಂದರೆ ತುಂಬ ಜಟಿಲವಾಗಿರ್ತಕ್ಕಂಥದ್ದು, ತುಂಬ ಕಠಿಣವಾಗಿರ್ತಕ್ಕಂಥದ್ದು. ಮತ್ತು ವಿಜ್ಞಾನ ಅಂದ ತಕ್ಷಣ ಇದು ಸ್ಪೆಸಿಫಿಕ್ಕಾಗಿ ನಮ್ಮ ಉಭಯಲಿಂಗಿ ಸಮಾಜದಲ್ಲಿ ಪುರುಷ ಪ್ರಾಧಾನ್ಯತೆಯ ಕ್ಷೇತ್ರ. ಲ್ಯಾಬ್ನಲ್ಲಿ ರಿಸರ್ಚ್ಗಳಾಗಿರ್ಬೋದು, ಸಂಶೋಧನೆಗಳಾಗಿರ್ಬೋದು, ಆವಿಷ್ಕಾರಗಳಾಗಿರ್ಬೋದು, ಅನ್ವೇಷಣೆಗಳಾಗಿರ್ಬೋದು, ಈ ವಿಜ್ಞಾನ ಕ್ಷೇತ್ರ ಅನ್ನೋದು ಅದು ಪುರುಷನಿಗೆ ಸೀಮಿತವಾಗಿರ್ತಕ್ಕಂಥ ಮತ್ತು ಪುರುಷನಲ್ಲಿ ಪ್ರಾಬಲ್ಯವಾಗಿರ್ತಕ್ಕಂಥ ಕ್ಷೇತ್ರ ಅನ್ನೋದು ನಮ್ಮ ತಲೆಯಲ್ಲಿ ಉಳ್ಕೊಂಡಿರ್ತಕ್ಕಂಥದ್ದು. ಆದರೆ ನಾನಿವತ್ತು ನನ್ನ ಉಪನ್ಯಾಸದಲ್ಲಿ ತುಂಬ ಸರಳವಾಗಿ ಮತ್ತು ಯಾವುದನ್ನು ನಾನು ಹೊಸದನ್ನೇನೋ ಕಟ್ಟಿ ಅಥವಾ ತುಂಬ ಪ್ರಬಲವಾಗಿ ಇದು ಮಹಿಳೆಯರದೇ ಕ್ಷೇತ್ರ ಅಥವಾ ಇದೇ ಅಂತ ಹೇಳಿ ನನ್ನ ವಾದ ಜಗಳ ಯಾವ ಚರ್ಚೆಗಳು ಅಲ್ಲ. ಬಟ್ ನಾನು ಹೇಳ್ತಾ ಇರುವ ನನ್ನ ಉಪನ್ಯಾಸದ ಮುಖ್ಯಾಂಶಗಳನ್ನು ಕೇಳಿದಾಗ ತುಂಬ ಸಹಜವಾಗಿ ನಮ್ಮ ಮನಸ್ಸಿನಲ್ಲಿ ಬರ್ತಕ್ಕಂಥದ್ದು ಏನು ಅಂತಂದರೆ, ಈ ಕ್ಷೇತ್ರ ಅನ್ನೋದಿದೆಯಲ್ಲ, ಈ ಪ್ರಕೃತಿ ಒಬ್ಬ ತಾಯಿಯಲ್ಲಿ ತುಂಬಿ ಕಳಿಸಿರ್ತಕ್ಕಂಥ ಭಾಳ ಅದ್ಭುತವಾಗಿರ್ತಕ್ಕಂಥ ಒಂದು ಪ್ರಾಕೃತಿಕ ಜ್ಞಾನ. ಇದು ನೇಚರ್ ನಮಗೆ ಕೊಟ್ಟಿರ್ತಕ್ಕಂಥ ಬಹಳ ದೊಡ್ಡ ಮದರ್ಹುಡ್ ಇದೆಯಲ್ಲ, ಆ ಮದರ್ಹುಡ್ ಒಳಗಡೆ ಈ ವಿಜ್ಞಾನ ಅಡಗಿಕೊಂಡಿದೆ ಅನ್ನೋದನ್ನು ನಾನು ತಮ್ಮ ಮುಂದೆ ಇವತ್ತು ಸ್ಪಷ್ಟಪಡಿಸ್ತಾ ಇದ್ದೀನಿ. ಇತಿಹಾಸದುದ್ದಕ್ಕಲೂ ಕೂಡ ನಾವು ಗಮನಿಸ್ಕೊಂಡು ಬಂದಿರೋ ಹಾಗೆ ಈ ಆರೋಗ್ಯ ಕ್ಷೇತ್ರ, ವಿಜ್ಞಾನ ಕ್ಷೇತ್ರ, ಬೇರೆ ಬೇರೆ ಕ್ಷೇತ್ರಗಳನ್ನು ನಾವು ಗಮನಿಸ್ಕೊಂಡಾಗ ಇದರಲ್ಲಿ ಹೆಣ್ಣು ಮಕ್ಕಳ ಕಾಂಟ್ರಿಬ್ಯೂಷನ್, ಪಾಲುದಾರಿಕೆ ತುಂಬ ಕಡಿಮೆ ಪರ್ಸೆಂಟೇಜ್ನಲ್ಲಿ ಇತ್ತು ಅನ್ನೋದನ್ನು ನಾವು ನೋಡ್ತೀವಿ. ಆದರೆ ಪ್ರಥಮ ಗಣಿತ ತಜ್ಞ ಆಗಿರ್ತಕ್ಕಂಥ ಅಲೆಕ್ಸಾಂಡ್ರಿಯಾ ಹೈಪೋಷಿಯಾ ಕ್ರಿಸ್ತಿಶಕ 370ರಲ್ಲಿಯೇ ಬಹಳ ದೊಡ್ಡ ಒಬ್ಬ ಗಣಿತ ತಜ್ಞಿಯಾಗಿ ಆಕೆ ತನ್ನ ಅಮೂಲ್ಯವಾಗಿರ್ತಕ್ಕಂಥ ಕೊಡುಗೆಯನ್ನು ಜಗತ್ತಿಗೆ ಕೊಟ್ಟಿರ್ತಕ್ಕಂಥದ್ದಿದೆ. ನಮ್ಮ ಭಾರತದ ಲೀಲಾವತಿ ಅನ್ನುವ ಒಬ್ಬ ಹೆಣ್ಮಗಳು ಕೂಡ ಬಹಳ ದೊಡ್ಡ ಗಣಿತ ತಜ್ಞೆ ಆಗಿದ್ಲು ಅನ್ನೋದನ್ನು ನಾವು ಗಮನಿಸ್ಕೊಳ್ತೀವಿ. ನಮಗೆ 1543ರಿಂದ ಒಂದು ವೈಜ್ಞಾನಿಕ ಯುಗ ಅಂತ ಪ್ರಾರಂಭವಾಯಿತು. ಅಲ್ಲಿಗಿಂತ ಮುಂಚೆ ಇರಲಿಲ್ಲ ಅಂತಲ್ಲ, ಇತ್ತು. ಯಾವಾಗ ನಮ್ಗೆ ಕಲೋನಿಸಮ್ ಅಂದರೆ ವಸಾಹತೀಕರಣದ ಸಂದರ್ಭದಲ್ಲಿ ಪೌರ್ವಾತ್ಯ ಅನೇಕ ಸಿದ್ಧಾಂತಗಳು, ವಾದಗಳು ನಮ್ಮ ಭಾರತೀಯರ ಮೇಲೆ ಬ್ರಿಟಿಷ್ ಆಳ್ವಿಕೆ ಸಂದರ್ಭದಲ್ಲಿ ಹೇರಲ್ಪಟ್ಟಾಗ, ನಮಗೆ ಗಮನಿಸಲ್ಪಟ್ಟಾಗ ನಾವು ಅದನ್ನು ಬೇರೆ ಬೇರೆ ಕ್ರಾಂತಿಗಳು, ಹಸಿರು ಕ್ರಾಂತಿ, ಬೇರೆ ಬೇರೆ ಕ್ರಾಂತಿಗಳು ಅಂತ ಕರ್ಕೊಂಡು ನಾಲೆಜನ್ನು ನಾವು ಅಪ್ಡೇಟ್ ಮಾಡ್ಕೊಂಡ್ವಿ. ಬೇಸಿಕಲಿ ವಿ ಹ್ಯಾವ್ ದಟ್ ಆಲ್ ನಾಲೆಜ್. ಇವತ್ತಿಗೂ ಕೂಡ ಜಗತ್ತಿನಲ್ಲಿ ವಿಜ್ಞಾನ, ತಂತ್ರಜ್ಞಾನ, ಕೃಷಿ ಇವೆಲ್ಲ ಕ್ಷೇತ್ರಗಳಲ್ಲಿ ಭಾರತೀಯರೇ ಬಹಳ ದೊಡ್ಡ ಒಂದು ಬೇಸಿಕ್ಕನ್ನು ಹಾಕಿಕೊಟ್ಟಿರ್ತಕ್ಕಂಥದ್ದನ್ನು ನಾವು ಆರ್ಯಭಟನಿಂದ ಹಿಡ್ಕೊಂಡು ಚಾಣಕ್ಯನಿಂದ ಹಿಡ್ಕೊಂಡು ಅನೇಕ ಇಂತಹ ವಿಜ್ಞಾನಿಗಳನ್ನು ನಾವು ನೋಡ್ತಾ ಇದ್ದೀವಿ. ಆದರೆ 1543 ಕ್ರಾಂತಿಯ ಆ ಒಂದು ರಿಸಲ್ಟ್ ಏನಿತ್ತು ಅಂದರೆ ಅದು ಓನ್ಲಿ ಫೋಕಸ್ಡ್ ಆನ್ ಮೆನ್. ಆ 16ನೇ ಶತಮಾನದ ಕ್ರಾಂತಿ ಕೇವಲ ಪುರುಷರನ್ನಷ್ಟೇ ತಲುಪಿತು. ನಮ್ಮ ವೈಜ್ಞಾನಿಕ ಯುಗದಲ್ಲಿ ನಾವೆಲ್ಲ ಬದುಕ್ತಾ ಇದ್ರೂ ಕೂಡ ಒಂದು ಸಣ್ಣ ಪ್ರಮಾಣದ ಒಂದು ಅವಕಾಶ, ಟೈಮ್ ಆ್ಯಂಡ್ ಸ್ಪೇಸ್ ಹೆಣ್ಮಕ್ಕಳಿಗೆ ಬಹಳ ಅವಕಾಶಗಳು ಸಿಗಲಿಲ್ಲ ಅನ್ನೋದನ್ನು ನಾವು ನೋಡ್ಕೊಳ್ತೀವಿ. ಜಗತ್ತಿನಲ್ಲಿ ಇವತ್ತಿಗೂ ಕೂಡ ಡೆವಲಪಿಂಗ್ ಕಂಟ್ರಿ ಎಲ್ಲ ಆಯಾಮಗಳನ್ನು ನಾವು ಗಮನಿಸ್ಕೊಂಡಾಗ ಭಾರತದ ಒಂದು ಸಮೀಕ್ಷೆಯನ್ನು, ಯುನೆಸ್ಕೋ ವರದಿಯನ್ನು ಮುಂದಿಟ್ಕೊಂಡಾಗ ಭಾರತೀಯ ಮಹಿಳೆಯೂ ಕೂಡ ಪುರುಷನಷ್ಟೇ ಸಮಬಲಳಾಗಿ, ಸಮಾನಳಾಗಿ ತನ್ನ ಕಾರ್ಯಕ್ಷೇತ್ರವನ್ನು ವಿಸ್ತೃತ ಮಾಡಿಕೊಂಡಿದ್ದಾಳೆ ಅನ್ನೋ ಒಂದು ಯುನೆಸ್ಕೋ ವರದಿಯನ್ನು ನಾವು ಗಮನಿಸ್ಕೊಂಡಿದ್ದೀವಿ. ನಮಗೆ ಗೊತ್ತಿರೋ ಪ್ರಕಾರ ನನ್ನಂಥವರು ಯಾರೋ IT ಪೇಯರ್ಸ್ ಇದ್ದೀವಿ, ನಾವು ಮಾತ್ರ ಭಾರತದ ಆರ್ಥಿಕ ಪರಿಸ್ಥಿತಿಯಲ್ಲಿ ಓನ್ಲಿ 27% ವಿಮೆನ್, ದೋಸ್ ಹೂ ಆರ್ ಪೇಯಿಂಗ್ IT, ಅವರಷ್ಟೇ ಕೌಂಟ್ ಆಗ್ತಾ ಇರೋದ್ರಿಂದ ಉಳಿದ ರಾದರ್ ದೆನ್ ನಮಗೆ ಸಿಗ್ಬೋದಾಗಿರ್ತಕ್ಕಂಥ 77%, 67% ಹೆಣ್ಣು ಮಕ್ಕಳ ಕಾಂಟ್ರಿಬ್ಯೂಷನ್ ಎಲ್ಲಿ ಹೋಯ್ತು ಅಂದರೆ ಇವರೆಲ್ಲ ಏನಾಗಿದೆ ಅಂದರೆ ಅಸಂಘಟಿತ ವಲಯ, ಕಾರ್ಮಿಕ ವಲಯ ಮತ್ತು ಮನೆಗೆಲಸದಲ್ಲಿ ಹೆಣ್ಮಕ್ಳು ತೊಡಗಿಕೊಂಡಿರೋದ್ರಿಂದ ಇವರಿಗೆ ಕೆಲವೊಬ್ಬರಿಗೆ ಪೇಮೆಂಟು ಇಲ್ಲ, ಪೇಮೆಂಟ್ ಸಿಕ್ಕರೂ ಕೂಡ ಇವರು IT ಪೇಯರ್ಸ್ ಅಲ್ಲ. ಆದರೆ ಬೇಸಿಕಲಿ ಈ ಕ್ರಾಂತಿಯ ಮೂಲ ಉದ್ದೇಶ ಅಂತಂದರೆ ಹೆಣ್ಣು ಮಗಳ ಬೌದ್ಧಿಕತೆಯನ್ನು, ಅವಳ ಇಂಟಲೆಕ್ಚುವಲ್ ಕ್ಯಾಪಬಿಲಿಟಿಯನ್ನು ನಾವು ಹೇಗೆ ಅಸೆಸ್ ಮಾಡ್ತೀವಿ ಅಂತಂದರೆ ಜೆಂಡರ್ ಡಿಸ್ಕ್ರಿಮಿನೇಷನ್ನಲ್ಲಿ ಅಸೆಸ್ ಮಾಡೋದ್ರಿಂದ ನಾವು ಹೊರಗೆ ಬರಬೇಕಾಗಿದೆ. ನಮಗೆಲ್ಲ ಗೊತ್ತಿದೆ, ಕಾಸ್ಟ್ ಅನ್ಟಚಬಿಲಿಟಿ ಗೊತ್ತಿದೆ, ಆದರೆ ಕಾಲ ಹೇಗೆ ಸಾಕೊಂಡು ಬಂತು ಹೆಣ್ಮಗಳ ವಿಷಯದಲ್ಲಿ ಅಂತಂದರೆ ಇವಳು ಹೆಣ್ಣು ಅನ್ನೋ ಕಾರಣಕ್ಕೆ ಇವಳ ಬುದ್ಧಿ ಮೊಣಕಾಲು ಕೆಳಗೆ ಅನ್ನುವ ಶಾಸ್ತ್ರ ಇಟ್ಕೊಂಡು ಇವಳ ಬೌದ್ಧಿಕತೆಯನ್ನು, ಇಂಟಲೆಕ್ಚುವಲ್ ಅಬಿಲಿಟಿಯನ್ನು ನಾವು ಒಂದು ಅನ್ಟಚಬಲ್ ಅಂತ ಅಂದ್ಕೊಂಡು ಹೆಣ್ಣು ಅನ್ನೋ ಕಾರಣಕ್ಕೆ ಒಂದು ಪೂರ್ವಾಗ್ರಹ ಪೀಡಿತರಾಗಿ ನಾವು ಅದನ್ನು ಉಳಿಸ್ಕೊಂಡು ಬಂದಿರತಕ್ಕಂಥ ವಿಪರ್ಯಾಸದಿಂದ ಈಗ ಹೊರಗೆ ಬರಬೇಕಾಗಿದೆ. ತುಂಬ ಮುಖ್ಯವಾಗಿರ್ತಕ್ಕಂಥದ್ದು ಏನು ಅಂತಂದರೆ ಮಹಿಳೆಯರಿಗೆ ವಿಜ್ಞಾನ ಯಾಕೆ ಬೇಕು? ನಿಮಗೊಂದು ಇನ್ಸಿಡೆಂಟನ್ನು ನಾನು ಹೇಳ್ತೀನಿ. ನಾನು ತುಂಬ ಪ್ರೀತಿಯ ಮಹಿಳಾ ಸಾಹಿತಿಗಳು ಡಾಕ್ಟರ್ ಅನುಪಮಾ ನಿರಂಜನ್ ಅವರನ್ನು ನಾನು ನಿನ್ನ ವೇದಿಕೆಯಲ್ಲಿ ನೆನೆಸಬೇಕು. ನಮಗೆಲ್ಲ ಗೊತ್ತಿದೆ, ಶಿ ಈಸ್ ಅ ಗ್ರೇಟ್ ಗ್ಯಾನಕಾಲಿಸ್ಟ್ ಆ್ಯಸ್ ವೆಲ್ ಆ್ಯಸ್ ಎ ರೈಟರ್ ಅಂತ ಹೇಳಿ. ಅನುಪಮಾ ನಿರಂಜನ್ ತಮ್ಮ ಆತ್ಮಚರಿತ್ರೆ ನೆನಪು ಸಿಹಿ ಕಹಿಯಲ್ಲಿ ಬರೀತಾರೆ. ಅವರು ಏನಂತಂದರೆ, ಫಸ್ಟ್ ಅವರು CV ರಾಮನ್ ಅವ್ರನ್ನ ಭೇಟಿಯಾಗ್ತಾರೆ. ಭೇಟಿಯಾಗಿ ನಿಮ್ಮ ಲ್ಯಾಬಲ್ಲಿ ನನಗೊಂದು ಅವಕಾಶವನ್ನು ಕೊಡ್ರಿ ಅಂತ ಇವ್ರ ಜೊತೆಗೆ 3-4 ಜನ ಮಹಿಳಾ ವಿಜ್ಞಾನಿಗಳು ಹೋಗಿ ಕೇಳಿದಾಗ ದ ಗ್ರೇಟ್ ಸೈಂಟಿಸ್ಟ್, ನೋಬಲಿಸ್ಟ್ CV ರಾಮನ್ ಹೇಳ್ತಾರೆ, ಹೆಣ್ಮಕ್ಳು ಲ್ಯಾಬ್ನಲ್ಲಿ ಕಂಫರ್ಟೇಬಲ್ ಆಗಿ ಕೆಲಸ ಮಾಡಲಿಕ್ಕಾಗೋದಿಲ್ಲ. ಸಂಶೋಧನೆ ಮತ್ತು ಇಂತಹ ಎಲ್ಲ ಆವಿಷ್ಕಾರಗಳು, ಅನ್ವೇಷಣೆಗಳಲ್ಲೇನಿದೆ ಅಂತಂದರೆ ಪುರುಷನಷ್ಟು ಆಕೆ ಕೆಪೇಬಲ್ ಅಲ್ಲ ಅಂತ ಹೇಳಿ ತಮ್ಮ ರಾಮನ್ ಇನ್ಸ್ಟಿಟ್ಯೂಷನ್ನಲ್ಲಿ ಹೆಣ್ಮಕ್ಳಿಗೆ ಅಡ್ಮಿಷನ್ ಕೊಡೋದಿಲ್ಲ. ನೀವು ನೆಟ್ಟಲ್ಲಿ ಸರ್ಚ್ ಮಾಡಿದರೆ ಇದು ತುಂಬ ದೊಡ್ಡದಾಗಿರೋ ಕತೆ ಇದೆ, ಅದನ್ನು ಓದ್ಬೋದು ನಾವು. ಅಂದರೆ ದ ಸೋ ಕಾಲ್ಡ್ ರಾಮನ್ನಂತಹ ಒಬ್ಬ ಮೇಧಾವಿ ವಿಜ್ಞಾನಿಯ ತಲೆಯಲ್ಲಿನೂ ಕೂಡ ಏನಿತ್ತು ಅಂದರೆ ಹೆಣ್ಣು ಮಕ್ಕಳಿಗೆ ವಿಜ್ಞಾನ ಯಾಕೆ ಬೇಕು ಅಂತ. ಆದರೆ ತುಂಬ ಸಹಜ ಮತ್ತು ಸರಳವಾಗಿ ನಾವು ನೋಡೋದಂತಂದರೆ ಜೀವನದ ಪ್ರತಿನಿತ್ಯ ಹಂತದಲ್ಲಿನೇ ವಿಜ್ಞಾನಿಯೇ ಆಗಿರ್ತಾಳೆ ನಮ್ಮ ಅಮ್ಮ, ನಮ್ಮ ತಾಯಿ. ಹೆಣ್ಣಿಗೆ ಈ ನೇಚರ್ ಎಂಥ ಭಾಳ ದೊಡ್ಡ ಒಂದು ಕೆಪಬಿಲಿಟಿಯನ್ನು ಕೊಟ್ಟಿದೆ ಅಂತಂದರೆ ಆಕೆ ಹೋಗಿ ಪ್ರಯೋಗಾಲಯದಲ್ಲಿ ತನ್ನ ಸಂಶೋಧನೆಗಳನ್ನು ಮಾಡಬೇಕಾದದ್ದಿಲ್ಲ. ಆಕೆಗೆ ಕಿಚನ್ ಈಸ್ ಅ ವೆರಿ ಗ್ರೇಟ್, ಅವಳಿಗೆ ಅಡುಗೆ ಮನೆಯೇ ಬಹಳ ದೊಡ್ಡ ಪ್ರಯೋಗಶಾಲೆ. ಆಕೆ ಪಾಕಶಾಲೆನೇ ಆಕೆ ಪ್ರಯೋಗಶಾಲೆ. ಹೀಗಾಗಿ ಆ ಅಡುಗೆ ಮನೆಯಿಂದ ಆಕೆ ತನ್ನ ನಾಲೆಜನ್ನು ಹೇಗೆ ಜಗತ್ತಿಗೆ ನೀಡ್ತಾ ಬಂದ್ಲು ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ನಾವು ಕಾನ್ಸಂಟ್ರೇಟ್ ಮಾಡಬೇಕಾಗಿದೆ. ವೈಜ್ಞಾನಿಕ ಜೀವನ ಅನ್ನೋದು ನಮಗೆ ಪ್ರತಿ ಹಂತದಲ್ಲಿ ಮನುಷ್ಯನ ಜೀವನದ ಮೊದಲ ಆದ್ಯತೆ ಅನ್ನೋದನ್ನು ನಾವು ನೋಡ್ಕೊಂಡು ಬರ್ತಾ ಇರುವಾಗ, ಈ ಲಿಂಗಾಧಾರಿತ ಅಂದರೆ ಜೆಂಡರ್ ಡಿಸ್ಕ್ರಿಮಿನೇಷನ್ನಲ್ಲಿ ಒಳಗಾಗಿದ್ದಾಗ ಈ ಬೌದ್ಧಿಕ ಸಾಮರ್ಥ್ಯ, ಅನ್ವೇಷಣೆಗಳು, ಆವಿಷ್ಕಾರಗಳು ಇವೆಲ್ಲವುಗಳು ಕೂಡ ಇವತ್ತು ಮಹಿಳೆಯ ರಿಪ್ರೆಸೆಂಟೇಷನ್ ಕೊರತೆ ಎದ್ದು ಕಾಣ್ತಾ ಇರೋದನ್ನು ನಾವು ಸಮೀಕ್ಷೆಯಲ್ಲಿ ಗುರುತಿಸ್ಬೋದು. ಆದರೆ ಮೇರಿ ಕ್ಯೂರಿಯನ್ನು ನಾವು ನೆನಪಿಸ್ಕೊಂಡಾಗ ಆಕೆ ತನ್ನ ಜೀವಿತದ ಕಾಲದಲ್ಲಿಯೇ ಒಂದು ಲಿಜೆಂಡ್ ಆಗಿದೆ. ಯಾಕೆಂದರೆ ಯಾವ ಸೌಲಭ್ಯಗಳಿಲ್ಲದೆ ಆಕೆ ಮಾಡಿರ್ತಕ್ಕಂಥ ಪ್ರಯೋಗಗಳಿಗೆ 2 ನೊಬೆಲ್ಗಳನ್ನು ಪಡಿತಕ್ಕಂಥದ್ದನ್ನು ಗಮನಿಸ್ಕೊಂಡಾಗ ಇವತ್ತಿಗೂ ಕೂಡ ಫ್ರಾನ್ಸ್ ವಿಜ್ಞಾನ ಅಕಾಡೆಮಿ ಅವಳಿಗೆ ಎಂಟ್ರಿ ಕೊಡಲಿಲ್ಲ, ಮೇಡಮ್ ಮೇರಿ ಕ್ಯೂರಿಗೆ. ಬಟ್ ತನ್ನ ಮನೆಯಲ್ಲಿಯೇ ಆಕೆ ಒಂದು ಲ್ಯಾಬನ್ನು ಮಾಡಿಕೊಂಡು ಅಂಥ ಬಹಳ ದೊಡ್ಡ ಒಂದು ಆವಿಷ್ಕಾರವನ್ನು ಮಾಡಿರ್ತಕ್ಕಂಥ ಮೇರಿ ಕ್ಯೂರಿಯನ್ನು ನಾವು ಕಾಣಲಿಕ್ಕೆ ಸಾಧ್ಯ. ಮುಖ್ಯವಾಗಿ ನಾವು ಗಮನಿಸಬೇಕು, ನಾವೆಲ್ಲ ಕಾಡಿನಿಂದ ನಾಡಿಗೆ ಬಂದವರು, ಬೇಟೆ ಸಂಸ್ಕೃತಿಯಿಂದ ಬೇಸಾಯ ಸಂಸ್ಕೃತಿಗೆ ಬಂದವರು ನಾವೆಲ್ಲ. ಇದು ಬೇಸಿಕ್ ನಮಗಿರ್ತಕ್ಕಂಥದ್ದು. ಈ ಬೇಸಾಯವನ್ನು ಹುಟ್ಟು ಹಾಕಿದವರು ಯಾರು ಈ ಜಗತ್ತಿನಲ್ಲಿ ಅಂದರೆ ಅದು ಹೆಣ್ಮಕ್ಕಳು. ಇದು ಜಗತ್ತಿನ ಬಹಳ ದೊಡ್ಡ ಸತ್ಯ ನಮ್ಮ ಕಣ್ಣು ಮುಂದಿರ್ತಕ್ಕಂಥದ್ದು. ನಾವೆಲ್ಲ ಅನಾಗರಿಕರಾಗಿದ್ದಾಗಲೂ ಕೂಡ ಆ ಬೇಟೆ ಸಂಸ್ಕೃತಿಯಿಂದ ಬೇಸಾಯ ಸಂಸ್ಕೃತಿಗೆ ಬಂದು ಕೃಷಿಯನ್ನು ಪ್ರಾರಂಭ ಮಾಡಿರ್ತಕ್ಕಂಥದ್ದು ಯಾರು ಅಂದರೆ ಅದು ಮಹಿಳೆ. ಮೊದಲೆಲ್ಲ ಮೆಟ್ರಿಯಾರ್ಕಿಸಮ್ ಇತ್ತು, ನಂತರದಲ್ಲಿ ನಾವೇನು ಮಾಡ್ಕೊಂಡ್ವಿ, ಪೆಟ್ರಿಯಾರ್ಕಿಸಮ್ಗೆ ಬರೋ ಹೊತ್ತಿಗೆ ನಮಗೇನಾಗ್ಬಿಡ್ತು ಹೆಣ್ಮಕ್ಳಿಗೆ ಅಂದರೆ ಅಡುಗೆ ಮನೆ, ಹೆರಿಗೆ ಮನೆ. ಇದು 2ಕ್ಕೆ ನನ್ನ ನಾಲೆಡ್ಜು ಸೀಮಿತವಾಗಿಬಿಡ್ತು. ಅಡುಗೆ ಮನೆ, ಹೆರಿಗೆ ಮನೆ. ಈ ಒಂದು ಸಂದರ್ಭವನ್ನು ನೆನಪಿಸ್ಕೊಂಡಾಗ ನಾವು ಗಮನಿಸಬೇಕಾಗಿರ್ತಕ್ಕಂಥದ್ದು ಏನು ಅಂತಂದರೆ, ಎಲ್ಲ ಕ್ಷೇತ್ರಗಳಲ್ಲಿ ನಾಟ್ ಓನ್ಲಿ ನಾನು ಪಾಯಿಂಟ್ಔಟ್ ಮಾಡಿ ಇಂಥದ್ದೇ ಕ್ಷೇತ್ರಗಳಂತ ಹೇಳ್ತಾ ಇಲ್ಲ. ನಾವೆಲ್ಲ ಇವತ್ತು 21st ಸೆಂಚುರಿಯಲ್ಲಿ ಬದುಕ್ತಾ ಇದ್ದೀವಿ. ನಮಗೆ ಗೊತ್ತಿದೆ ಜಗತ್ತಿನ ಎಲ್ಲ ಆರ್ಥಿಕ ವಿಶ್ಲೇಷಣೆ ಮತ್ತು ಎಲ್ಲ ವ್ಯವಸ್ಥೆಗಳಲ್ಲಿ ಇವತ್ತು ಹೆಣ್ಮಕ್ಳು ತಮ್ಮದೇ ಆಗಿರ್ತಕ್ಕಂಥ ಕಾಂಟ್ರಿಬ್ಯೂಷನನ್ನು ನಮಗೆ ಕೊಡ್ತಾ ಇದ್ದಾರೆ ಅನ್ನೋದು ನಮಗೆ ಕಣ್ಣು ಮುಂದಿರ್ತಕ್ಕಂಥ ಸತ್ಯ. ಹೀಗಾಗಿ ತನ್ನ ಇಂಟೆಲೆಕ್ಚುವಲನ್ನು ಆಕೆ ಪ್ರದರ್ಶನ ಮಾಡಲಿಕ್ಕೆ ಆಕೆಗೆ ಸೂಕ್ತವಾಗಿರ್ತಕ್ಕಂಥ ವೇದಿಕೆಗಳು ಬೇಕಿತ್ತು. ಬಿಕಾಸ್ ಶಿ ಹ್ಯಾಸ್ ಸೆಲ್ಫ್ ಕಾನ್ಫಿಡೆನ್ಸ್ ಆ್ಯಂಡ್ ಆಕೆಗೆ ತನಗೆ ಗೊತ್ತಿದೆ ಅವಳ ಸ್ವಸಾಮರ್ಥ್ಯ ಇದೆ, ಅವಳಲ್ಲಿ ಕ್ಯಾಪಬಿಲಿಟಿ ಇದೆ ಅನ್ನೋದನ್ನು ನಾವು ಮೊಟ್ಟ ಮೊದಲು ಅರಿತುಕೊಂಡು ನಡಿಬೇಕಾಗಿರ್ತಕ್ಕಂಥ ಕಾಲದ ಘಟ್ಟದಲ್ಲಿ ಇದ್ದೀವಿ. ತುಂಬ ಬೇಸಿಕ್ ಆಗಿರ್ತಕ್ಕಂಥ ಸಬ್ಜೆಕ್ಟನ್ನು ನಾನು ನಿಮ್ಮ ಮುಂದೆ ಪ್ರಸ್ತುತಪಡಿಸ್ತಾ ಇದ್ದೀನಿ. ಏನಂದರೆ, ಮಹಿಳೆ ಮೂಲತಃ ಆಕೆ ಒಬ್ಬ ಹೋಮ್ ಸೈಂಟಿಸ್ಟ್, ಆಕೆ ಒಬ್ಬ ಗೃಹ ವಿಜ್ಞಾನಿ. ಎಷ್ಟು ಚೆನ್ನಾಗಿ ಚಾಕುಚಕ್ಯತೆಯಿಂದ ತನ್ನ ಕುಟುಂಬವನ್ನು ನಿಭಾಯಿಸ್ತಾಳೆ ಅಂದರೆ, ಆಕೆಗೆ ವಿಜ್ಞಾನ ಅನ್ನೋದು ಜೀವನದ ಒಂದು ಕಲೆ, ಆರ್ಟ್ ಆಫ್ ಲಿವಿಂಗ್. ನಮಗೆ 2 ಗೊತ್ತಿದೆ, ಆರ್ಟ್ ಆಫ್ ಲೀವಿಂಗ್, ತ್ಯಾಗ ಅಂದರೆ ಹೆಣ್ಣು, ಆರ್ಟ್ ಆಫ್ ಲೀವಿಂಗ್ ಎಲ್ಲ ತ್ಯಾಗ ಮಾಡೋದು ಆಕೆಗೆ ಗೊತ್ತಿದೆ. ಆ್ಯಂಡ್ ಶಿ ಈಸ್ ವೆರಿ ಪರ್ಫೆಕ್ಟ್ ಇನ್ ಆರ್ಟ್ ಆಫ್ ಲಿವಿಂಗ್ ಆಲ್ಸೋ. ಆಕೆಗೆ ಲೀವಿಂಗ್ ಎಷ್ಟು ಮುಖ್ಯನೋ ಲಿವಿಂಗ್ ಕೂಡ ಆ ಹೆಣ್ಣಿಗೆ ಅಷ್ಟೇ ಪ್ರಮುಖವಾಗಿರ್ತಕ್ಕಂಥದ್ದು. ಹೀಗಾಗಿ ನಮ್ಮ ಜನಪದರಿದ್ರಲ್ಲ, ನಮ್ಮ ಹಿಂದಿನ ತಲೆಮಾರಿನ ಹೆಣ್ಣು ಮಕ್ಕಳಿದ್ರಲ್ಲ, ಅವರೆಲ್ಲ ಎಷ್ಟು ಸಸ್ಟೈನೇಬಲ್ ಆಗಿದ್ರು ಅಂತಂದರೆ, ನಮ್ಮ ಜನಪದ ಗರತಿಯರು ಅಂತ ಕರಿತೀವಿ ಅವರನ್ನು. ಆ ಜನಪದ ಗರತಿಯರು ಎಷ್ಟು ಅದ್ಭುತವಾಗಿರ್ತಕ್ಕಂಥ ನಾಲೆಜ್ ಅವರಲ್ಲಿತ್ತು ಅಂತಂದರೆ, ತಾಯಿಯ ಎದೆ ಹಾಲಿನಲ್ಲಿ ಅಮೃತ ಇದೆ, ತಾಯಿಯ ಎದೆ ಹಾಲಿನಲ್ಲಿ ಮಗುವಿಗೆ ರೋಗ ನಿರೋಧಕ ಶಕ್ತಿ ಇದೆಯಂತ ನಮ್ಮ ಜನಪದ ಗರತಿಯರು, ನಮ್ಮ ಹಿಂದಿನ ತಲೆಮಾರಿನವರು 8 ವರ್ಷ ಹಾಲು ಕುಡಿಸ್ತಿದ್ರು ಮಕ್ಕಳಿಗೆ. ಇದೆಲ್ಲ ನಮ್ಗೆ ಗೊತ್ತಿರ್ತಕ್ಕಂಥ ವಿಷಯನೇ. 8 ವರ್ಷ, ನಾವೀಗ 1.5 ವರ್ಷ 2 ವರ್ಷ ಹಾಲು ಕುಡಿಸ್ತೀವಿ, ಆದರೆ 8 ವರ್ಷ ಆ ತಾಯಿ ಮಕ್ಕಳಿಗೆ ಹಾಲನ್ನು ಕುಡಿಸ್ತಾ ಇರ್ತಕ್ಕಂಥದ್ದನ್ನು ನಾವು ಗಮನಿಸ್ಕೊಳ್ತೀವಿ. ಇದ್ರ ಜೊತೆಗೆ ಯಾವುದನ್ನು ನಾವಿವತ್ತು ಸೋ ಕಾಲ್ಡ್ ಲ್ಯಾಬ್ ಟೆಕ್ನಾಲಜಿ, ಲ್ಯಾಬ್ ಸೈನ್ಸ್ ಅಂತ ಕರಿತೀವಿ, ಅದು ಯಾವುದು ಅವಳಿಗೆ ಅವಶ್ಯಕತೆ ಇರಲಿಲ್ಲ. ನಮ್ಮ ಪೂರ್ವಜರೆಲ್ಲ ಯಾವ ಒಂದು ಜಗತ್ತಿಗೆ ತೆರೆದುಕೊಳ್ತಕ್ಕಂಥ ನಮ್ಮ ನಾಗರಿಕತೆಯ ಪೂರ್ವದಲ್ಲಿನೂ ಕೂಡ ಹಾಲಿಗೆ ಹೆಪ್ಪಾಕಬೇಕು ಅನ್ನೋ ಸೈನ್ಸ್ ಇದೆಯಲ್ಲ, ಆಕೆ ಬಾಳೆ ಎಲೆಯನ್ನು ವೀಳ್ಯದೆಲೆಯನ್ನು ಹಾಲಿಗೆ ಹಾಕಿಡ್ತಿದ್ಲು, ಅದು ಹುಳಿ ಆಗದೇ ಇರುವ ಹೆಪ್ಪಾಗಿರ್ತಕ್ಕಂಥ ಮೊಸರಾಗ್ತಾ ಇತ್ತು. ಇದು ಕೂಡ ಒಂದು ವಿಜ್ಞಾನ ಆ ತಾಯಿಯಲ್ಲಿರ್ತಕ್ಕಂಥದ್ದು. ನಮಗೆಲ್ಲ ಗೊತ್ತಿದೆ, ಕೋವಿಡ್ ಬಂದು ಹೋದ್ಮೇಲೆ ಭಾರತೀಯ ಆಹಾರ ಪದ್ಧತಿಯ ಮೇಲೆ ಎಷ್ಟು ಫೋಕಸ್ ಆಯಿತು ಜಗತ್ತಿನಲ್ಲಿ. ದ ಇಂಡಿಯನ್ ಫುಡ್ ಕಲ್ಚರ್ ಅಂತ ಕರೆದ್ರು ಅದನ್ನು. ಕಲ್ಚರ್ ಅಂದರೆ ನಮ್ಮ ಉಡುಗೆ ತೊಡುಗೆ ಅಷ್ಟೇ ಅಲ್ಲ, ನಮ್ಮ ಜನಜೀವನ ಮತ್ತು ಫುಡ್ ಕಲ್ಚರ್ ಅಂತ ಕರೆದ್ರು. ಯಾಕೆ ಅಂದರೆ ಭಾರತೀಯರು ಬಳಸ್ತಕ್ಕಂಥ ಆಹಾರದ ವೈಜ್ಞಾನಿಕ ಪದ್ಧತಿ ಇದೆಯಲ್ಲ, ಇಟ್ಸ್ ವೆರಿ ಗ್ರೇಟ್. ನಮ್ಮ ಜನಪದ ಹೆಣ್ಣುಮಕ್ಕಳು ಕೆಮ್ಮು, ನೆಗಡಿ, ಜ್ವರ ಬಂದರೆ ಮನೆಯಲ್ಲೇ ಏನು ಮಾಡ್ತಾಯಿದ್ರು, ಅವರು ಹಸಿ ಶುಂಠಿಯನ್ನು, ಮೆಣಸನ್ನು ಮತ್ತು ಲವಂಗವನ್ನು ಬಳಸಿ ಕಷಾಯ ತಯಾರಿಸ್ತಿದ್ರು. ನಾವೆಲ್ಲ ಈಗ ಎಲ್ಲಿ ಬಂದಿದ್ದೀವಿ? ಮತ್ತು ಇದೇ ಸಿಸ್ಟಮ್ಗೆ ವಾಪಸ್ ಕೋವಿಡ್ ಟೈಮ್ನಲ್ಲಿ ನಾವು ಇದೇ ಸಿಸ್ಟಮ್ಗೆ ಮತ್ತೆ ವಾಪಸ್ ಬಂದ್ವಿ. ಅಷ್ಟೇ ಅಲ್ಲ, ಇನ್ನೊಂದು ನಮಗೆ ಗೊತ್ತಿರಬೇಕು, ಆ ಹೆಣ್ಣುಮಕ್ಕಳು ಹೊಲದಲ್ಲಿ ಕೆಲಸ ಮಾಡ್ತಾ ಇರುವಾಗ ಏನಾದರೂ ಪಟ್ನೆ ಗಾಯ ಆದರೆ, ಅವ್ರಿಗೇನಾದರೂ ತಮ್ಮ ಇದರಿಂದ ಹೊಡೆತ ಬಿದ್ದರೆ ಟೀಕಿ ತಪ್ಪಲ ಅಂತ ಬರ್ತದೆ. ಇದು ಭಾಳ ಜನರಿಗೆ ಗೊತ್ತಿರಬಹುದು, ಯಾಕಂದರೆ ಗ್ರಾಮೀಣ ಪ್ರದೇಶದಲ್ಲಿ ಹುಟ್ಟಿ ಬೆಳೆದವ್ರಿಗೆಲ್ಲರಿಗೂ ಗೊತ್ತು. ಆ ಟೀಕಿ ತಪ್ಪಲದ ರಸ ಹಚ್ಚಿಬಿಟ್ರೆ ಇಮ್ಮಿಡಿಯೇಟ್ ಗಾಯ ಮಾಯ ಆಗ್ತೈತಿ. ಈ ಒಂದು ಹೊಲಿಗೆ ಹಾಕಿದಂಗೆ ಆಗ್ಬಿಡ್ತೈತಿ ಕಟ್ಟಾಗಿದ್ದ ಪ್ರದೇಶ ಇದ್ರೂ ಕೂಡ. ಅಂದರೆ ಈ ನೇಚರ್ ಎಂತಹ ದೊಡ್ಡ ಅಮೂಲ್ಯವಾಗಿರ್ತಕ್ಕಂಥ ಔಷಧಿ ಗಿಡಮೂಲ್ಯಗಳನ್ನು ಹೊಂದಿದೆ ಅನ್ನೋದು ನಮ್ಮ ಹಿಂದಿನ ತಲೆಮಾರಿನ ಹೆಣ್ಣು ಮಕ್ಕಳಿಗೆ ಅದು ಗೊತ್ತಿತ್ತು ಅಂತ ಹೇಳಿ. ರಕ್ತ ಹೆಪ್ಪಗಟ್ಟಬೇಕು ಅಂದರೆ ನಂಜಿನ ಬೇರನ್ನು ಬಳಸ್ತಾ ಇದ್ರು, ಅಡುಗೆಯಲ್ಲಿ ಇಂಗು, ಅರಿಶಿಣಗಳನ್ನು ಬಳಸ್ತಾ ಇದ್ರು. ನಿಮ್ಗೆ ಇನ್ನೊಂದು ಇಂಪಾರ್ಟೆಂಟ್ ಹೇಳಿಬಿಡ್ತೀನಿ, ನಾವಿವತ್ತೆಲ್ಲ ಆಹಾರ ಕೆಡಬಾರ್ದು ಅಂತ ರೆಫ್ರಿಜರೇಟರನ್ನು ಬಳಸ್ತೀವಿ. ರೆಫ್ರಿಜರೇಟರ್ ಬಳಸೋದ್ರಿಂದ ನಮ್ಮ ಆರೋಗ್ಯದ ಮೇಲೆ ಏನು ಪರಿಣಾಮ ಆಕೈತೆ ಅನ್ನೋದು ನಮ್ಗೆ ಗೊತ್ತಿದೆ. ಆದರೆ ನಮ್ಮ ಹಿಂದಿನ ತಾಯಂದಿರೆಲ್ಲ ಏನು ಮಾಡ್ತಿದ್ರು, ಆಹಾರ ಕೆಡದಂಗೆ ಇಡಬೇಕು ಅನ್ನೋದಕ್ಕೆ ಒಂದು ಪಾತ್ರೆ ಮಾಡಿರ್ತಿದ್ರು ಅವರು. ಆ ಪಾತ್ರೆಯ ಒಳಗಡೆ ನೀರು ಹಾಕಿ ಯಾವ ಆಹಾರ ಕೆಡಬಾರ್ದು ಆ ಆಹಾರವನ್ನು ಅದರಲ್ಲಿ ಇಡ್ತಿದ್ರು. ಅವ್ರು ಆಗಿನ ರೆಫ್ರಿಜರೇಟರ್ ಅದು ಅವರಿಗೆ. ಅಂದರೆ ಈ ವಿಜ್ಞಾನ ಅನ್ನೋದು ಹೆಣ್ಣು ಮಕ್ಕಳಿಗೆ ಶತಶತಮಾನಗಳಿಂದನೂ ಕೂಡ ಅವಳಿಗೆ ಇನ್ಬಿಲ್ಟ್ ಅಂತ ಹೇಳ್ತೀವಲ್ಲ, ಅದು ವಿಜ್ಞಾನ ಅನ್ನೋದು ನನ್ನ ಲ್ಯಾಬ್ ಒಳಗೆ ನಾನು ಮಾಡ್ತಕ್ಕಂಥ ಆವಿಷ್ಕಾರಗಳು, ಸಂಶೋಧನೆಗಳು ಅದರೆಲ್ಲವೂ ಅಲ್ಲ, ಅವಳಿಗೆ ಬೈ ನೇಚರ್ ಕೊಟ್ಟಿರ್ತಕ್ಕಂಥ ಇನ್ಬಿಲ್ಟ್ ನಾಲೆಜ್ ಇದೆಯಲ್ಲ, ಶೀ ಈಸ್ ಬೈ ನೇಚರ್ ಶೀ ಈಸ್ ಓನ್ಲಿ ಅ ಸೈಂಟಿಸ್ಟ್ ಅನ್ನೋದನ್ನು ನಾವು ಅರ್ಥ ಮಾಡ್ಕೊಳ್ಬೇಕಾಗಿದೆ. ನಿಮ್ಗೆ ಇನ್ನೊಂದು ನೆನಪಿಸ್ಕೊಳ್ಬೇಕು, ನಾನು ಇವತ್ತು ದೇಶದ ಅತ್ಯುನ್ನತ ನಾಗರಿಕ ಪ್ರಶಸ್ತಿಯನ್ನು ಪಡೆದಿರ್ತಕ್ಕಂಥ ಸೂಲಗಿತ್ತಿ ನರಸಮ್ಮನ ಬಗ್ಗೆ ನೀವೆಲ್ಲ ಓದ್ಬೋದು. 20,000 ಹೆರಿಗೆಗಳನ್ನು ಮಾಡಿಸಿದಾಳೆ ಆ ತಾಯಿ. 98 ಇಯರ್ಸ್ ಬದುಕಿದ್ಲಾಕೆ, ಫ್ರೀ 20,000 ಹೆರಿಗೆಗಳನ್ನು ಫ್ರೀ ಮಾಡಿಸಿದಾಳೆ. ನಂತರ 98 ವರ್ಷ ಅವರು ಬದುಕಿದ್ರು. 2018ನಲ್ಲಿ ಅವರು ನಮ್ಮನ್ನು ಅಗಲಿದ್ರು ಕೋವಿಡ್ ಪೂರ್ವದ ಸಂದರ್ಭದಲ್ಲಿ. ಆಶ್ಚರ್ಯ ಅಂದರೆ ಆಕೆನೂ ಸಾಲಿ ಕಲ್ತಿಲ್ಲ, ಅವಳು ಯಾವ ವಿಶ್ವವಿದ್ಯಾಲಯದಲ್ಲೂ ಯಾವ PhD ಡಾಕ್ಟರೇಟ್ ಪದವಿ ಪಡೆದಿಲ್ಲ. ಅನೇಕ ವಿಶ್ವವಿದ್ಯಾಲಯಗಳು ಒಳಗೆ ಗೌರವ ಡಾಕ್ಟರೇಟ್ ಕೊಟ್ಟವು. ನಮ್ಮ ದೇಶ ಒಳಗೆ ಪದ್ಮಶ್ರೀ ಪ್ರಶಸ್ತಿ ಕೊಟ್ಟಿರ್ತಕ್ಕಂಥದ್ದನ್ನು ನಾವು ಇವತ್ತು ನೆನಪಿಸ್ಕೊಳ್ಬೇಕು ಈ ವೇದಿಕೆಯಲ್ಲಿ. ಅಂದರೆ ಆ ಸೂಲಗಿತ್ತಿ ನರಸಮ್ಮ ಯಾವ ದೈಹಿಕ ಶ್ರಮವಿಲ್ಲದೆ ಗರ್ಭಿಣಿಯರಿಗೆ ಸುಲಭದಲ್ಲಿ ಹೆರಿಗೆಯನ್ನು ಮಾಡಿಸ್ತಕ್ಕಂಥದ್ದನ್ನು ನೋಡಿದರೆ, ಅಷ್ಟೇ ಅಲ್ಲ, ಬಾಣಂತಿಯರಿಗೆ ನಮಗಿವತ್ತು ವಿಜ್ಞಾನ ಇದೆ. ನಾವೆಲ್ಲ ಇವತ್ತು ಅಲೋಪತಿ, ಹೋಮಿಯೋಪತಿ, ಬೇರೆ ಬೇರೆ ಔಷಧಿಗಳನ್ನು, ಆಯುರ್ವೇದ ಔಷಧಿಗಳನ್ನು ನಾವು ಬಳಸ್ತೀವಿ. ಬೇಗನೆ ನಾವು ವರ್ಕಿಂಗ್ ವಿಮೆನ್ಗಳಿದ್ದರೆ ಬೇಗನೆ ತಾಯಿ ಇದರಿಂದ ನಾವು ಬೇಗನೆ ಅದರಿಂದ ಹೊರಗೆ ಬಂದು ನಾವು ಡ್ಯೂಟಿ ಜಾಯಿನ್ ಆಗಬೇಕು ಅಂತಂದರೆ. ಆದರೆ ಈ ಪ್ರಕೃತಿ ಅನ್ನೋದು ಆ ಬಾಣಂತಿಯರಿಗೆ, ನಮ್ಮ ಹೆಣ್ಣು ಮಕ್ಕಳು ಮನೆಯಲ್ಲಿಯೇ ಇವತ್ತಿಗೂ ಕೂಡ ನಾವು ಸಂಪ್ರದಾಯವನ್ನು ಬಿಟ್ಟಿಲ್ಲ. ವಿಜ್ಞಾನ ಅಂದರೆ ನಾವು ತಿಳ್ಕೊಂಡಿರೋ ಪ್ರಕಾರ ಬಹಳ ದೊಡ್ಡ ನಮ್ಮಿಂದ ದೂರ ಇಟ್ಟಿರ್ತಕ್ಕಂಥ ಸೆಕ್ಟರ್ ಅಲ್ಲ. ನಾನಿವತ್ತು ಚಿನ್ವಾಲರ್ ಮೇಡಮ್ ಅವ್ರನ್ನ, ಇಲ್ಲೊಂದಿಷ್ಟು ಮಂದಿ ಎಲ್ಲ ಮಹಿಳಾ ಡಾಕ್ಟರ್ಸ್ಗಳನ್ನೆಲ್ಲ ನೋಡಿದೆ. ನನಗೆ ಟೀಚರ್ಸ್ಗಳ ಬಗ್ಗೆ ಒಂದು ಅಸೆಸ್ ಇತ್ತು. ಎಲ್ಲ ಡಾಕ್ಟರ್ಸ್ಗಳನ್ನು ನೋಡಿ ಮೇಡಮ್ ಹೇಳ್ತಾ ಇದ್ದೆ, ನೋಡ್ರಿ ನಾವೆಲ್ಲ IT ಸೆಕ್ಟರ್ನವ್ರ ಥರ ಯಾರೂ ಇಲ್ಲಿ ಇಂಥ ಭಾಳ ದೊಡ್ಡ ಫ್ಯಾಷನ್ ಬೇಲಾಗಿ ಮತ್ತು ಯಾರು ಸಂಪ್ರದಾಯವನ್ನು ಬಿಟ್ಟು ವಿ ಆರ್ ದ ಸೈಂಟಿಸ್ಟ್, ವಿ ಆರ್ ದ ಈ ಡಾಕ್ಟರ್ಸ್, ವಿ ಆರ್ ಅಂತ ಹೇಳಿ ಯಾರೂ ಇಲ್ಲ. ದೇ ಆಲ್ ಆರ್ ವೆರಿ ಕಲ್ಚರಲ್ ಮ್ಯಾನರ್ ಅಂತ ನನಗೆ ಭಾಳ ಸಂತೋಷ ಆಯಿತು. ಒಬ್ಬರು ಮೇಡಮ್ ಜಡೆ ಹೆಣ್ಕೊಂಡು ಬಂದಿದ್ದಾರೆ, ಎಷ್ಟು ಚೆನ್ನಾಗಿ. ಅಂದರೆ ವಿಮೆನ್ಹುಡ್ ಇದೆಯಲ್ಲ, ಈ ಮಾತೃತ್ವ ಇದೆಯಲ್ಲ, ಹೆಣ್ತನ ಇದೆಯಲ್ಲ, ಇದು ಈ ನೆಲ ನಮಗೆ ಕೊಟ್ಟಿರ್ತಕ್ಕಂಥ ಬಹಳ ದೊಡ್ಡ ಒಂದು ಅಫ್ಲಿಫ್ಟ್ ಅಂತ ನಾನು ಹೇಳಬಲ್ಲೆ. ಅದನ್ನು ನಾವು ಯಾವತ್ತೂ ಉಳಿಸ್ಕೊಂಡು ಬಂದಿದ್ದೀವಿ. ನಾವು ಯಾರೂ ನಮ್ಮ ಸಂಪ್ರದಾಯವನ್ನಾಗಲಿ ನಮ್ಮ ಹಿಂದಿನ ಯಾವ ಆಚರಣೆಗಳನ್ನಾಗಲಿ ಯಾವುದನ್ನು ಬಿಟ್ಟಿಲ್ಲ. ಅಂದರೆ ವಿಜ್ಞಾನ ಕ್ಷೇತ್ರ ಅನ್ನೋದು ಹೆಣ್ಣು ಮಕ್ಕಳಿಂದ ಯಾಕೆ ದೂರ ಇಡಲ್ಪಡ್ತು ಅನ್ನೋದಕ್ಕೆ ಅವಳು ಒಂದು ಹೆಣ್ಣು ಮತ್ತು ಅವಳ ನಾಲೆಡ್ಜ್, ಇದು ಎರಡನ್ನು ಮ್ಯಾಂಡ್ರೇಟ್ರಿ ಆಗಿ ಇಟ್ಕೊಳ್ಳೋದಾಗಿದ್ದರೆ ಇದನ್ನು ನಾವು ಒಪ್ಪಲಿಕ್ಕೆ ಸಾಧ್ಯ ಇಲ್ಲ ಅನ್ನೋ ಮಾತನ್ನು ನಾನು ಹೇಳ್ತಾ ಇದ್ದೀನಿ. ಇದರ ಜೊತೆಗೆ ಬಹುತೇಕ ಒಂದು 2 ನಿಮಿಷದಲ್ಲಿ ನನ್ನ ಮಾತನ್ನು ನಾನು ಮುಗಿಸ್ಬಿಡ್ತೀನಿ. ತುಂಬ ಗಮನಿಸಬೇಕಾಗಿರ್ತಕ್ಕಂಥದ್ದೇನು ಅಂತಂದರೆ ಇದನ್ನು ನಾವು ಮದರ್ಹುಡ್ಡನ್ನು ಜೈವಿಕ ಸಂಗೋಪನೆ ಅಂತ ಕರಿತೀವಿ ಕನ್ನಡದಲ್ಲಿ. ಇದನ್ನು ಹಾಗೆಯೇ ಅವಳಿಗೆ ಪಶು ಸಂಗೋಪನೆಯೊಳಗೂ ಕೂಡ ಗೊತ್ತು. ವಿಜ್ಞಾನ ಅಂದರೆ ನನ್ನ ತಿಳಿದ ಮಟ್ಟಿಗೆ ನಾವು ರಾಕೆಟ್ ಸೈನ್ಸ್ ಅಥವಾ ಲ್ಯಾಬ್ ಸೈನ್ಸ್ ಅಂತ ತಿಳ್ಕೊಂಡಿದ್ದೀವಿ, ಅದಲ್ಲ. ಆಕೆ ಮಕ್ಕಳನ್ನು ಹೇಗೆ ಪಾಲನೆ ಮಾಡ್ತಾಳೆ, ಪಶು ಸಂಗೋಪನೆಗಳನ್ನು ಕೂಡ ಮಾಡ್ತಾಳೆ. ಆಕಳ, ಕುರಿ ಇವುಗಳನ್ನೆಲ್ಲ ಜೋಪಾನ ಮಾಡಿ ಅದರ ಹಾಲನ್ನು ಮಕ್ಕಳಿಗೆ ಕೊಡ್ತಕ್ಕಂಥದ್ದು ಮತ್ತು ಹೈನುಗಾರಿಕೆಯನ್ನು ಮಾಡ್ತಕ್ಕಂಥ ಕಲೆ ಹೆಣ್ಣು ಮಕ್ಕಳಲ್ಲಿತ್ತು. ಇದರ ಜೊತೆಗೆ ಮುಖ್ಯ ಅಂತಂದರೆ ಅವಳೊಬ್ಬ ಕೃಷಿ ತಜ್ಞೆ. ಅವಳೊಬ್ಬ ಬೇಸಿಕಲಿ ಆಕೆ ಒಬ್ಬ ಕೃಷಿ ತಜ್ಞೆಯಾಗಿದ್ಲು. ಈ ಬೀಜವನ್ನು ಬಿತ್ತಿ ಮೊಳಕೆಯನ್ನು ಬರೆಸ್ಕೊಂಡು ಒಂದು ಕಾಳು ಬಿತ್ತಿ 1000 ಕಾಳುಗಳನ್ನು ಪಡ್ಕೊಳ್ತಕ್ಕಂಥ ನಾಲೆಡ್ಜು ಈ ಕೃಷಿ ಪ್ರಾರಂಭವಾಗಿರೋದು ಅದು ಹೆಣ್ಣು ಮಕ್ಕಳಿಂದ ಅನ್ನೋದನ್ನು ನಾವು ಕಾಣ್ಕೊಳ್ತಾ ಇದ್ದೀವಿ. ಹೀಗಾಗಲೇ ನಾವಿವತ್ತು 21st ಸೆಂಚುರಿಯಲ್ಲಿದ್ದೀವಿ. ಅದನ್ನು ಉಲ್ಟಾ ಮಾಡಿರಿ, 12th ಸೆಂಚುರಿ ಆಗತ್ತೆ. 12th ಸೆಂಚುರಿಯಲ್ಲಿ ನಮ್ಮ ವಚನಕಾರರು ಕೂಡ ಅಕ್ಕ ಮಹಾದೇವಿ ಅವಳ ಯೋಗಾಂಗ ತ್ರಿವೇದಿಯಲ್ಲಿ ಬರೀತಾಳೆ. ನಾನೊಂದು ಆರ್ಟಿಕಲ್ ಬರೆದಿದ್ದೀನಿ, ಅಕ್ಕ ಮಹಾದೇವಿ ಯೋಗಾಂಗ ತ್ರಿವೇದಿಯಲ್ಲಿ ಮನೋವೈಜ್ಞಾನಿಕ ವಿಶ್ಲೇಷಣೆ ಅಂತ. ಯೋಗಾಂಗ ಅಂದರೆ ಒಬ್ಬ ಯೋಗಪಟು. ಅಕ್ಕ ಮಹಾದೇವಿ ಒಬ್ಬ ಯೋಗ ತಜ್ಞೆಯಾಗಿದ್ಲು. ಆಕೆ ಹೇಳ್ತಾಳೆ, ಆಹಾರವ ಕಿರಿದು ಮಾಡಿರಣ್ಣ ಅಂತ ಹೇಳ್ತಾಳೆ. ಕಡಿಮೆ ಊಟ ಮಾಡಬೇಕು, ಜಾಸ್ತಿ ಶ್ರಮ ಹಾಕಬೇಕು, ದೈಹಿಕ ಆರೋಗ್ಯದ ಬಗ್ಗೆ ನೈಸರ್ಗಿಕ ಸಂಪನ್ಮೂಲಗಳನ್ನು ಹೇಗೆ ನಾವು ಬಳಸ್ಕೊಳ್ತೀವಿ ಅಂತ. ಅವಳೇ ತನ್ನ ವಚನದಲ್ಲಿ ನೆಲದ ಮರೆಯ ನಿಧಾನದಂತೆ ಅಂತ, ಭೂಮಿಯ ಒಳಗಡೆ ಕಲ್ಲಿದೆ, ಮಣ್ಣಿದೆ, ಅದರಲ್ಲಿನೇ ಬೆಲೆ ಬಾಳ್ತಕ್ಕಂಥ ಬಂಗಾರ ಇದೆ ಅಂತ ನಾವು ಈಗಿನ ಲ್ಯಾಬ್ ಸೈನ್ಸ್ನಲ್ಲಿ ಹೇಳ್ತೀವಲ್ಲ, ಅದನ್ನು ಆವಾಗಲೇ ಅಕ್ಕ ತನ್ನ ವಚನದಲ್ಲಿ ಬರೆದಿರ್ತಕ್ಕಂಥದ್ದನ್ನು ನೋಡ್ತಾ ಇದ್ದೀವಿ. ಹೀಗಾಗಿ ವಿಜ್ಞಾನ ಅಂತಕ್ಕಂಥದ್ದು ಮಹಿಳೆಯರಿಗೆ ಹೊಂದತಕ್ಕಂಥ ಕ್ಷೇತ್ರ, ಆವಿಷ್ಕಾರಗಳೆಲ್ಲ ಕೇವಲ ಮೇನ್ ಜಂಡರಿಗೆ, ನಮ್ಮ ಸಮಾಜದ ಮೊದಲ ಲಿಂಗತ್ವಕ್ಕೆ ಸಂಬಂಧಿಸಿರ್ತಕ್ಕಂಥದ್ದು ಅನ್ನೋದರಿಂದ ನಾವಿವತ್ತು ಹೊರಗೆ ಬರಬೇಕಾಗಿದೆ. ಇವತ್ತು ಭಾರತದ ವೈದ್ಯಕೀಯ ವಿಜ್ಞಾನ ಸಂಸ್ಥೆ ಅಬ್ದುಲ್ ಕಲಾಂಜಿಯವರು ಇದ್ದಾಗ ಮಹಿಳಾ ವೈಜ್ಞಾನಿಕ ವಿಂಗನ್ನು ಅವರು ಅಲ್ಲಿ ವಿಜ್ಞಾನದಲ್ಲಿ ಮಹಿಳೆ ಮತ್ತು ಮಹಿಳೆಗಾಗಿ ವಿಜ್ಞಾನ ಅಂತ ಹೇಳಿ 2011ನೇ ಸಾಲಿನಲ್ಲಿ ನಮ್ಮ ಮಹಿಳಾ ಯೂನಿವರ್ಸಿಟಿಯ ಕುಲಪತಿಗಳಾಗಿದ್ದರೆ ಡಾಕ್ಟರ್ ಗೀತಾ ಬಾಲಿಯವರು, ಒಬ್ಬ ಒಳ್ಳೆ ಸೈಂಟಿಸ್ಟ್ ಇದ್ದರು, ಅವರು ಕೆಮಿಸ್ಟ್ರಿ ಸೈಂಟಿಸ್ಟ್ ಇದ್ದರು. ಅವರು ಆಲ್ ಇಂಡಿಯಾ ಸೈನ್ಸ್ ಕಾಂಗ್ರೆಸ್ನ ಮಹಿಳಾ ಅಧ್ಯಕ್ಷರಾಗಿರ್ತಕ್ಕಂಥ ಸಂದರ್ಭದಲ್ಲಿ APJ ಅಬ್ದುಲ್ ಕಲಾಂ ಅವರನ್ನು ಇಟ್ಕೊಂಡು ಒಂದು ಬಹಳ ದೊಡ್ಡ ಕಾರ್ಯಕ್ರಮವನ್ನು ಮಾಡಿದಾಗ ನಮಗೆ ಬಹಳ ದೊಡ್ಡ ಒಂದು ಜಗತ್ತಿನಾದ್ಯಂತ ಒಂದು ಭಾರತೀಯ ಮಹಿಳೆಯರು ವಿಜ್ಞಾನ ಕ್ಷೇತ್ರದಲ್ಲಿ, ಅವಳು ವೈದ್ಯೆಯಾಗಿ, ಆನಂತರ ತನ್ನದೇ ಆಗಿರ್ತಕ್ಕಂಥ ರಾಕೆಟ್ ಸೈನ್ಸ್ ಆಗಿರ್ಬೋದು, ಎಲ್ಲ ಕ್ಷೇತ್ರದಲ್ಲಿ ಆಕೆ ಹೇಗೆ ತನ್ನ ಅಭಿವೃದ್ಧಿಯನ್ನು ಮಾಡ್ತಾ ಇದ್ದಾಳೆ ಅಂತ ಹೇಳಿ. ಇವತ್ತು ನಮಗೆ ಗೊತ್ತಿದೆ, ಭಾರತದ ಆಹಾರ ಸಂಸ್ಕರಣಾ ಪದ್ಧತಿ ಅಂತ ಯಾವುದನ್ನು ನಾವು ಕರಿತೀವಿ, ಅಲ್ಲಿ ಇವತ್ತು ಹೆಣ್ಣು ಮಕ್ಕಳು ಫುಡ್ ನ್ಯೂಟ್ರಿಷಿಯನ್ಸ್ ಅಂತ ಕರೀತಾರೆ, ಅವರನ್ನು ಫುಡ್ ನ್ಯೂಟ್ರಿಷಿಯನ್ ಸೈಂಟಿಸ್ಟ್ ಅಂತ ಕರೀತಾರೆ. ಅಂತಹ ಅನೇಕ ಹೆಣ್ಮಕ್ಳು ಕೆಲಸವನ್ನು ನಿಭಾಯಿಸ್ತಾ ಇರ್ತಕ್ಕಂಥದ್ದನ್ನು ನಾವು ನೋಡ್ತಾ ಇದ್ದೀವಿ. ಹೀಗಾಗಿ ನಮ್ಮ ಬಯೋಟೆಕ್ನಾಲಜಿಯಲ್ಲಿ ನಮ್ಮ ಭಾರತವನ್ನು ಪ್ರತಿನಿಧಿಸ್ತಕ್ಕಂಥ ಕಿರಣ್ ಮಜುಮ್ದಾರ್ ಅವರನ್ನು ನಾವು ಈ ವೇದಿಕೆಯಲ್ಲಿ ನೆನೆಸ್ಕೊಳ್ಬೇಕು. ಅದ್ಭುತವಾಗಿರ್ತಕ್ಕಂಥ ಅವರ ಒಂದು ಪ್ರಾಯೋಗಿಕ ಶಕ್ತಿ ಇದೆಯಲ್ಲ, ಅದು ಜಗತ್ತಿನಲ್ಲಿ BT ಸೆಕ್ಟರನ್ನು, ಬಯೋಟೆಕ್ನಾಲಜಿ ಸೆಕ್ಟರನ್ನು ಪ್ರತಿನಿಧಿಸ್ತಕ್ಕಂಥ ಒಬ್ಬ ಮಹಿಳಾ ವಿಜ್ಞಾನಿ ಆಗ್ತಾಳೆ. ಹಾಗೆ IT ಸೆಕ್ಟರನ್ನು ಪ್ರತಿನಿಧಿಸ್ತಕ್ಕಂಥ ನಮಗೆಲ್ಲ ಗೊತ್ತಿದೆ ನಮ್ಮ ಕರ್ನಾಟಕದ ಹೆಮ್ಮೆಯ ಪುತ್ರಿ ಸುಧಾಮೂರ್ತಿಯವರು. ಅವರು ಕೂಡ ಈ IT ಸೆಕ್ಟ್ರನ್ನು ಮುನ್ನಡೆಸ್ಕೊಂಡು ಹೋಗ್ತಕ್ಕಂಥದ್ದನ್ನು ನಾವು ಕಾಣ್ತಾ ಇದ್ದೀವಿ. ಹೀಗಾಗಿ ನಮಗೆ ತುಂಬ ಸಹಜವಾಗಿ ಸಾಮಾನ್ಯ ವೃತ್ತಿಯಿಂದ ಹಿಡ್ಕೊಂಡು ನೊಬೆಲ್ ಪುರಸ್ಕಾರವನ್ನು ಪಡಿತಕ್ಕಂಥ ಎಲ್ಲ ಕ್ಷೇತ್ರಗಳಲ್ಲಿ ಮಹಿಳೆಯರು ತಮ್ಮದೇ ಆಗಿರ್ತಕ್ಕಂಥ ಬಹಳ ದೊಡ್ಡ ಒಂದು ಕಾಂಟ್ರಿಬ್ಯೂಷನನ್ನು ಈ ವಿಜ್ಞಾನ ಕ್ಷೇತ್ರಕ್ಕೆ ನೀಡಿದ್ದಾರೆ ಅನ್ನೋದನ್ನು ನಾವು ಗಮನಿಸಲಿಕ್ಕೆ ಸಾಧ್ಯ. ಮೆರಿಟ್ ಪಾಡೀಹ ಬಿಫೋರ್ AD 2700 ಬಿಫೋರ್ ADಯಲ್ಲಿ ಜಗತ್ತಿನ ಮೊಟ್ಟ ಮೊದಲ ಮಹಿಳಾ ವಿಜ್ಞಾನಿ ಅಂತ ಗುರುತಿಸ್ಕೊಂಡಿರ್ತಕ್ಕಂಥವಳು ಈಜಿಪ್ಟ್ನ ಡಾಕ್ಟರ್ ಯಾರು, ಮೆರಿಟ್ ಪಾಡೀಹ ಅಂತ ಹೇಳಿ. ಅವಳು ಫ್ರೆಂಚ್ ವಿಜ್ಞಾನಿ ಆಗಿದ್ಲು. ಭೌತಶಾಸ್ತ್ರ ಮತ್ತು ರಸಾಯನಶಾಸ್ತ್ರದಲ್ಲಿ ಹೇಗೆ ಮ್ಯಾರಿ ಕ್ಯೂರಿ ಅವರು ತಮ್ಮ ಸಂಶೋಧನೆಗೆ 1935ನಲ್ಲಿ ಅವರು ನೊಬೆಲ್ ಪ್ರಶಸ್ತಿಗಳನ್ನು ಪಡೆದರು, ಹಾಗೆ ಅಂತಹ ಅನೇಕ ಹೆಣ್ಣು ಮಕ್ಕಳು ಈ ನಮ್ಮ ಕ್ಷೇತ್ರವನ್ನು ಪ್ರತಿನಿಧಿಸ್ತಾರೆ ಅನ್ನೋದನ್ನು ಹೇಳ್ತಾ, ಈ ಹೆಣ್ಮಕ್ಳು ಕೃಷಿ ಕ್ಷೇತ್ರದಲ್ಲಿಯೂ ಕೂಡ ಅದ್ಭುತವಾಗಿರ್ತಕ್ಕಂಥ ತಮ್ಮ ಜ್ಞಾನವನ್ನು ಇವತ್ತು ಅವರು ಜಗತ್ತಿಗೆ ನೀಡ್ತಾ ಇದ್ದಾರೆ ಅಂತ ಹೇಳಿ ನಾವೆಲ್ಲ ಮರೆಯೋ ಹಾಗಿಲ್ಲ. ಚಂದ್ರಯಾನದಲ್ಲಿ ಸಕ್ಸಸ್ಫುಲ್ ಆಗಿರ್ತಕ್ಕಂಥದ್ದು ನಮಗೆ ಗೊತ್ತಿದೆ. ಇದರಲ್ಲಿ ಹೆಣ್ಣು ಮಕ್ಕಳು ಕೂಡ ಸೈಂಟಿಸ್ಟ್ಗಳಾಗಿ ತಮ್ಮ ದೊಡ್ಡ ಸೇವೆಯನ್ನು ಸಲ್ಲಿಸತಕ್ಕಂಥದ್ದನ್ನು ನೋಡ್ತೀವಿ. ನಾನು ಕೇವಲ ಇಲ್ಲಿ ಕಲ್ಪನಾ ಚಾವ್ಲಾ ಅವರು ನಮ್ಮ ನಗಲಿದ್ದಾರೆ ಅನ್ನೋ ಕಾರಣಕ್ಕೆ ಅವರನ್ನು ನಾನು ಇವತ್ತಿಲ್ಲಿ ನೆನಪಿಸ್ಕೊಳ್ತಾ ಇದ್ದೀನಿ. ಅನೇಕ ಜನ ನಮ್ಮ ಹೆಣ್ಣು ಮಕ್ಕಳು ಈ ಸ್ಪೇಸ್ ಸೈಂಟಿಸ್ಟ್ಗಳು ಕೂಡ ಆಗಿರ್ತಕ್ಕಂಥದ್ದನ್ನು ನಾವು ಗಮನಿಸ್ಕೊಳ್ತಾ ಇದ್ದೀವಿ. ಹೀಗಾಗಿ 21st ಸೆಂಚುರಿಯಲ್ಲಿ ನಾವು ಪೂರ್ವಾಗ್ರಹ ಪೀಡಿತರಾಗಿ ಇವೆಲ್ಲ ಜೆಂಡರ್ ಇನ್ಡಿಸ್ಕ್ರಿಮಿನೇಷನ್ನಿಂದ ಹೊರಗೆ ಬಂದು ನಾವು ನಮ್ಮ ಇಂಟೆಲೆಕ್ಚುವಲ್ ಕೆಪ್ಯಾಬಿಲಿಟಿಯಿಂದ ಈ ಪ್ರಕೃತಿ ನೀಡಿರ್ತಕ್ಕಂಥ ಜ್ಞಾನದಿಂದ ಬೇಸಿಕ್ ಸೈಂಟಿಸ್ಟ್ ಯಾರಾದರೂ ಇದ್ದರೆ ಅದು ವಿಮೆನ್ ಅನ್ನೋದನ್ನು ನಾವು ನಮ್ಮ ತಾಯಿಯನ್ನು ನೋಡಿ ಕಲ್ತಿರ್ತಕ್ಕಂಥದ್ದು, ಒಬ್ಬ ತಾಯಿ ನಮಗೆ ಮದರ್ಹುಡ್ಡಲ್ಲಿ ಅನುಭವ ಕೊಟ್ಟಿರ್ತಕ್ಕಂಥದ್ದನ್ನು ಅನ್ನೋದನ್ನು ನಾನು ಹೇಳ್ತಾ ಇವತ್ತು ನನ್ನ ಕೊನೆಯ ಮಾತಿಗೆ ಬರ್ತಾ ಇದ್ದೀನಿ. ಕಾಲ ಬದಲಾಗಿದೆ, ಜಾಗತೀಕರಣೋತ್ತರ ನಮಗೆಲ್ಲ ಕಿವಿಯೊಳಗೆ ಬೀಳ್ತಿತ್ತು. ನಾವೆಲ್ಲ ಇವತ್ತು ಎಲ್ಲಿದ್ದೀವಿ ಅಂತಂದರೆ ನಾವು ಜಾಗತೀಕರಣ ಸಂದರ್ಭದಲ್ಲಿ ನಾವಿದ್ದೀವಿ ಅಂತಿದ್ವಿ. ಬಟ್ ಜಾಗತೀಕರಣ ಮುಗಿದು ಹೋಗಿದೆ, ಜಾಗತೀಕರಣೋತ್ತರದಲ್ಲಿ ನಾವಿವತ್ತು ಇದ್ದೀವಿ. ಹೀಗಾಗಿ ವಿಜ್ಞಾನ, ತಂತ್ರಜ್ಞಾನ, ಬಯೋಟೆಕ್ನಾಲಜಿ, ಸ್ಪೇಸ್ಗಳಂತಹ ಅನೇಕ ರಂಗಗಳಲ್ಲಿ ಹೆಣ್ಣು ಮಕ್ಕಳ ಪ್ರವೇಶಕ್ಕೆ ವಿರೋಧಗಳಿಲ್ಲ. ಇವತ್ತು ಅವಳಿಗೆ ತುಂಬ ಮುಕ್ತವಾಗಿರೋ ಅವಕಾಶ ಇದೆ. ಜಗತ್ತಿನ ನಾಲೆಜ್ ಹಬ್ಗಳಿವತ್ತು ಹೆಣ್ಮಕ್ಕಳಿಗೆ ವಿಶೇಷವಾಗಿರ್ತಕ್ಕಂಥ ಸ್ಥಾನಮಾನಗಳನ್ನು ಕೊಡ್ತಾ ಇದ್ದಾರೆ. ವೈದ್ಯ ರಂಗಕ್ಕೆ ಪ್ರವೇಶಿಸಿರ್ತಕ್ಕಂಥ ಭಾರತದ ಮೊದಲ ಡಾಕ್ಟರ್ ಆನಂದಿಬಾಯಿ ಜೋಶಿ ಅವರು ಎಂಥ ಸಂದಿಗ್ಧ ಸಂದರ್ಭದಲ್ಲಿ ಅವಳು ಓದಿದ್ಲು ಅನ್ನೋದನ್ನು ನೆನಪಿಸ್ಕೊಂಡು ಅಂತಹವರ ಜೀವನ ಚರಿತ್ರೆಯನ್ನು ನಾವು ಓದ್ತಾ ಇರುವಾಗ 1940ನಲ್ಲಿ ಇಂಜಿನಿಯರಿಂಗ್ ಕ್ಷೇತ್ರಕ್ಕೆ ಬರ್ತಾಳೆ. 1992ನಲ್ಲಿ ಆಕೆ ಒಬ್ಬ ಸೇನೆಯ ಬಾಗಿಲನ್ನು ತಟ್ತಾಳೆ. ವಿಜ್ಞಾನದ ಕೀಲಿ ಕೈ ಯಾರ ಕಡೆಗಿದೆ? ಹೆಣ್ಮಕ್ಳಲ್ಲಿದೆ. ಆ ನೇಚರ್ ಅವಳನ್ನು ಸಸ್ಟೈನೇಬಲ್ ಮಾಡಿರ್ತಕ್ಕಂಥದ್ದನ್ನು ನಾವು ಗಮನಿಸ್ಕೊಳ್ಬೋದು. ಗೃಹಿಣಿಯಾಗಬಲ್ಲವಳು ಗೃಹಲೋಕದಲ್ಲಿನೂ ಕೂಡ ಮಿಂಚಬಲ್ಲಳು ಅನ್ನೋದನ್ನು ನೆನಪಿಸ್ಕೊಳ್ತಾ, ಸಾಧನೆಗೆ ಅಸಾಧ್ಯವಾಗಿರ್ತಕ್ಕಂಥದ್ದು ಯಾವುದೇ ಇಲ್ಲ. ಆದರೆ ಲಿಂಗ ತಾರತಮ್ಯಗಳಿಂದ ಉಳ್ಕೊಂಡಿರ್ತಕ್ಕಂಥ ಆ ಮಾನದಂಡಗಳಿಂದ ನಾವು ಹೊರಗೆ ಬರಬೇಕಿದೆ. ಕೊನೆ ನನ್ನ ಒಂದು ಮಾತನ್ನು ಹೇಳ್ತೀನಿ. ತೊಟ್ಟಿಲವನ್ನು ತೂಗೋ ಕೈ ಜಗತ್ತನ್ನು ತೂಗಬಲ್ದು, ಹಾಗೆ ಅಂಗನವಾಡಿಗಳನ್ನು ಆಡಿಸುವ ಕೈ ಎಲ್ಲಿ ಹೋಗ್ಬೋದು? ಅಂತರಿಕ್ಷಕ್ಕೂ ಹೋಗ್ಬೋದು. ಪೊರಕೆ ಹಿಡಿಯುವ ಕೈ ಪಾರ್ಲಿಮೆಂಟನ್ನು ಆಳಬಹುದು ಅಂತ ಹೇಳ್ತಕ್ಕಂಥ ಮಾತನ್ನು ಎಲ್ಲ ನಾನು ನನ್ನ ಉಪನ್ಯಾಸದ ಮೂಲಕ ಹೇಳ್ತಾ, ಅವಳ ಮನೋಶಕ್ತಿ, ಮನೋಬಲ, ಒಂದು ನನ್ನ ಅನುಭವ ಹೇಳ್ತೀನಿ. ಹೆಣ್ಣು ಹಡಿದ್ಲು ಅಂತಂದರೆ ಹೇಳ್ತಾರೆ ಮನೆಯಲ್ಲಿ ಹಿರಿಯರು, ಅವಳೇನು ಹೆಣ್ಣು ಹಡ್ದಾಳು ಬಿಡು, ತಾಯಿನೂ ಗಟ್ಟಿರ್ತೈತಿ, ಮಗಳು ಗಟ್ಟಿರ್ತೈತಿ ಅಂತ ಹೇಳ್ತಾರೆ. ಅಕಸ್ಮಾತ್ ಆಕಿ ಗಂಡು ಹಡ್ದಿದ್ಲಂದ್ರೆ ಆ ಮಗುವಿಗೆ ಗಿಂಡಿಲೆ ನೀರು ಹಾಕ್ರಿ, ಗಂಡು ಹಡ್ದಾಳಕಿ ಕೂಸು ಚಂದ ಜೋಪಾನ ಆಗಬೇಕು ಮತ್ತು ಬಾಣ್ತಿನೂ ಚಂದ ಜೋಪಾನ ಆಗಬೇಕು ಅಂತ ಹೇಳ್ತಾರೆ. ಇದೆಲ್ಲ ನಮಗೆ ಗೊತ್ತಿರೋ ವಿಚಾರ. ಯಾಕೆ ಇದನ್ನು ಹೇಳ್ತಾ ಇದ್ದೀನಿ ಅಂದರೆ, ಬೈ ನೇಚರ್ ಗಂಡು ಮಕ್ಕಳಲ್ಲಿ ಆ ಒಂದು ಪ್ರಕೃತಿ ಕೊಟ್ಟಿರ್ತಕ್ಕಂಥ ದೈಹಿಕ ಸಾಮರ್ಥ್ಯಕ್ಕಿಂತ ಹೆಣ್ಣು ಮಕ್ಕಳಿಗೆ ದೈಹಿಕ ಸಾಮರ್ಥ್ಯ, ಆರೋಗ್ಯ ಈ ನೇಚರ್ ನಮಗೆ ಕೊಟ್ಟಿದೆ. ಅದನ್ನು ನಾವು ಉಪಯೋಗಿಸ್ಕೊಳ್ತಕ್ಕಂಥದ್ದನ್ನು ಕಲ್ಕೊಳ್ಬೇಕು. ನಮಗೆಲ್ಲ ಗೊತ್ತಿದೆ, ಕೋವಿಡ್ ಸಂದರ್ಭದಲ್ಲಿ ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್ ಆಗಿ ತೀರ್ಕೊಂಡಿರೋ ರೇಷೋ ಯಾರ್ದು ಜಾಸ್ತಿ ಇದೆ? ಗಂಡು ಮಕ್ಕಳದ್ದು ಜಾಸ್ತಿ ಇದೆ. ಹೆಣ್ಮಕ್ಳಿಗೆ ಈ ಹೃದಯ ಅನ್ನೋದಿದೆಯಲ್ಲ, ಮದರ್ಹುಡ್ ಅನ್ನೋದಿದೆಯಲ್ಲ, ಈ ಹೊಕ್ಕಳು ಬಳ್ಳಿಯ ಒಂದು ಬಹಳ ದೊಡ್ಡ ಒಂದು ಇದು ಇದೆಯಲ್ಲ, ಬ್ರಿಡ್ಜ್ ಇದೆಯಲ್ಲ, ಇಟ್ಸ್ ವೆರಿ ಗಟ್ಟಿಯಾಗಿರ್ತಕ್ಕಂಥದ್ದು. ಹೀಗಾಗಿ ವಿಜ್ಞಾನ ಅನ್ನೋದು ನಮ್ಮಿಂದ ದೂರದ ಕ್ಷೇತ್ರ, ನಮ್ಮನ್ನು ದೂರ ಇಟ್ಟಿರುವ ಕ್ಷೇತ್ರ, ನಾನು ಪ್ರವೇಶಿಸಿದ ಕ್ಷೇತ್ರ ಅಲ್ಲವೇ ಅಲ್ಲ. ಅದು ಮುಂಚೆಯಿಂದನೂ ಕೂಡ ಹೆಣ್ಮಕ್ಳು ಈ ಕ್ಷೇತ್ರದಲ್ಲಿ ತಮ್ಮದೇ ಆಗಿರ್ತಕ್ಕಂಥ ಕಾಂಟ್ರಿಬ್ಯೂಷನನ್ನು ಕೊಟ್ಕೋತಾ ಬಂದಿದ್ದಾರೆ. ಮುಂದೆ ನಮಗೆ ಜಗತ್ತು ಅವಕಾಶಗಳನ್ನು ತೆರೆದಿಟ್ಟಿದೆ, ಒಂದು ಹೊಸ ಇತಿಹಾಸವನ್ನು ನಿರ್ಮಿಸಬಹುದು ಅಂತ ಹೇಳ್ತಾ ನನಗೆ ಕೊಟ್ಟಿರುವ ನಿಗದಿತ ಸಮಯ ಮತ್ತು ವಿಷಯವನ್ನು, ನನ್ನ ಹೊಟ್ಟೆಗಿನ ಮಾತಂತ ಹೇಳ್ತಾರಲ್ಲ, ಒಂದಿಷ್ಟು ನಾನೇನೋ ನಿಮ್ಮ ಜೊತೆಗೆಲ್ಲ ಹಂಚ್ಕೊಳ್ಬೇಕಿತ್ತು. ಈ ಅವಕಾಶವನ್ನು ಕೊಟ್ಟಿರ್ತಕ್ಕಂಥ ಈ ಕಮಿಟಿಯ ಸದಸ್ಯರಿಗೂ ಮತ್ತು ಇವತ್ತಿನ ಚೇರ್ ಆಗಿರ್ತಕ್ಕಂಥ ಕವಿತಾ ಗುರುಮೂರ್ತಿಯವರಿಗೂ, ಹಾಗೆ ಸುಲೋಚನಾ ಚಿನಿಮಾಲರ್ ದಂಪತಿಗಳಿಬ್ಬರಿಗೂ ಕೂಡ, ಮತ್ತು ಎಲ್ಲ ಆರ್ಗನೈಸಿಂಗ್ ಕಮಿಟಿಯವರಿಗೂ ಕೂಡ ನನ್ನ ಹೃತ್ಪೂರ್ವಕ ಧನ್ಯವಾದಗಳನ್ನು ಸಮರ್ಪಿಸ್ತಾ ಇದ್ದೀನಿ. ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ.
Organized by Maitri, and I am honored to be a part of this function, and as well as chair the session of Dr. Maitri. Thank you, madam. It was an excellent talk. And before I just want to add, organize about women's success. They all commemorate and the difficulties what our ancestors have noticed about one lady who was a surgeon. She lived as a man her entire life. And it was only after her death they came to know that she was a woman, and that was how she continued to live her passion of surgery, and she performed surgeries and died as a man, but later they came to know it was a woman. It is the success of the difficulties of those women, and they have paved a way for us, and we have been doing well. And as you rightly pointed out, that women and science, they are not inseparable, and we are born scientists. And definitely thank you, madam, for that wonderful message. Thank you one and all.
ಭಾಳಷ್ಟು ಮಹಿಳೆಯರು ಅದರಲ್ಲಿ ಪಾರ್ಟಿಸಿಪೇಟ್ ಮಾಡಿ ಬಹಳಷ್ಟು ಅಭಿನಂದನೆ, ಮೋದಿಜಿಯವರಿಂದ ಭಾಳಷ್ಟು ಅಭಿನಂದನೆಯನ್ನು ಸಲ್ಲಿಸಿದರು. ನಾವು ಇವತ್ತು ಅವರಿಗೆ ಸಲ್ಯೂಟ್ ಮಾಡಬೇಕು. ಯಾಕಂದರೆ ವಿಜ್ಞಾನ ಯುಗದಲ್ಲಿ ಮಹಿಳೆಯರು ಕೂಡ ಇಷ್ಟೊಂದು ಸಕ್ರಿಯವಾಗಿ ಭಾಗವಹಿಸಿ ಶ್ರಮ ವಹಿಸ್ತಾ ಇದ್ದಾರೆ. ಊಟ ನಿದ್ದೆ ಇಲ್ಲದೇ ಸಾಕಷ್ಟು ರೀತಿಯಲ್ಲಿ ಶ್ರಮ ವಹಿಸ್ತಾ ಇದ್ದಾರೆ ಅಂದರೆ ನಿಜವಾಗ್ಲೂ ಅವರಿಗೆ ನಾವು ಸೆಲ್ಯೂಟ್ ಮಾಡಬೇಕು ಈ ಒಂದು ಸಂದರ್ಭದಲ್ಲಿ ಅಂತ ಹೇಳ್ತಾ.
ಇನ್ನೂ ಒಂದು ಮೊನ್ನೆ ಮಂಡನೆಯಾದ ಮೋದಿಜಿಯವರು ರಾಜಕೀಯದಲ್ಲೂ ಮಹಿಳೆಯರು ಸಕ್ರಿಯರಾಗಲಿ ಅಂತೇಳಿ 33% ನಮಗೆ ಆದ್ಯತೆ ನೀಡಿದ್ದಾರೆ. ಅದು ಕೂಡ ಸ್ವಾಗತಾರ್ಹ, ಶ್ಲಾಘನೀಯ.
Now I request Dr. Maitrini Madam to please accept a small token of appreciation from our side.
Thank you, madam. To reduce our carbon footprints of this conference to keep it as minimal as possible. The reason of being eco-friendly is also the Gangavathi art store, which have been where the materials have been made using banana fiber, which is totally eco-friendly and sustainable, and also the art which have been made by our Maitris. I request all delegates to just stroll to the store during the lunch break. As we break for lunch, let us get back together at 2:30 p.m. sharp, as we have few more speeches lined up, and we would not like to be late for the much awaited and the showstoppers of our event, the cultural programs. Thank you.
Want to make more money? Yes, that's what I thought. You got that right. Now you won't sleep through this session, because here we bring to you money matters. Interesting, right? Now I call upon our next speaker, Dr. Shilpa GB ma'am, to talk more on this topic, smart investments for self-employed women. I request Mrs. Rashmi Madhusudan to please escort Shilpa ma'am. Now I request Dr. Veena Satish. She's practicing OB-GYN at Channabaswaswamy Nursing Home, Gangavathi, to please introduce Dr. Shilpa GB ma'am. Thank you.
Good afternoon, everyone. I am feeling proud and privileged to introduce to you all my sister, Dr. Shilpa GB. She is an obstetrician and gynecologist, laparoscopic surgeon, infertility specialist. She is practicing at Bangalore. She completed her education starting from pre-nursery to MS OBG in Davangere. She also completed her diploma in reproductive medicine from Germany. She then completed her MS, then went on to do DNB and FIC MCH. Now she is a medical director of Shanti Shell Fertility Center and Bloom Women's Center, Bangalore. She has authored a book on diabetes in pregnancy, diabetes in obstetrics and gynecology in 2009. She is currently the chairperson of Kasoga Infertility Committee, and she has been the immediate past president of the prestigious Bangalore Obstetrics and Gynecological Society, and she was the youngest president of the society. I forgot to mention she was the gold medalist in MS OBG from Rajiv Gandhi University of Health Sciences. Now she is chairperson of Kasoga Infertility Committee, and a wonderful thing she is doing is she is running 3 WhatsApp group. Along with Dr. Jay Mehta, she's been spreading the knowledge to so many people all around Karnataka through her webinars. Their webinars start at night 10:30. They are so committed to teach people, and I'm really proud of her. Here I present the supremely talented, extremely hardworking, the beauty with brains, Dr. Shilpa GB, to you all.
So thanks, Vinaka, for that introduction. I hope I will be able to do justice for your time, especially after lunch. I know how difficult it is to keep our eyes open on Sunday after lunch. But I think this is something which everybody should know, and this topic is very close to my heart. I hardly accept any physical programs now if it is related to OBG and infertility. But finance, I think I have to create awareness with our doctor fraternity. So this one I could not refuse. Of course, the other reason is my sister Veena. So many people called me, told me that please don't cancel in the last few days. But I told them, no, this is something which I have to do. This is my, I think as a service to my fraternity, I have to give it back to everyone, because I know how hard it was for me for 2 years to learn this. So during COVID, this is what I was doing. I was studying like an exam going PG every day about this. So I think the mistakes that I have made, I don't want anybody else to make. So this is something which I think everybody should know today, that what you should not do rather than what you should do. So that is extremely important, because as doctors, I think we are the cream of the society. We are one of the most, I think, respected and also one of the most hardworking people of the society. So let me just take you through my presentation. So at any point in time, if you think you have any doubts or if you want to ask me, just make a note of it. I will try to answer my best in the end. So financial literacy, it is the ability to understand and effectively use various financial skills, including personal financial management, budgeting and investing.
So this financial literacy, now it is now called as personal financing, where it is a very individualistic thing, where each person's goals of dealing with their finances is very different. So what works for you may not work for your brother or sister. What works for you may not work for your friend, even though you may be practicing as a group practitioners. So it is a very, very personal thing which you need to understand. So it is not something which which is not like a blanket thing where it fits everyone. So this we should all disregard, or these are the myths about finance, that money is not important. We know how important money is, but yes, I mean to a certain extent. Beyond that, it doesn't make any difference. And rich people are bad. This is also something which is wrong. So rich people are not bad always. We can only give it back to the society when we have enough of it. So this is again another myth. Share market is gambling. This is also a myth. And finance is difficult. This is a very big myth, because doctors are the one who write the toughest exam in the world, probably the MBBS, CET, NEET, whatever it is. So finance is something which we should not outsource it to a agent who is not even like 10th pass or 12th pass. So if we make up our mind, if we give it enough importance in our life, then we will be better than anybody, any other professional in this. And another myth is it needs a lot of time. Yes, I mean, if we want to repair our mixer or a fan also will take a lot of time, but if we have the intention, if we have the mindset to safeguard our hard-earned money, then the time that we spend on it is worth it. We all know that our profession is a noble one, and we are extremely busy with our profession, and we are one of the most hardworking human beings on this earth. But there is so much information, there is so much of noise around you. So there is TV channels which are screaming, there are Telegram channels which are there to give you tips, there are so many other avenues wherein you get inputs which are not even required, and you all get confused. So what do we do, what do we not do, you don't know. So this is the most important slide, wealth creation. How do we create wealth? So what is our goal? The goal is to create wealth. So how do we create this wealth? So it is only through the right asset allocation. So if you know this slide today, if you understand this, then don't even listen to my presentation for the rest of it. You can please go to sleep peacefully. So this one, asset allocation, is extremely, extremely important, and this is the bottom line of my talk today, wherein I'm telling you to diversify your assets, diversify your money into real estate, into gold, into equity, and also into debt. Debt is like fixed deposits or bonds which don't have much risk. So it is the wealth creation is not about picking a stock. Wealth creation is not about like picking an FD, or wealth creation is not about mutual funds. Wealth creation is only about how you divide your money into all these four. So this gives you a heads up, or this gives you a lot of benefit over any other thing that you think. This is a very basic thing which we don't know, because people will hoard only gold, people will hoard only real estate, people will hoard only loads of equity or loads of FDs, which is not the right thing to do. Always diversify your assets into equal distribution or equal proportion depending on your mentality or on your mindset. So why do we need to know about finance? So professionally, we have better quality of work because we are not commercially driven to fleece patients or to do commercial things, and it gives a better patient care because you can work passionately about your profession rather than expecting monetary benefit out of it. So if you work with more passion, obviously the money is a byproduct. And you work towards well-being of the medical associations and colleagues selflessly if you are secure in your finances. If you are all the time worried about your finances, about your EMIs, about meeting the ends, about your future, about your retirement, then obviously, I mean, you will not have a peaceful life. There are so many things which will go wrong on a day-to-day basis, either with the patient care or with your colleagues. So having a secure finance is extremely, extremely important. And personally, it relieves the tension of building our net worth, time to perceive our passion, which may be like fitness, sports, spirituality, and it gives you a good family time, and also it gives you a better quality of life. So this is very important. So I see so many of my colleagues who are extremely good in art, who are so passionate about going to Himalayas, who are so passionate about trekking and all that, but because they don't have that comfort or that financial security, they are forced to work in medical field, and they are forced to work, say night shifts they work because they want to earn that extra money. Their quality of life is not so good. All the time they are under stress to meet the ends or to have that kind of income on a monthly basis. So this financial freedom, or what we call it as the financial security, gives you that edge over others, wherein you only work when you want to work. You only work with people who you want to work with. So that is the ultimate thing, wherein you are not forced to do anything which you don't like. So you don't like to treat one patient who you think may not be something which you want to do because of whatever reasons, because of the rapport, because of their being nasty. So if you are very clear about your finances, then you have the freedom to do whatever you want. So chase your dreams. Let money chase you. Never chase money. So the more you chase money, the more it runs away from you. So when to plan to diversify or to plan for the finances? Today. If it is the best day is today. Don't think, oh, Nifty was 10,000 10 years back. Now it is already 20,000. I don't want to invest at 20,000. If you wait for another 10 years, Nifty will be 35,000. So when is the best day to invest? The best day to invest is today. And time is the greatest compounder, and compounding, we know it is the 8th wonder of the world. If we understand the compounding, if we understand the time that the compounding gives, or the compounding that the time gives, it is one of the greatest awareness that you can have. So start early. As doctors, I know that we all start earning late. So by the time we finish our post-graduation, we'll already be around late 20s or early 30s, and then we want to try to do fellowships and all sorts of things, and then we want to establish practice. By the time we have established practice and we have enough money to invest, we'll already be in our late 30s or 40s. But at the same time, it is never too late. So we would have been working very hard during our MBBS and PG times, wherein we find it difficult to control our whatever urge to spend on things which we would have wanted to that time. So we kind of splurge on so many things after we start earning. But at the same time, you should have a fixed amount where you have to invest. So starting early is extremely important, and all of you should teach it to your children. So if they get 60,000 per month, once they finish their PG, they can't spend 80,000. They can't be swiping on their credit card. They can't be taking loans and making their expenses more than 30% of their income. So this, if you can teach your children, I think that is the biggest gift you can teach your children. You can give your children as parents. And everyone is running their own race at their own time. So Obama retired at 55 and Trump started at 70. So each one is different. We need not compare our colleagues with ourselves. We can't say that our colleagues, they have 10 sides, I have only this much. So there is no point in doing it. So we have our own journey. So everybody's journey is very different and unique. So what are the milestones in financial freedom? The first one is the passive income should be more than the annual expenses. So the one that you are earning through your medical profession is the active income. The passive income is the one which you make an alternative income where you don't have to work. It just keeps happening. So it could be just an FD where you earn interest. It could be some rentals that you have invested on a property and you're getting rentals. So it could be anything. So the second goal is the passive income should become more than the primary income. The third goal is to have the funds to survive 20 years without any active income. This is the ultimate financial freedom. So if you think that you will not work from today, and if you have enough backup for that, then you have had your financial freedom. So we should know first what is not investment. FD is not an investment. Ignorance policies like LIC is not an investment. It is only because they don't beat the inflation. So the inflation is around 6% now, wherein the cost of something goes on going up. See, the tomatoes will be like 10 rupees 5 years back, now it is 100 rupees. So it is the value of that money goes down as the time goes up. So this is an example for FD. So if you have 10,000 rupees as an FD, after 1 year with ROA of 7%, you get 10,700. The tax on 10% interest is 700 rupees, 70 rupees. So it will be 10,630. Inflation is 6 to 8%, and 637 rupees is gone in that. So after 1 year, what you get is 9,993. So the 10,000 value is going down to 9,993 by 7 rupees. That is only because of the inflation, which all of you should understand. I know as doctors, I know my parents, I know everybody who has loads of FDs, who are like, so happy that they have these many FDs, crores of FDs, and they're happy to receive that interest. But after 20 years, after 10 years, the value of that FD is definitely, it is not appreciating. Gold jewelry, I'll come to this a little later. I know I'm wrong being in the women's wing to tell this, but I will tell you why I'm telling this. So the true assets are the ones which can be sold easily, like FD, bonds, shares, gold coins, plots, lands. Okay, pseudo assets are the one like home, jewelry, furniture, and car. So people buy 50 lakh rupees worth car. They buy, I met a gynecologist like 2 months back who bought 1 crore worth diamond necklace for her daughter. I was like, ma'am, you should have spoken to me once before you bought it. So it's like, I feel like telling them, please read something on YouTube where they have given extensively as to what not to be done. And the second thing which is extremely important is the insurance. So insurance is an expense. So we should not waste our time to study the expenses. Insurance like life insurance, health insurance, car insurance, they should be a mandate. There is no alternative. You can't say that I don't have that insurance. You have to have that insurance, and whatever it is, like you may be 45 now, you may be 60 or whatever it is, you need to have it. Health insurance and term insurance is very, very important. And we should never mix the insurance and investment. Like LIC policies which come, like Jeevan Bima, whatever it is, like you go on putting like 10,000 every month, and then they say when you die, we will give it. So that doesn't work, because the returns in that will be only 3 to 4%, but the inflation is 6%. So it doesn't beat the inflation. So the value of your investment is gone. So never mix your investment with insurance. Insurance is an expense. Just take a policy, the best policy that suits you, and leave it at that. Don't mix it. So term insurance, health insurance, professional indemnity insurance, car insurance, travel insurance, these are a must. There is no alternative. There is no way that we can get away by not doing this. So where to invest? I think this is what everybody wants to know. This is, I think this slide is very important. This is about GRED, that is gold, real estate, equity and debt. So this is according to your age. So what should be the percentage of investment in gold, real estate, equity and debt? So if you are young, then your investment in equity has to be more. If you are old, then your investment in debt. Debt is the bonds and the FDs. That has to be more once you are older, because at that time you are not looking at creating wealth. When you are older, more than 60 years, you are looking at protecting your wealth. So wealth protection becomes more important after 60 years than wealth creation. So wealth creation is important for people who are young, who want a good returns for their money. So real estate, yes, the advantage is the rental income, capital appreciation, but the disadvantage is low liquidity and also a lot of hassles, lot of litigations, all those things that come along. But if you are a type of person who is into real estate, who enjoys, who knows how to do it, who likes to have all these the lateral problems that come along with it, then yes, definitely in India real estate is a good investment. But I am not the one who invests much into real estate, so I may not be the right person to tell you about real estate. So equity, yes, I mean this is one of the things which is very important because not many in India do it. Thinking that it is like gambling, it has a lot of risk. The advantages of equity is by diversifying the portfolio. It gives high liquidity and the long term returns are more. So Nifty, if you look at Nifty now, I mean people are shocked, like when they are thinking about recession, when they are talking about not the whole thing is going to crash and world is coming to an end. Now Nifty is at the all time high at 20,000. So equity is something which I personally suggest youngsters to read up about it, to know about it, at least be aware about it, and diversify your asset or allocate some amount, some percentage of your finance into it. So choosing stocks, it is a very high risk thing and it depends on the market condition. So choosing stocks, I would definitely not suggest unless you are really a pro in it and you have all the time. So equity is Nifty at this point in time, because Nifty is a very well diversified stock or pool of stocks, I can say. Nifty is the index, stock index. So how do we manage the risk in stock market? It is 3D, that is diversification, duration, minimum you should be invested for 7 years, and dip buying should be done more for the stocks like Reliance or ITC or Infosys. Whenever there is a fall, just keep buying and keep it. But you should be invested for more than 7 years to have good returns. So mutual funds, direct versus regular. Regular mutual funds are the ones that you do through the agent. Direct mutual funds are the ones that you do yourself through this Coin or Paytm or any of these direct portals. So if you do it as a regular, if you have invested 50,000 SIP per month for 30 years, and the invested value is about 1.8 crores. The final value is 22.7 crores at the end of 30 years. If you do it direct by yourself without any agent, without any commission, so it comes to 27.8 crores. So here nearly there is a difference of 5 crores. So this is a very simple thing wherein you can do the direct mutual fund investments. So all it takes is a little bit of knowledge about your the computer. So this is NSE website, this is Government of India website. So here you can see this is the simplest thing anybody can do, that you have a demat account. So there are various this thing like Zerodha or so many upstocks and so many things where you can open a demat account. They are stock brokers. So you just type Nifty Bees. Nifty Bees will tell you how the Nifty goes up. So the same thing will happen to the Nifty Bees. So this is Nifty Bees, that is the first 50 stocks which are large cap, that is with highest weightage in the Nifty. The second is the Junior Bees. Junior Bees is the next 50. So these are the top 100 companies of India. So you need not study about sitting there and studying about Reliance, sitting and studying about HDFC, sitting and studying about ICICI, knowing about TCS, Infosys, what happens, nothing. So if you know that you will do the Nifty, then all of this will automatically come with whatever the weightage is there in the index. So this 188 rupees is one. So you can, even if you have 200 rupees, you can still buy one Nifty Bee. So you can go on investing as SIP every month. You can fix a date and go on investing on Nifty Bees and Junior Bees. This itself will give you a good chunk of capital at the end of say like 7 years or 10 years. You need not break your head about choosing which stock to invest in. So coming to mutual funds. So mutual funds is like I'm not too much. So there will be investors who pool their money and they invest in securities. So that will generate the returns and it will be passed back to the investors. So there are so many mutual fund companies, mutual fund homes like HDFC Asset, there is Kotak, there are so many mutual funds which invest in multiple things, like they invest in large cap companies, they invest in small cap companies, they invest in debt. So many things will be there. So here the commission is about 1% of the asset and 10% of the profit. So this eats out a lot of your profit if it is a regular mutual fund. So never invest in a new mutual fund. If the mutual fund has been there for more than 5 years, that is the best thing to invest in because they have proved themselves with their returns. But the agent will come telling you with fancy names that this is a new one, this is excellent and all that, which is wrong. Invest in sectoral funds, like there are so many sectors, government sector, there is banking sector, there is IT sector. So avoid dividend and dividend, so this is a little more. So investing in regular funds is also good. So tell me where I'm going to die, so I don't go there. So you should know what not to do. So these are new fund offers, this sectoral, then there is growth funds which are good ones. Dividend option is not a good one. So direct, growth and open-ended. So closed-ended means you can take out the money only at the end of that term. That is closed-ended, like 3 years there will be a lock-in period, 5 years there will be a lock-in period. Otherwise you will lose out on the profit in that. They will cut 30% of the profit, 50% of the profit. So make sure that it is always open-ended fund, mutual fund. So these are the mutual fund platforms: Zerodha Coin, Grow, Kuvera, Paytm. So banks and brokers are not doing this. So direct plan and equity, that is ELSS mutual fund is there, large cap, mid cap, liquid funds. You can do it in a SIP mode, that is either you fix an auto mode where it goes on cutting every month at the same date, and it should be regular. You invest same amount every month and it should be consistently done. There is no need to run behind any fancy or hot named funds. So these are the category of mutual funds that you need to invest in. Index funds. Index funds, as I told you, Nifty index funds, multi-cap, large cap, ELSS. Debt mutual funds are liquid funds, which if we type liquid Bs, it will come. So these, if you want to know more, you can just type VRO tools on Google, it will come. So this is a graph which is important, which shows the FD versus gold versus equity. So as you can see, the FD is the lowest, the mid one is the gold, the top one is the equity, that is the stock market. So coming to gold. So this is, I think Indians are very fond of it, especially South Indians. You should just come to Jayanagar 4th block on a Sunday evening. So the jewelry shops are like, you will just know where you are standing when you just see the jewelry the shops over there. So gold is one of the assets for investment. Through ages, it has provided value, liquidity, and its average return of 8 to 10% have beaten inflation in long term. Yes, gold investment is very, very good, but not jewelry. So it's not gold versus Nifty. It is about gold and Nifty. So you should have both investments in gold and also in Nifty. So physical gold, yes, it may be in the form of certified coins. Yes, it is good, but not in jewelry. Price of gold is revised daily internationally based on the price declared by the London Bullion Association. So certified gold coins are very easy to buy. Minimal hidden charges can be redeemed against exact buying weight, and purity is guaranteed by certification. Jewelry is not an investment in gold. All men can feel happy about it, but women, I know, they will not like me after this. It is because it is mainly an expense. It is just a social status, especially during weddings, and at the cost of more essential necessities. Biggest lifeline for many rural families. This is important. This has been a biggest lifeline for many rural families who are uneducated, wherein for their emergency they use jewelry as their emergency fund. But one needs to be careful about purity and weight when they go for jewelry. So gold is good for diversification. There are so many non-physical form of gold like gold ETF and gold mutual funds, SGB, gold derivatives. So gold Bs, this is gold ETF. You should have a demat account. Just type gold Bs and it comes in the Zerodha, and you can start buying from there. Even if you can invest 10,000 also every month. So it has got good liquidity. It is easily saleable. So, but you will not be able to touch. So many people I see, even my mother, who wants to just keep seeing her jewelry every now and then and feel happy about it. So gold Bs versus SGB. SGB is better if you want to hold it till maturity, and the maturity is 7 years, 2.5 interest on the face value in addition to the appreciation of the price of the gold. Tax benefit on the maturity proceeds. That is, it is tax free. Whatever the appreciation is there, if we hold it till maturity, it is tax free. Gold piece is better if you want to sell it at your convenience, and it can be pledged for margin if you are doing FNO. So SGB, again I'm telling you, if you want to invest in gold, don't even see any of my previous slides, invest in SGB. So your bank or your broker, somebody will send you a message or an email saying that a new tranche of SGB has been released. Don't even think. Whatever money you want to invest in gold, just put it in gold. Don't worry, oh today it is 60,000, should I invest, not invest, I'll wait for next time. Next time it will be 62,000. So don't worry, just invest in SGB. This is the best appreciation that you will get in the form of like gold if you are a person who likes to invest in gold. And this is a gold bond. It's again a substitute for physical gold, but SGB has purchase limitation. Maximum is only 4 kgs. So I don't think any of us can, I think at one point in time, take 4 kgs of gold. So here we can buy it in commercial banks or post office, NSE. So maturity, as I told you, it is 8 years. 8 years and a lock-in of 5 years. So this is how we can buy SGB. So SGB, it's ideal if you are a long-term investor, if you are not selling it every now and then and making jewelry out of it. You can purchase in small quantity, and it is mainly for diversification of the asset. So you buy the bonds in the primary market and we can redeem it. So this is not important. So this is a comparison between physical gold, gold ETF and sovereign gold bond. Among these, sovereign gold bonds is very, very good. But if you are a person who want to touch and feel the gold and feel happy about it, then yes, biscuits or the gold coins are very good. So government bonds, it is also extremely good because they are safe. It gives you a fixed cash flow every year. So bonds, again, it is all about, I told you, asset allocation. These bonds fall in the debt category like FDs. So our safest custodian for our wealth is our government. So these are the bonds of the government that we are investing in. Banks can come under financial crisis, like how it happened with Yes Bank, wherein our FDs can go for a toss. But when you invest in bond, that time the government is responsible for it. So there is no chance that they can default. So the yield now is 7%. So as we know, the inflation is 6%. So this will beat the inflation, the G6. And there is a guarantee by the government. So this is how you buy it. So it opens every Tuesday and closes on Thursday. You just have to type T-bills on Coin Zerodha on the website. So this is how it looks. Bonds can be traded. FD cannot be. Yeah, I am done. So these 3 ways to buy bonds: in coin or in mutual fund, gilt mutual funds. So this is my thing where I have invested in this gold bonds. So this is about bonds, yeah. So the principles of investment is diversification, allocations. Senior citizens should reduce investment in volatile assets like equity and gold. They can keep more in debt. They can keep more in FDs. They can keep more in government bonds. And risk-averse person should have more in debt and less in equity. So equity is not a safe option for senior citizens. So the take-home message is: know yourself, what suits you. A big no to ignorance policy like LSEs, and no to agents. Insurance is not an investment, so just pay it. Don't attach that you will get back that money in some ways. It is not going to work. Always invest some part of your money into equity, because that is the biggest patriotism that you can show in your country, because you are investing in the companies where it will help in the economic growth of the country. And always invest in direct mutual funds and not in regular mutual funds. Yeah. So thank you so much. Thank you. I hope it was okay.
We could look at money from this moment onwards. I request the chairpersons to add the concluding remarks on the talk, if any.
A person like me, one more thing, who is not fond of the jewelries and anything. Thank you, and it was a very wonderful lecture, and it was a very wonderful lecture, and many of them are doing the false thing, keeping in the fixed deposit, and you have enlightened us very nicely, and it was your commendable job done by you. Thank you very much, ma'am. Thank you.
Like madam said, and the very best part of the talk was you have mentioned to diversify our investments. So that is very important in today's perspective, because you are not ending up in only one this thing. You know, sometimes one things fail and the other will click to you. So it's like you are managing that part. And like Madam said, I don't agree, but I like gold. I like physical gold. I don't like that certificate gold.
Then you should buy only the
So
coins.
that I don't agree with you.
Only the coins you should buy, ma'am. So I forgot one more thing.
Thank you.
Actually, women do very well in stock market because they are very conservative and they don't take risk. They don't want to multiply their money in 6 months. They don't want to double their money in 6 months, how men want to do it. So always, it has proven in the past so many years in the stock market that women always do well. So I encourage all women here, because they are the pillars of the family, that they also learn it and they teach it to their children, which will, I think, give a very good head start to their children, which is very, very important in this point in time for all our children to be self-sufficient and also to be independent when it comes to the finances.
Sadly for us, we are all still fighting to live. I call upon the chairpersons for this talk, Dr. Gangama K., practicing obstetrician and gynecologist at Balaji Maternity Hospital, Sirigupa. We welcome you, madam. And Srimati Shanta Kadi, madam, retired lecturer at M&M Government PU College, Gangavathi. We request madam to come over to the dais. The last talk for today, the topic is Save the Girl Child. For this, I call upon Dr. Shweta Sankanur to deliver this talk.
It gives me great pleasure to introduce Dr. Shweta Sankanur ma'am, our own IMA family member. Dr. Shweta Sankanur is a consultant anesthesiologist currently working as a clinical coordinator at Chirayu Critical Care Center, Gadag. She completed her MBBS at JNMC Belgaum and went on to complete her post-graduation in MD Anesthesiology in JJMC, Davangere. She has worked as a consultant anesthesiologist at Mahatma Gandhi Hospital, Gadag from 2013 to 2016. She joined as a trainee in the critical care department in Gopal Gowda Hospital, Mysore from 2017 to 2019. She currently is the coordinator at Chirayu Critical Care Center, Gadag. She has coordinated, monitored patient care and overseen quality assurance program to enhance the performance and efficiency. She has also managed the COVID. She completed her EDIC in November 2022. She is also a proud recipient of Vidyashri Award in 2023. Congratulations, ma'am. Here, Dr. Shweta Sankanur.
If we continue in the same manner, like what has happened in some of the states in India, what would the world look like? If none of us want to have a girl, all of us only want to have sons and only sons, so this is what is going to be like. So this is how it will be. It's a world filled with women with just one girl here, I think, in the corner, who was just born by mistake, I guess. Okay, so what is going to happen next? Can you imagine a world without women? I'm asking it openly, to the women and to the men, okay? What happens when there are no women? Imagine there are no women. What is going to happen is something like what happened in the Chayan village. This was in 2001. This was a village in Haryana. And can you guess the number of girls? It was only 18 girls for 25,000 men in the village. Can you imagine the state of those 18 girls? How safe were they? Were they even able to survive or even go out of their houses? Can you imagine 25,000 men ogling at you? It's like someone coming out from some other planet or an alien, okay? So that would be the situation of those 18 girls in those villages. Next slide. So that, sorry, just go back to the previous slide. So this was about Chayan village. And now what this map indicates is, it is the sex ratio of the various districts in India. The ones in the light blue are the ones which have a ratio of less than 800 to 1,000 men. The ones in the dark blue have a ratio of almost 1,000 to 1,000 women. And you can see that it's not an even distribution. You can see that it is different for different parts of the country. And it can be attributed to various aspects, which we'll be talking about later. Next slide. So this is what the world sex ratio is like. So many studies have been conducted, and it has been found that when we give nature its way, it is seen that there are usually more number of females than males. It is not only for the human race, it has been studied in many different animal populations as well. That is, generally the number of children born, females will be more than males. And that is what you get to see in many of the European, American countries. What you see is the ratio of males. Females is more than males. That is in blue. What is in red is where the males are more than females. And you can see that it is mostly in the Southeast Asian countries. And the ones in green are the ones which have a similar population. Next slide. So this is another alarming statistics which we have to keep in mind. This was, I got it only up to 2011. The red line denotes the overall sex ratio, irrespective of the line is the child sex ratio. That is the sex ratio of children between the age group of 0 to 6 years. And like you can see, it is much lower. Though the overall sex ratio is 943, the sex ratio of children in that age group is only around 918. That is, this is the future sex ratio. And it also denotes to what extent many activities like female feticide or infanticide is going on. Okay, next slide. So another statistics which I want you all to notice is, this is statistics in India from 1901 to 2001, within a period of 100 years. In 1901, what was noticed is women were 3.5 million lower than the male population, which increased to almost tenfold in 100 years. That is, there were 35 million fewer women compared to men. Thanks to the advent of technology, thanks to the advent of ultrasonography, thanks to the advent of liberal abortion laws, etc., this is what resulted. And according to Professor Amartya Sen, he's written a beautiful article called Missing Women, where he has statistically proven that in the Southeast Asian countries, over the past 100 years, almost, in the last century, almost 100 women have gone missing. That is, either they were not born at all, and even if they were born, they were killed within a few years. Okay, so this is the statistics which has been proven. Next slide. So when we let our daughters die, I would say we are inviting the end of the human race. So progressively, we are slowly eliminating the human race altogether. Why is that? Because as the number of, generally the number of, you can argue, you can say, okay, the number is not that staggering. What if the difference between the number of males and females is of 900 women for 1,000 men. So why are you worrying so much about it? It will take care of itself. It will run its natural course. You may say that, but many studies have been conducted. When the numbers are not so low, it is found that there is an increased chance of human trafficking. There is increased chance of abuse against women, violence against women. And we actually question, and we actually put the safety of the girls who are at present living, we put their safety at risk by killing the future girls. Next slide. The International Monetary Fund has conducted a study which states that the GDP of a country or the productivity of a country is best when the sex ratio in the workforce is 1:1. So this is a study which they have conducted. So by decreasing the number of women, we are actually decreasing the economic growth of the nation. So this is another interesting thing that has been happening in many of the northern states for the past few decades, from the 1990s onwards. What was seen is in states like Haryana, Uttar Pradesh, Punjab, the number of women has gone down so much that they could not find brides for their sons. So what did they do? They started buying brides from different regions of the country, from Kerala, Tamil Nadu, from northeastern states like Assam, Mizoram, etc. And they were all bought for a certain amount of money, and they were bought into the household. And they were called molki. Molki meaning you're paying some amount, mol, for the bride. So they were called molkis. And how were they taken into the families? The families had some 4 or 5 sons. And this woman would act as a wife for all of them. One. Second thing, she would do the work of a daily wage worker in the farms. She would be a maid. She would do all the work at home. And since she didn't know the local language, she was usually from a lower socioeconomic status. She was uneducated. She totally did not have any rights. And she didn't know whom to approach. Even if her modesty was, even if she was abused, even if she was ill-treated, she did not have anyone to go to. And I can't imagine what her life would have been like. And it wasn't just to one family. After a while, if she became a little older, these guys would again resell her to another family. And I read some instances in which a woman has been handed down like that through 7 families. And she is like now 50, 60 years old. She does not have anyone to take care of. I don't know how she could have survived the trauma. Maybe because she was a woman, she could do it. But it is like unimaginable. You can't even think. And can you imagine at what price these women are bought? Can anyone just guess? Yeah? They were bought for as low as 5,000 rupees, which is even lower than the rate of a cattle. And that is the respect we give to our women. I mean, where Durga, Kali, where Lakshmi, Saraswati and all are, like we pray to them and we give them so much of value only on the pedestal. But on the local grounds, the value of a woman is just reduced to 5,000 to 10,000 rupees. And there are many brokers who are actually living off these things. And because the families belong to a very low socioeconomic status, the women actually feel abandoned by their families and they don't have anywhere to go to it. So the other thing, recently in the election in Haryana, there was an election campaign slogan which said, Bahu Dilao or Vote Pao. So that is how it is. That is how bad the situation is. Next slide. It not only increases the violence against women, it also increases the violence against men. Men are also taken as soft targets. When the number of women are decreasing in the society, this is what happens. Next slide. So, you may ask, how did we reach here? It was by these 3 things that we have reached here. First, before the advent of ultrasound and technology, it was female infanticide. Many of the hospital doctors have given statements saying that the moment a daughter is born, the mother and the daughter would just go missing from the hospital, and the next day when you go back for a vaccination or something, the girl is not there at all. Either she's drowned in a tub of water, or she's put under a pillow, or she's just abandoned somewhere. That is female infanticide. The second thing, female feticide, which came about after the ultrasound came about and sex determination was happening at a very rampant rate. So selective abortions were taking place at that time. And next is female neglect. Even if she does grow up, usually what is the custom followed in many of the households is the men get to eat first, and only whatever is left, the women and the girls are fed. And they would again be fed very less, and if they fall ill, they are usually not taken to the hospital because again it is considered an expense. So what happens is female child neglect also gives rise to a lot of deaths among the girl children. Next slide. So there is one thing which I want you all to notice. What I want you all to know, female feticide, which we talk about so often and to such an extent, it is just a symptom. It is not the actual disease. So whatever the government does, it could be PCPNDT, it could be, Beti Bachao, Beti Padhao Andolan, or it could be any other thing, Sukanya Samriddhi Yojana, everything. That is all just symptomatic treatment. You know what the actual disease is, the actual cancer? It is that gender discrimination. It is that difference which we find. I think many of the speakers today have spoken about it. Dr. Shilpa spoke about it, and Madam also spoke about it. She said about gender discrimination. Women are always treated as second-class citizens. They're always considered second. A man or a male is considered the first person, and only then the female is considered. And if at all, if she is considered, that is. So that is the major disease. It is the disease that we have to eliminate from its root. Next slide. So who is responsible for the gender discrimination? It's all of us, each and every one of us. Next. And it is our society as a whole. So what is this society that we live in? It is mainly a patriarchal society where men are in positions of power and they take majority of the decisions. And also, there is a hint of misogyny in our society. What is misogyny? It is a sort of hatred or contempt for women. And this misogyny is present among women as well. Women themselves don't like other women. Women themselves don't respect other women. So, as long as that goes on, there is no way we can end this gender discrimination. So, this is what misogyny looks like. Imagine there is a boy kind of, hits on a girl or assaults a girl or molests her or something. So many of the people, the first question they ask is, what was she doing there? What was she wearing? What time of the day was it? Why was she there? But no one would ever question why did the boy do it? Why did he do that? What right did he have to do that? Irrespective of where she was, how she was, what she was doing. He does not have any right to do that to a girl. Next slide. So, what are the reasons? Why do we think like this? Why are we on automation where we keep blaming it on the woman always? It is because of the gender bias. When you think, like many of the speakers have told, they told about the Stone Age, the hunter-gatherers. So, during the age of hunter-gatherers, it was definitely the sex or the person who had better physical strength. He was the one who was going about and foraging for food, hunting for food and coming back. So maybe he had an upper hand. And since the women are definitely physically weaker and a little bit more fragile, and because we have to give childbirth, they felt that the women have to be protected within the confines of the house. So that was in Stone Age. But we still follow those things even now. Even now, though it is not the physical strength which is held supreme now. How do you think Joe Biden would do on would he last on a karate field or in even a fist fight with me? No, right? He is not physically stronger, but he is a male. Correct? So it is not the physical strength which actually determines in present day. It is actually your intellectual capacities, your creativity, your ability to solve problems. So that is not gender specific. That does not belong to any particular gender. I think any gender could do it. It could be male or female. But still we follow that physically stronger male is supreme than the physically weaker female. But the times were a little different in India. Like, as Madam mentioned once, that in the early Vedic and Tamil period, during that time, actually, women were given, status of importance. They were given decision-making power. Swayamvara was very in vogue at that time. They were given the freedom to choose their own life partner, and they were present in assemblies taking important decisions. So that was during the early Vedic age. And you can see many of the writers in Rig Veda are women. You can talk about Akkama Devi. There are so many instances like that. But then, what happened later on? Later on, with the external invasions, it could be the Persian invasion or it could be the Christian invasion into our country, where the women were put behind parda again. That was just to protect them, because they were known to, actually assault these women if they did not have a male guidance, etc. Next slide. So it is this mentality which has led to the preference of a son. And the reason when people are asked, why would you prefer a son? The usual causes, the reasons is: one, he can be a breadwinner. Two, he can take care of his aged parents when they are older. Three, you don't have to spend money on his marriage or dowry. But so men are considered to be bringing in money into the family, whereas women are considered to be the ones who take away the money from the family. That is, you have to pay for their upbringing, you have to pay for their marriage, you have to pay for the dowry, etc., etc. And then maybe later on also you have some responsibility towards them. So it all boils down to economics. So as long as the women are not able to make money, earn money, they will not be given the due respect which is due to them, irrespective of which gender they belong to. So I would tell, since all of y'all are independent women, you need to encourage more women to be economically independent. And some studies in US have conducted where men and women are equally economically independent. It was found that the daughters were found to take care of the older children, older parents in a better way. They were more acceptable to taking care of their parents than the male child. That is, when the girl child and the male child was given equal freedom and economic independence, it was found that the girls would come forward to take care of their parents. Next slide. And the other thing what I want you all to note is, sex is what you're born with at birth. That is, the difference is in what? XX, XY. The difference is in the reproductive organs and the endocrine system, the hormones to some extent. Other than that, every other organ is similar. May not be exactly the same. The brain, the heart, the lungs, the liver, the intestines, the kidney, everything else is the same. It is only the sex hormones and the sexual organs which are different. Okay? But what happens is, though we are born as boys and girls, the society actually attaches a lot of value to gender. The girls should be like this. The boys should be like that. Boys are not allowed to, boys shouldn't cry. They should act manly. Girls are supposed to be quiet. They should not talk loudly. They should not laugh loudly. They should be in the confines of the house. They should not play much outside. But boys, they cannot cry. They cannot express their emotions. And they cannot play with dolls, or they cannot play in the house. So we have a lot of these gender-based upbringing differences between the boys and the girls. Though boys and girls are different, but we actually make them a lot more different with our societal norms. Like they say, the men are from Mars and women are from Venus. I actually don't believe that. Believe there's an iota of truth also in it. It's like saying we are not even a part of the same species. It's like we don't even belong to the same planet. But I don't think that's true. What happens, the problem with gender is, it tells you how you should be. It actually doesn't see how you are. So that is what we need to change. So what is the solution to this? What can I do as a woman? I think the first and foremost thing is accept yourself, love yourself, be unapologetically female, okay? Accept your weaknesses, build in your strengths. Only when we do that can we accept the other women as well. So you can actually be both. You can be soft, but at the same time you can be strong. You can lead others, at the same time you can express emotions. You can be feminine, but at the same time be assertive. You can wear pink, at the same time you can wear blue. So let us not segregate the two into two actually totally different molds. And I want all of y'all to be feminists. There's a lot of negative connotation associated with feminism, but actually feminism is just the fight for a political, social equality among the sexes. It doesn't say that females are superior to males. It doesn't say that, it's not male hating. Totally, it is not that. And I want you all to get it out of your mind. And I want everyone here, not just the women, I want the men also to be feminists. And only then, only if all of us join our hands together, can things change. And I want the women to be more kinder towards each other. We've seen so many times, some group of women will be talking, and the moment someone leaves the group, you start, backbiting and talking bad about that person. I don't think that should happen. We have to be there for each other. We have to have each other's back. Only when we support each other, only when we are kind towards each other, can we form a group and actually fight for our cause. And there is something called as internalized misogyny. That is, they always tell you, okay, you're not like other girls, or I'm not like other girls. 5 minutes? Okay. We tend to think that. So we have to get rid of that feeling, You have to be more accepting of the other women, of the women kind around us. Next. And we have to be an ally for each other, have each other's back. It is said that girls compete against each other, but women always support each other. And we have to be vocal against sexism. Like I would say, I'll give an example for a sexist remark. Okay, I have 2 daughters, and any time I fell at the feet of an elder, the first blessing they would give me is, next time gand hadi. Okay, so So that is a sexist remark. Okay? Anything associated with a sex, or you can say women can't drive, they are bad drivers. That is a sexist remark. When you say girls can't do maths, that's a sexist remark. When you say, boys cannot be emotional, that is a sexist remark. Boys cannot be caring, that's a sexist remark. So be aware. What is a sexist remark? Anything that limits you based on your sex or your gender, that is sexist. So we need to see it, we need to recognize it. The thing is, it has been ingrained in us for so many generations. You must have heard, "Maine kya chudiya pehni hai?" That's also one. Me say the gando. So these are all sexist remarks which we need to recognize and we need to get rid of. Next slide. And I want to call all the men also to change this status. Why? You're privileged, men are privileged, you have the upper hand. But still, I want you all to change it. Why? Because Bell Hooks, actually she said it in one of her books, she said, though men are not oppressed or exploited by sexism, there are ways in which they suffer too. When we say, that's what, like I said, boys don't cry. And men are always discouraged from being emotional, showing emotions, being compassionate, being caregiving. These are all the things we don't encourage the boys. And we always tell them to keep proving their manhood by being aggressive, by being in the forefront. He may not want to do it, Next slide. So we teach the boys the small, and we put them in small cages of masculinity, and we let them have these fragile egos. So the moment some girls comes and tells them something, they feel their egos are hurt. It is just the fragile ego that they have developed because of their upbringing. Previous. I know you're in a hurry. 2 minutes. Okay, and what we teach the girls, we teach them, okay, you should behave in a certain way in front of a man. You should not try to be too smart. You should not try to be too intelligent. You have to hold yourself back. You have to shrink. That is what we're teaching the girls. We're telling them you should not speak in front of this group of men. You should be ambitious, but not much. Don't be too ambitious. Don't be too successful. It is not good. It's not good for your family harmony, etc., etc. And we teach the girl to compete against each other for a man's attention, which is again a very bad thing. You teach them to be competitive, but for something good. Let them learn. Let them cultivate themselves. Rather than for a man's attention, I think we should teach them to inspire themselves, inspire others. Next slide. Actually, my daughter, she had gone to a badminton class and the coach was scolding the boy, it seems. So she felt very offended. She came back and told me, "Mummy, he said that to the boy. Is that baigalanadu?" Antando. So these are the things that they get exposed to at a very young age, and this actually forms their thought process. Their brain wiring gets affected because of this. So why was I saying that men need to change too? Like you can see on the slide, this is the gender-based suicide rates. And you can see that the suicide rates among men is almost 3 times that of women. And one of the major causes for this is we don't teach men to share their feelings, to share their worries, to share their thoughts. I think they need to change. They need to accept that feminine side of them. And only then will they be free of the worries. We tell them the boy has to be the breadwinner of the family. So whatever said and done by hook or crook, he should get the bread on the table. In the sense, he should be the one earning money. So he goes through a lot of stress and he's unable to share this with anyone because it is a question of his manhood, right? Me se prashne. Next. So what I want to tell you all is, gender is not the two extremes. It is not the whole male and the female. It is a bit of a fluid in between. It's a spectrum. Whatever attributes we show, like the masculine, they should be physically strong. They should be confident. They should be the risk taker, etc. Non-emotional. And the girls should be pleasing. And they should be pretty. They should be emotional, etc., etc. So these are features which are present in both men and women. Okay, we need to cultivate our own in the sense, like whatever is suitable for us, whatever we are convenient with, whatever we are happy with, we should be free to cultivate that. Just because I'm a girl, I shouldn't be doing this. Or just because I'm a boy, I should not be doing this. So we should not be putting such restrictions on our children. Okay, so gender is a spectrum. I want you all to understand that. It is not the extreme. It is not the Mars and the Venus. All of us are on Earth only. Next slide. So according to mythology, when Brahma created the male and the female forms, he took both from the Shiva Shakti. from Shiva Shakti, he divided into the male and the female forms. So Shiva actually had both, the Shiva and the Shakti part. Likewise, all of us have some masculine traits and some feminine traits. And I don't think we should suppress some just because we're a boy or just because we're a girl. We should be able to cultivate as individuals. Idu Jedara Dasimaya or Vachana. He said so many centuries back, he said, Mole mudi bandede hennembaru, gadda meese bandare gandembaru. Naduve suluve atmanu, hennu alla, gandu alla kana, Manjunatha, Ramanatha. So this is what Jedara Dasimaya has said about the Atma in us. The gender and the sex is only for the body. The soul does not have any gender. So we should be free to be how we want to be. Next slide. So this is what the men can do. Let me just run through quickly. Open up yourself and be wholeheartedly accept yourself. Don't think I'm a man, I shouldn't be doing this, etc. Don't get defensive. This is one point which I want all the men to understand. When I say I want to stand up for women's rights, I'm not saying I'm going against the men. Please don't think that your chair is under, it's being threatened. No, what we are saying is we want to be right next to you. We don't want to be superior to you. We don't want to be inferior to you. We want to be next to you. And we're not going to snatch your chair and sit on it. So please don't be defensive. Okay, so the moment we say we want equal rights, we are not threatening you in any way. We are just fighting for ourselves. And speak up against sexism. I want you all to speak up too. So the next time, in case you have a son and a daughter, and you're telling something to your daughter, please think what you're telling. Notice whether you're being sexist yourself or someone else is being sexist against your children. So recognize that and speak up against it. Next slide. And you need to listen to women. When we say we want something, I'm not telling about jewelry and all that, but our own rights and, when we say that, I felt mistreated or unseen here, please look into it. Next slide. So this is what men shouldn't be doing. You cannot say, okay, gentlemen, next on the agenda. Should we give women equality? No, that is not something which you can give. It is something that is ours by birth and we just need to claim it. Next slide. So even Swami Vivekananda has said many years ago, he said that women will work out their destinies much better too than men can ever do it for them. All the mischief of women has come because men have undertook to shape the destiny of women. Next slide. So as a doctor, what can we do? I think we need to educate. I think you must be having so many instances. I would love to hear some stories from you all. Especially as gynecologists, you all must be experiencing it day in and day out. And I would be really happy to go through them. And that's one more point, I had mentioned it in a group sometime. Sometimes what I've noticed is when I used to go for LACS before, the doctor would ask the patient, "Yen magu ide amma modalne magu," before doing tubectomy. I think many of you all still do it, right? Yen magu ide anta. So automatically what the patient thinks is, okay, it is important for me to have a male child. That is why a doctor who is in that position is asking me whether I have a boy or not. Don't you think she will interpret it that way, right? So rather than that, the question should be, how old is your elder child? How healthy is your older child? Is it okay if I do a tubectomy now? I think those should be the questions rather than what sex is your older child or how many male children do you have. You don't ask it directly, but definitely you ask, "Yen magu ide modalnedu," right? So please don't do that. You're sending a wrong message. Next. So it's both the sexes. I hope it will happen in my daughter's time or my granddaughter's time or in my great-granddaughter's time. That is when we raise our daughters differently and we raise our boys also differently. And like Swami Vivekananda said, there is no chance of the welfare of the world unless the condition of the women is improved. And it is not possible for the bird to fly with one wing. Because men and women form the two wings of humanity and both of us have to fly together for humanity to succeed. And anyone wants to share something, please, if the...
Without addressing to the Save the Girl Child top female discrimination aspects at the school level, in all the sectors actually. So they are even only catching the doctors in the PCP and IT Act. So that has to be addressed in a broad way. So I thank Dr. Shweta Sankanur for having a good lecture in this. Thank you so much. And I thank Gangavathi members and the staff for giving me the opportunity, and they have pleased to accept your this one. Thank you so much.
And I would like
Madam,
to thank
just a word.
for giving me this chance. Thank you.
Just a word. I am Dr. Annadani Meti, past president of IMA Karnataka State and the proud father of 2 lady doctors. What Dr. Sweta Sangnur said is exactly right. I request her to prepare such a slide in Kannada so that it can be emailed to all our IMA branches. What we need to do is bring out awareness among the community, not the doctors. We are aware of it. PCPNT has got a lot of changes in changing the sex ratio. Request her to do this one. PCPNT has got a lot of clerical works. Actually, instead of, it is a good one, but it is burdened with a lot of clerical works for doctors. That's all.